I want to just make this announcement. This board meeting is being live streamed for the convenience of the public at www.okaloosaschools.com. The public may participate in the public comment portions of the meeting by either personal attendance or by calling the school board meeting public participation phone line. A separate seating area has been set aside for the press and public who are in attendance at the meeting in accordance with social distancing guidelines as provided by the Centers for Disease Control and Prevention. If calling into the meeting, you should call 850-833-3100. The phone lines will be operational beginning at 6 p.m. on the night of the board meeting, and callers will be transferred into the board meeting during the public hearing portion of the meeting only in the order in which calls are received. If you are calling into the meeting to make public comment, please be patient as there may be a wait time, and tonight there will be a wait time while being transferred into the meeting. So with that, I need a motion to approve the agenda.
So moved, Chairman.
Mr. Destin, hello, Dr. Kelly. We're approving the agenda. Mr. Destin has made a motion. Do I have a second?
I'll second it.
Ms. Ivanchek makes a second. Any discussion? Hearing none. Ms. Ivanchek, how do you vote?
Yes.
Dr. Kelly, how do you vote?
Yes.
Dr. White, how do you vote?
Yes.
And Mr. Destin, how do you vote?
Yes.
And I vote yes, and the motion carries 5-0. So now we are down to discussion agenda 3.1, emergency school board policies 01-29, face coverings during COVID-19 pandemic emergency, recommended by the superintendent for approval. This policy is intended to promote and contribute to a healthy and safe school environment and to minimize the spread of COVID-19 in an effort to keep school buildings open and students and employees in an effort to keep school buildings open and students and employees in attendance. So, Mr. Chambers, I believe you would like to start off tonight.
Thank you, Mr. Bryant, and I just thank the board as well. First of all, what I would like to say, just to start off with, is I would just like to thank our parents. I would like to thank our employees. I would like to thank the public. And what I mean by that is the fact that, so many have given input into this decision as it applies to the requirement of masks. And I think, just like I've shared with many families who I've responded back to, whether it be by email or by phone, is I very much appreciate, and I know that you, the board, does as well, is when we have people being a part of the process and being a part of the solution. And I think when we can do that, even though there could be, a disagreement, so to speak, but when you can be a part of the solution, I think that is what we want here at Okaloosa County each and every day. I do want to just take us back just a little bit. As you know, we had a reopening schools plan, and in that reopening schools plan, what we had was, as it pertained to masks, is that they would be strongly encouraged. But what I know that I have said, and that we've even said in our board meetings, is we would continue to monitor the situation, and as time went by and as we got closer to the start of school, we would make a decision at that time. And I know that myself, just as well as you as board members, you've had people reach out to you probably over the last 6 weeks, 8 weeks, as it pertains to masks and what the stance should be. And I think we all know that we have people on both sides of this issue, so to speak. But we did do what we said we would do, is continue to take input from our parents, from our employees, and from the community. And I think we know last Thursday at the board workshop, because I know that there's been some discussion amongst the board at board meetings in terms of a requirement or just even conversations about the possibility of a requirement as it pertains to masks. So last Thursday's board meeting, I know we had a good conversation. I asked the board kind of which direction would we like to go in this matter. And I think we had a good, healthy discussion. And I think at the end of that meeting on Thursday's board workshop, it was clear to look at some type of a requirement where masks would be required, where social distancing could not be maintained. That weekend, I think each of you, I know I did, received input from families, from employees, and we ended up making a revision to the policy. That revision was an opt-out policy for families. And so we did do that. And tonight, you will see two very small revisions as well, and Mr. McGinnis will go through that. One of the revisions deals with band, where our band directors asked us to make a small tweak, which we did. And then the other revision, which is the second one, deals with the buses. We, on the bus, masks will still be required due to the distance that the kids would be so close to each other. So we just wanted to be sure that this policy as written didn't get in the way of that intent in terms of masks being required on the bus. So I just want to wrap up my portion, and then Mr. McGinnis is going to go through this policy. But once again, to me, this is healthy, and it's always healthy when you have individuals who are willing to give input and be a part of the process and be a part of the solution. So I do appreciate our employees, our parents in the community who are letting their voice be heard on this issue. So I just thank you. Mr. McGinnis?
Yes, sir, Mr. Superintendent, board members. I've been asked to review the policy. I'm not reading the policy verbatim. I will go through and highlight the sections of the policy. It starts out with a preamble that sets the legal basis for this policy. One item being that the state of Florida has been under a declared state of emergency as a result of COVID-19 pandemic since March of 2020. It also states in the preamble that the emergency policy intended to promote and contribute to a healthy and safe school environment and to minimize the spread of COVID-19 in an effort to keep school buildings open and students and employees in attendance. The first section of the content of the policy deals with wearing of face coverings. And what's important to understand about this policy is that the requirement here to wear face coverings starts clearly saying that only at those times when social distancing of at least 6 feet between individuals is not possible, when on or inside any property owned, leased, or operated by the school board. So that's the standard you start out with on this policy, that with the exceptions that are laid out, students, employees, visitors, vendors, and other persons are expected to comply with the CDC guidelines regarding wearing a mask or face coverings when social distancing is not possible. The policy goes on to say that all individuals subject to this policy are encouraged to provide their own face coverings that comply with this policy. The school district will maintain emergency supplies of disposable or other new face coverings so that no student, staff member, or other person will be in a position where they will not have access to a face covering. And let me clarify my words about the wearing of them. The policy says they must comply with the CDC guidelines when social distancing is not possible. The policy goes on to require that persons shall have face coverings with them at all times while they're on school district property. The policy provides that in the event the CDC guidelines significantly change during the effective period of this emergency rule, the school board delegates authority to the superintendent to modify compliance requirements in accordance with the guidance from public health officials. We then move into a definitional section for defining face coverings, and the policy provides that face coverings must cover both the mouth and nose completely and fit snugly against the sides of the person's face and under the chin with little or no gaps. It goes on to describe the acceptable materials that face coverings can be made of. It provides examples of acceptable face coverings. It provides examples of unacceptable face coverings. It provides that all face coverings must comply with school dress codes. We then move into the section on exceptions. And so remembering that the standard of the policy is that you must wear a face covering in accordance with CDC guidelines when social distancing cannot be maintained, these would be exceptions. One is for pre-K, kindergarten, and specialized student populations. Students in pre-kindergarten, kindergarten, and students in ESE self-contained classrooms and at ESE center schools may not be able to utilize face coverings to the same extent as other classrooms. Thus, the policy provides that strict application of the policy is not required for those students, but teachers and other employees are encouraged to encourage the students to use face coverings. Students with intellectual and developmental disabilities, mental health conditions, or other sensory sensitivities may have challenges wearing a face covering. It is therefore recommended to consult with their healthcare provider for advice about wearing face coverings. The next exception deals with very young children, providing that face coverings are not required for children 3 years of age or less than 3 years of age. The next exception deals with face shields in certain circumstances. While the policy recognizes that there is currently not enough evidence from the CDC to recommend face shields as a substitute for face coverings, wearing face shields may not be feasible, wearing face covering may not be feasible in every situation, especially for persons who are deaf of hard of hearing or those who care for or interact with a person who is hearing impaired. While face shields are less effective than face coverings, as defined above, usage may be indicated in some circumstances. So face shields as defined in the policy may be used in these scenarios as a possible accommodation under the ADA or Section 504, where appropriate medical professionals have certified in writing the person has a qualifying reason that would prevent them from being able to safely wear a face covering, where staff or students have an instructional or communicative reason for showing or viewing another's mouth, such as during phonetic instruction, or for students who are hearing impaired and need to see facial movements, and in other situations on a case-by-case basis when it is determined that it's in the best interest of the person seeking permission to wear the face shield. The next exception is for face covering breaks. The policy provides that schools will provide students with opportunities for breaks where they can remove their face covering while maintaining appropriate social distancing, and under these circumstances, employees may also periodically take a face covering break. The next exception deals with eating and drinking and provides that face coverings are not required while someone is actively eating or drinking during planned meal times. The next exception covers strenuous physical activity and provides that coverings are not required during times when persons are engaged in strenuous physical activity, whether inside or outside of the school buildings. The next category deals with musical performances, and this is an area, as the superintendent mentioned, where there is a recommendation for a slight adjustment tonight. This provides that a face covering with a small slit for mouthpiece access will be required for any student, employee, or visitor while playing certain musical instruments indoors as specified by the band director. And that is the revision because the band directors have confirmed that in the studies and report, it's not every instrument that needs the slit face covering. It's certain ones, and this policy would then allow band directors to provide that direction. The next category of exception is during receipt of health care. Persons receiving health care or undergoing health care exams from authorized health care professionals, including school nurses, would not be required to have a face covering on. The next category, emergency circumstances. They're not required and may be removed if a person is experiencing acute problems breathing, a medical emergency, or is unconscious or incapacitated, or cannot personally remove the face covering without assistance. The next category deals with indoors or driving when alone, and the policy does not require face coverings when persons, including employees, are alone in a classroom, office space, other school district building room, or in school district vehicles. The next category of exception is for medical certification. This provides that a face covering is not required for persons who present school district staff with certifications from a licensed healthcare provider that the person has a medical, physical, or psychological contraindication that prevents them from being able to safely wear a face covering. There is an exception for IEP or 504 plans. Face coverings are not required for any student whose IEP or 504 plan specifically exempts the student. The next category is for outdoors with social distancing. A face covering shall not be required when persons are outside of any district school building or vehicle, provided they're maintaining social distancing of at least 6 feet from each other. The next category is when the face covering will be an impediment to classroom instruction. This part of the policy allows teachers, staff members, and students at the direction of a teacher to remove their face coverings when wearing them impedes instruction. Finally, the last exception would be the opt-out provision, and this would allow parents or guardians to opt their student out from the requirement of wearing face coverings. The same would be true for employees, with the exception that opt-out would not be allowed while riding buses. The next category of the policy goes into non-compliance, and in this category, the category for students is a multi-tiered recommendation in the policy that if a student's not wearing the covering, they would be reminded of the importance. If they're reminding and still don't comply, then the school administration would be contacted. They would contact the parent of the student to get support from the parent for the face covering or to discuss the potential exceptions that that child might qualify for.
Okay.
The next category of noncompliance is with employees as well. There's a multi-tiered level here. They would be reminded of the obligations of the policy, and they would also be reviewed with exceptions to determine if there's something to accomplish their concern with the face covering. Finally, others, all visitors will be reminded that face coverings are required while at or inside school district facilities and buildings. A visitor will not be admitted to a school district, school, or facility without an appropriate face covering. The last portion of the policy deals with a special provision for Eglin Elementary School because of the fact that there are public health emergency management orders in place by the 96th Test Wing Commander at Eglin. Those orders must be followed for all persons going to Eglin Elementary School, irregardless of the school board policy. And I would remind you finally, Mr. Chairman and board members, this is an emergency proposed policy, therefore it only would be valid for a period of 90 days, and the board would have to make a decision during that time frame whether or not to go through regular rulemaking provisions to have the policy extended.
Okay. Thank you, Mr. McInnes. So we're now at the part of public hearing, and we did go a few minutes over because we did start a few minutes late just to be able to get all the board members on. But I do want to remind the public, we very much encourage public comment, and tonight will be no exception. If you are attending or calling in, know that there might be a wait as speakers address the board in the order in which they are received. Tonight, we are going to start with an in-person, and then we'll switch to a phone call, and we'll keep doing that just to be fair with everybody. Please also be mindful that there is a 4-minute time limit, and I ask that if you are speaking, try to stay on topic. Also, a reminder that proper engagement etiquette is expected, and that we, as residents of Okaloosa County, there will be no personal attacks, and that we will have some type of civility and compassion as we address the board. With that being said, over the last 5 days, I've been encouraged by the emails, the calls that I've received, and the fact that people have been very straightforward, but they have also been very polite, in my opinion. So I would just ask that we do that tonight. I know this is a very sensitive subject, and I also know that there's people on both sides tonight. So I just ask that we remember that we are residents of Okaloosa County, and we can show the world tonight that we know how to conduct ourselves in public comment. So, Mr. Mitchell, we will start with the first in-person. Good evening, sir. Welcome to public comment. I would ask that you please state your name and your address for the record, and a reminder that you have 4 minutes to speak.
Yes, sir. My name's Hollis Miller, 4474 Sundance Way, Holt, Florida. I am a owner of 2 daycares, one in Holt and one in Baker. I am against my child starting high school at Baker wearing a mask. Like I said, we own 2 daycares. Between those 2 daycares in the past 3 months, we've had 43,500 kids, teachers, and parents walk through that daycare. No mask policy. Nobody wears masks. Nobody has come up with any coronavirus positive test or anything. Pretty much, I'm just kind of against it.
Okay.
For my child.
All right. Well, thank you, sir. If you have any more time, if not, we appreciate you being here tonight.
We was walking down here on the opt-out. We don't
Okay.
understand the opt-out. If
Okay.
we opt out of masks, what is that?
Okay, so we'll be discussing that more later on.
Okay.
And we have actually discussed a little bit about it here just a few minutes ago.
Okay.
But in the spirit of trying to get everybody through public comment, but that is going to be addressed tonight.
That's fine. I appreciate all of
Yes,
y'all,
sir.
but
Thank you.
no masks. Thank you.
Thank you, sir. All right. Mr. Mitchell will do a phone call.
Mandy, go ahead and put the call through. You've reached the Okaloosa School Board public comment line. Please state your name and full address for the record. You're live with the school board.
Sure. This is Josh Ashley at 1107 North Bayshore Drive in Valparaiso.
Okay, Mr. Ashley, I just want to remind you do have 4 minutes.
Okay, thanks. Thanks for taking my call. I'm calling tonight because I know the board has received many passionate and emotional arguments asking you to back down from your proposed mask policy tonight, to the point that the board has redlined in an opt-out provision, which would render the policy largely meaningless. I've opted to have my own kids go to school in person this year, out of faith that this school board will institute every reasonable precaution it can to protect our community, including masks when appropriate. As of right now, my kids have a full set of grandparents, which is a blessing. I know that's a precious thing, and I hope this school board understands that your decision tonight could prematurely end the lives of one or more of those grandparents, or even my wife's life or my own life if we're particularly unlucky. We're putting our lives in your hands. So let me be blunt. Anti-mask arguments are no different than anti-vaccine arguments. In so many ways, the arguments and emotions mirror each other. We have a requirement that every student in this county be vaccinated for measles, because it's not a constitutional right to spread measles throughout our schools. Some anti-vaxxers make the baseless claim that vaccines cause autism. This is unequivocally false. And even if it had some degree of truth, which it doesn't, the truth is that the MMR vaccine has clearly saved countless lives since its inception. In the same way, anti-maskers will claim that masks somehow interfere with breathing or cause disease, using pseudoscience and emotional appeals to cover up the fact that they don't have any evidence. Anti-vaxxers will say that their choices don't affect anyone else. But the truth is, even vaccines aren't 100% effective. Some people unknowingly only receive temporary or partial immunity, and some really can't get vaccinated for purely medical reasons. And then, if a large population of people selfishly make the choice to avoid vaccination based on pseudoscience, we'll lose herd immunity, and diseases like measles and diphtheria will spread freely again, including to people who took vaccines but only received partial immunity. In the same way, remember the core idea behind wearing a mask. My mask protects you, and your mask protects me. We wear masks during a pandemic out of mutual respect for one another. They are admittedly imperfect, far more imperfect than vaccines. Your own proposed policy lays out several valid circumstances where it may be allowable or necessary to not wear one. And yes, a medical opt-out should be among those reasons. But when you add in personal choice as a reason on top of all the others, especially when those choices are being driven by political tribalism and pseudoscience, we defeat the whole purpose of the policy and the protection it could offer. I wish we had a vaccine for COVID-19, and we will before too much longer. But for now, we just don't. We have to fight the virus with the tools available to us. That means social distancing. It means frequent hand washing and sanitation, plastic barriers, contact tracing, quarantines. And yes, it means masks in circumstances where we must be in close contact with one another. So let me ask you, if we can have an opt-out for a mask policy, then why don't we have an easy opt-out for all vaccines? Why don't we have an opt-out for the dress code? Do you plan on introducing opt-outs for those policies? No.
You
You
have
all know
30
the answer
seconds,
to those
sir.
questions. You won't, because it would be bad policy. Pass the mask requirement as originally written. Leave the opt-outs to the doctors, not personal beliefs. The appropriate opt-out to masks is the virtual schooling option. Thank you.
Okay, thank you, sir. Okay. And Mr. Greenwood, Adam Greenwood, if you would, please. State your name and your address for the record, and you have 4 minutes to speak on your.
Thank you. My name is Adam Greenwood. I live at 1235 Quail Lake Boulevard in Destin. I have a statement this evening, not a question. I have 3 children in the system ranging from 1st to 7th grade. I'm a veteran, and I do have a medical background, but I'm not here to speak about that this evening. I'm here for my kids this evening. To be more exact, I'm here to fight for their future. I recognize that all of us think very differently about things, not one side or the other, not red or blue. It's not about political affiliation or anything else. It's about our kids and their mental well-being. This is about paying attention to the questions they ask when they're exposed to all the rhetoric without having to use lies or deception to explain it to them. This unfortunate situation has thrown the general public for a loop, and more so the parents. And what are we actually supposed to believe, and how do we educate our children about what's exactly going on? I can't answer that, and I don't intend to educate anyone this evening. I'm just here to maybe put a small dent in the battle for my children's future. I'm here to talk about the elephant in the room, the subject that's hinted but never spoken about on the mainstream media, forward-facing publications, forums such as this, and even between peers comfortably. I'm here to talk outside of the normalcy bias in our comfort zone. Once again, I'm not here to speak about anything medical whatsoever, but I do want to speak about the false information that's being conducted here this evening. The data's out there in plain sight. Yes, it's skewed and manipulated to strike fear and panic in the minds of those who don't do their own research and they listen to the propagandized reports. And now that skewed data and propaganda is colliding with our kids at full steam in an attempt to manipulate their minds and disrupt their future that they deserve as Americans and free human beings. And what's a mask really? It's about desensitization. Masks are tools to belittle and herd. Yes, herd like sheep. And our children should not be herded or taught to not question. We should teach our children to make informed decisions for themselves with parental guidance, not to conform to mandates of a ruling class. We must teach them to be strong individuals, not faceless beings of an Orwellian society. Mask mandates build the acknowledgement and glorify the fiction that we are so deep in a public health emergency that our elected executives have extra constitutional power. They are a tool of peer pressure and conformity. Why? I don't know yet. But what I do know is if I'm to sit back and conform without question, I'm doing my children and their futures an injustice. I will leave you with this statement from Molly McCann of The Federalist. I quote, "Mandatory masks are a critical predicate, conditioning us to accept abuses of our liberty. Mandatory masking provides the foundation on which governments continue to justify emergency measures and rule by executive fiat. And it creates a national mood of consent that America will accept indefinite government expansion because we face a new normal." And that new normal I've heard over and over from documents that have come from the school system. Ladies and gentlemen of the board, Superintendent Chambers, I simply ask that you will step outside your comfort zone, outside that normalcy bias. Step outside the pressure upon you to make these rash and unnecessary decisions. Stand beside the children of our school system. Stand beside the thousands of patriots and veterans and active duty military that live in our county, as is your duty as elected officials. You have already imprisoned our children in plexiglass and fear. Do not further imprison them with a mask. Thank you.
Thank you, sir. All right. We'll take a phone call. Eric, remind on the phones that they got 4 minutes. Could you do that for me? They have 4 minutes.
I need you to turn down your whatever you're watching, the live stream, so that we can hear you better. You've got the Okaloosa School Board public comment line. Please state your name and full address for the record. You're live with the board. You have 4 minutes.
Hi, my name is Leslie Fuller. I live at 310 Sable Palm Drive in Niceville. I just want to thank you for hearing my comment today, and I thank you for answering my emails and just for being available to hear us. I have 5 children in Okaloosa County Schools, and I support the mask mandate. I have followed the local data and listened to Dr. Chapman, our Director of Public Health. She is adamant that the safest way to open schools is with a mask policy in place. According to her, 80 to 90% of people need to be wearing them in order for them to be effective. She went on to talk about a CDC article that was released on July 17th about a salon where two workers were symptomatic and they had a total of 139 clients between the two of them, and none of the clients came down with COVID. It was their policy at the salon to wear masks, and all of the clients wore them as well. So the CDC is using this anecdotal story just to show the evidence that masks can be effective if they are used regularly by everyone. I've listened to the base commander at Eglin plead with the public to wear masks to help them maintain mission readiness. Our hospitals have written letters to the county asking for them to mandate masks. I think it's clear from our medical professionals that masks are a critical way that we can fight the transmission of COVID-19. I think that it's important for our students to get back to school, but I think we must do it safely. I have a 9-year-old daughter that is high risk. Recently, we had a virtual visit with her immunologist at Nationwide Hospital in Ohio. He encouraged us to remain virtual for her, but he went on to state that his worry is not necessarily for children, but for their parents and their grandparents, for the teachers. He went on to say that it's not just those that are over 65 that are going to have a risk for this virus, but it's those in the 30s and 40s. Even if they don't die from this virus, he called them long haulers. They can have long-term effects. So many of our parents and teachers fall into this category. I'm also concerned about the opt-out policy. If we allow people to opt out simply because they don't want to follow the policy, we won't have that 80 to 90% participation. I think that there are legitimate reasons that children need to be able to opt out, and I agree with the policy as it was written before the revision was made. But I think that, we set rules for things like dress code. I don't think that this is any different. The big difference is that the effect of transmitting COVID to a child or a teacher far outweigh the effects of wearing a tank top or having a mustache, which are things that the school board has put in place to, mandate for our children. The CDC,
Ms. Fuller, you have 30
some
seconds.
reopening guidelines where it states that enforcing a mask policy that by not enforcing a mask policy, it moves us into the highest risk category for reopening schools. So I'm sure that the board has seen those guidelines. They go from lowest risk, which would be virtual, to some risk, medium risk, higher risk, and highest risk. The highest risk is unacceptable, and if we don't enforce masks at our schools, that's what category we will land in.
Okay, thank you.
So I would
Ms. Fuller,
urge you to
Ms.
please
Fuller,
listen
Ms.
to the
Fu-
advice of medical professionals
All right.
and
Ms.
open schools
Ms. Fuller?
safely.
Ms. Fuller?
Please mandate. Yes.
That's your 4 minutes.
Okay.
All right.
Thanks.
Thank you for calling in tonight.
Mr. Chairman, if I may, we have lots of people who are calling in that are starting to get busy signals because all the lines are full.
Okay.
So I'm just saying, when people are calling in, if they're getting a busy signal,
Right.
it's just because there's a lot of people
Right.
calling in, but that's the right number to call.
Right. Thank you, Mr. Mitchell, for clarifying that. And if you didn't hear him, he did say the lines are pretty jam-packed tonight, but you might hear a comment that you want to make, and someone might make it for you. You might want to wait till later on, that's fine, but just be patient with us. So we now have Alicia Logan. Ms. Logan, if you would, please state your name and address for the record, and you have 4 minutes to state your position.
Alicia Logan, 5040 Yellow River, Log Lake Road in Holt, Florida.
Good.
Mine is a question. I noticed on Monday that y'all added in the opt-out. And I know you say you're going to address that more later on.
Right.
But does that mean we get to come back and ask our question about it? Because mine is, how are the teachers going to identify who has opted out?
Right.
Or that's my biggest question
Right.
right now, is how are they going to know?
Right. Well, and and we appreciate that question, and I can imagine that 5 board members probably one of us might have that question down there to ask as we discuss the policy. So, I would hate to be able to bring that right now when we're going to have it in for discussion after we do public hearing. But I know that's a question I have, so I can assure you it's a question that's going to be asked. So,
Okay.
okay?
Okay, well, I appreciate
All right.
it. Thank you.
Thank you, ma'am. All right.
You've got the Okaloosa School Board public comment line. Please state your name and full address for the record. You're live with the board. You have 4 minutes.
Hi, my name is Erica Knightsky. My address is 1445 Oakmont Place in Niceville. Good evening, and thank you for allowing me the time for this public comment. I work for the Air Force as an engineer at Eglin Air Force Base, and my husband is the vice commander of the 53rd Wing at Eglin. And we have been proud members of this wonderful community for the last 6 years and plan on making this our home after military retirement. We have 2 daughters, one who will attend STEM Academy and one who attends Blue Water Elementary. And we have opted to send them back to school in person because we are strong believers in the power of public school teachers educating our children in person. At Eglin Air Force Base, Brigadier General Kane, commander of the 96th Test Wing, has asked for those of us that work on base and for those in our community to do our part to stem the spread of this virus because it impacts the mission-critical work that goes on at Eglin, not to mention Hurlburt and Duke Field. And as a working mother, I want nothing more than to ensure that schools remain open with an in-person option. But by not requiring mask usage at schools, we risk school closures due to virus transmission, and we put our community at risk, and we put the vital work that the military does for this nation at risk. While mask usage does not prevent virus transmission 100%, the science and the data show that it greatly reduces the spread, making it our best prospect at maintaining open schools and our best prospect for the military community to continue performing its mission. Mask usage has been mandatory at Eglin in situations when social distancing cannot be maintained. It should be the same at our schools. Make mask usage mandatory across the board to keep virus transmission at a minimum and keep our vulnerable populations safer. Make masks mandatory to keep teachers from having to individually make this difficult decision on our behalf. Make masks mandatory to keep the vital military mission operating at 100%, and let our school district be an example to other school districts. Let's show them that we can reopen safely and get our children the in-person education that they so desperately need and deserve. Thank you for your time.
Thank you for calling in tonight. Okay. So now we have in person Lynette Meissen. Ms. Meissen, if you would come to the podium, please state your name and address for the record, and you have 4 minutes to state your statement.
My name's Lynette Meissen, and I'm at 234 White Street, Unit 10, Niceville, Florida, 32578. I just wanted to let you all know about a website that has to do with the curriculum, and it's forkidsandcountry.org, and it's FOR, and then the and is AND in that. Also, as far as the masks, the herd immunity was for a virus, for a cold virus, has always been between 20 and 30%. And the whole reason that we were locking down to begin with was so that our hospitals wouldn't be overwhelmed. As things went on, we found out that the people that were most vulnerable to this virus were people in their 70s, 80s in nursing homes. And that's where the majority of the deaths has occurred. And there has never been a death of a child they might get the virus, but it's a mild cold, unlike other viruses and flus. More kids have died from flu than they ever have, and from SARS, and they are going to die from this virus. And since we're at that 20% to 30% near that right now, the people that get the virus, the herd immunity we achieved quickly, and we're almost there right now. by letting the people that this is nothing but a cold to them, get, if they get it, it's not the end of, and mostly it's adults that give it to the kids, not the other way around. And part of the science behind that is long-term T cell immunity, which has happened probably because they've had SARS or another cold virus long-term. So that's and I think it's really sad that kids have been, when you talk in groups, you talk about this with kids, they feel like they're really hurt. Psychologically, it's hurting them. They feel that like their life is over, things have changed. This isn't what this country's about. I just cry when I heard her, one of these kids talk about it like this. I had no idea it was like that. I have grandkids that live up in Atlanta area, and even coming from there down here to visit us, they said it's like a different world. It's more normal here than it is up there. I don't want to reverse what's become normal, become abnormal. I mean, I have asthma, so I can't breathe with those things on, especially in the heat. And the heat kills the virus anyway. So, I mean, I really don't see the extra need to force people into wearing masks. I want life for kids to be normal again, because through I've had mumps, measles, I grew through this whole thing, and I'm still here. You don't shut down, you don't shut down a country and people's lives for indefinitely like this, especially when it's never been done with other cold viruses. So.
All right. Thank you very much for your time tonight.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You're live with the school board. You have 4 minutes.
Yes, my name's Leah Felix. I live at 4880 Track Street in Crestview, Florida, 32536. Good evening. It's been quite some time since I've addressed the board last. I would like to begin by saying that I do not agree with mandating masks or face coverings in school. I am glad to hear and see that there has been a revision to the face covering policy, which allows parents an opt-out option. I will tell you that I will most certainly be one of those parents. With that said, I have instructed my children to wear a face mask anytime they are traveling in a hallway. I'll let them know that the face mask may come off in class. Why? Well, because the school has a 6-foot social distancing policy for each child's desk, and I do not believe wearing a mask 7 hours a day, 5 days a week for children is a good learning environment. Not to mention, it has been proven that face coverings trap germs and bacteria. To me, that is a health and safety concern. Also, children will not wear their mask properly. They will touch their mouths and noses with the face mask on and still contaminate areas around them with germs. What about recess? From my understanding, kids are still having recess, as they should, but who's going behind and wiping each bar, each swing, really anything after one kid has touched it before the other does? Moving on. The CDC recommends and encourages the wearing of cloth face coverings. Nowhere does it say should or must. According to the CDC, education and promotion of positive and supportive relationships should remain the primary focus of school administrators, teachers, and staff. In addition, school administrators should find strategies to encourage students to wear face coverings consistent with CDC guidance while maintaining a positive learning environment. Notice how it says encourages, not mandates or makes a policy to enforce face coverings. With that said, most of you have many years as school educators. You all have been to many training seminars, even maintained certificates. You all know what a conducive learning environment should look like and how quickly it can turn unfavorable. A conducive learning environment is one that lacks physical intimidation and emotional frustration, which brings me back to the beginning. How is a child wearing a face covering 7 hours a day, 5 days a week, a conducive learning environment? Now, some people may say, well, why didn't you just do online? Well, because as a parent, I made a decision that I believe is best for all my children. I struggled, went back and forth with should I or shouldn't I. Ultimately, the decision was mine to make, as should wearing a face coverings for my children. If schools were able to reopen and parents were able to choose whether or not they wanted their kids to do brick and mortar or online without a policy mandating masks, then this too should be a parent's decision. I will leave you all with one last thing to ponder. I tuned in and watched this past Monday's board meeting. I believe a good leader leads from the front. What I noticed more than anything was that none of the board members were wearing face coverings. I see this again, the case tonight. I wonder why that is. Is it because it's too stuffy? Is it because your words may seem or be distorted to others? Or is it just a personal decision? You are trying to enforce a policy, one that you yourselves are not willing to follow. There is no law or policy by the Florida Department of Education, Governor DeSantis, or anyone enforcing or mandating masks. Seems a bit hypocritical. With that said, I would like to thank you all for taking the time to listen to me, and my hope is that you truly take into consideration everything you've heard tonight. Thank you.
Thank you, Ms. Felix, for calling in. Okay, so now we have Mr. Michael Newcomer. I hope I pronounced that right.
That's correct.
You have, if you would, please state your name and address for the record. You have 4 minutes to state your statement.
Okay. My name is Michael Newcomer. I reside at 12 Washington Street in Fort Walton Beach. I'm going to read a statement prepared by my wife, Christine Newcomer, who could not be here this evening. This is the third time that I have appeared before this board. On the first occasion, I addressed the district's failure to notify parents that their children were the subject of investigations regarding physical abuse. On the second occasion, I spoke about the district's failure to notify me regarding its inability to provide my special needs son with necessary therapies as outlined in his individual education plan. Now I find myself once again addressing the district's failure to provide parents with pertinent information regarding issues that directly affect their children's well-being. It is my understanding that the board seeks to implement the face coverings during COVID-19 pandemic emergency policy under the recommendation of Dr. Karen A. Chapman, Director, Florida Department of Health in Okaloosa County. I am in disbelief that any public health official would have the audacity to present to this board a recommendation for children to wear a mask without presenting all.
Mr. Newcomer, if I can, Ms. Chapman has not made any recommendation before this board,
Okay.
just to be clear. Okay, go ahead, sir.
All right. All right. Presenting all the negative consequences our children could face. Under the premise of informed consent, this mandate places the responsibility of providing parents with this information squarely on the school district. Masks present numerous risks. Is the school district prepared to assume all liability for injuries from wearing masks to include emotional and psychological injuries? I sent each of you before me today a list of questions regarding liability to which you failed to reply. Nowhere have you provided criteria for when masks should be removed, such as indoor temperature and/or relative humidity levels or outdoor heat index. You have not presented parents, students, or teachers with actual fabric weave requirements or how moist a mask can be before necessitating removal. These are just some of the data points the district has failed to address. Did Dr. Chapman mention how students with neurological issues who require the maximum contextual information possible to determine inferences being made by teachers, students, and faculty will be adversely affected by their inability to see faces? It is plain to me that a reduction in this vital component of nonverbal communication puts our students with disabilities at an even greater disadvantage. Cloth masks are not a valid medical intervention to prevent the communication of viral infections. At best, they merely redirect aerosolized particles when sneezing, coughing, or speaking. Cloth masks have a viral penetration rate of 97%, while surgical masks have a penetration rate of 45%. Gaps around masks can further reduce efficiency by 60%, as stated in evidence cited by Dr. Chapman. That particular study has also used batting between 2 layers of cotton. I know of no parent who wants to mask their child with what is essentially a cloth diaper. When you read the actual science, you will find that cloth masks almost always make things worse. A randomized clinical trial recently published in a British medical journal shows that medical professionals were actually 13 times more likely to experience viral infections while wearing a cloth mask than while wearing a surgical mask. Based on surgical mask research, Oxford University actually shows that moisture buildup inside masks increases the viral penetration rate and, quote, moisture accumulation is also thought to facilitate the movement of contaminants through the material of the mask itself, unquote.
You have
Moist-
about 30 seconds.
Moisture retention also creates a reservoir for pathogen growth. I personally know of 2 different children who suffered seizures because of masks, and this was confirmed by their neurologists. Do our children need to seize before the district administrators, who are not medical providers, permit them for opting out of masks? Where can parents find your re-education materials that the school will use when child removes their mask or decides not to wear one?
Mr. Newcomer, your time is up.
Okay.
Thank you for your statement tonight.
Thank you.
And I believe you did email us tonight on the question you were getting ready to ask, so I know that's going to be addressed tonight. A what?
This is the Okaloosa School Board Public Comment Line. Please state your name and full address for the record. You have 4 minutes. You're live with the board.
Annie Grattan, 29 John Quill Avenue, Northwest Walton Beach, Florida. And I am a retired school teacher, so I'm calling because I'm concerned about the teachers and the students. And I have taught in one of the traditional classrooms, and they're not that large. So if they have a pretty large class, then without a mask, they can catch this virus. Now, we say we want school to be in because we want to teach our kids the necessary skills for life. But the first lesson that we should teach them is a respect for life and to show that they care for others and others care for them. And we can do this by having them to wear a mask. And then I wanted to relate one experience. I went on a field trip one year, a charter bus, and we had one student that had a virus, and every one of us caught that virus because we didn't have any protection. But we can protect our students, we can protect our teachers by having them to wear a mask, and then that way we're teaching our students. We're showing them that we care and that they care for others and others care for them. Because I know in the old traditional classroom, it's not that large. If you have 20, 25 or above, it's going to be hard to separate them, to social distance. So we should worry about the teachers and the students and have them to wear a mask. And that's my comment. I think it's very important for life and for health reasons. And we do have people, I heard him say, we have outbreaks in some schools, I know in Pensacola, Mississippi, and we have had young people get this virus. And we had some to get very sick. And we did have one to lose his life. So this is very important. It's just not about the main public. It's about the students and the teachers, and then also it can be carried out in the public from there. So I think this is very important. So I say that we should have masks to be a mandatory thing for all our students. Thank you for allowing me to speak.
Thank you for calling in tonight, and thank you for your service as an educator. We appreciate that. All right, so got to put my glasses on here. So Kelly Harder, is that correct? Okay, Ms. Harder, if you would, please state your name and address for the record, and you have 4 minutes to
Okay,
make
great.
your
Is
statement.
it okay if I don't say my street address? Because I know
That's
you're
fine.
live on YouTube.
That's
so,
fine.
I'm in Niceville.
Okay.
It's nice to meet you. Nice to see you all. So, I mean, we can be up here and talk about the statistics, and there's no experts that agree. You can find 50% that say masks are working, they're going to solve all the problems, and you have Dr. Chapman, who I know you're listening to because I've seen the emails. Dr. White is here, and he sent me plenty of reference material from her, and I know last meeting you talked about taking her recommendation into account. 50% of experts are going to tell you their work, they're going to solve it, and then you have Dr. Chapman, oh, we're going to wear the mask till the vaccine comes out. The thing doesn't exist yet. We don't know if it's going to work. It hasn't been even tried for a year. I don't know anybody sane who would want to take that thing. So and the other half of the experts will say masks don't work. Maybe a face covering might work. It might work a little. It might not work at all. Kids might keep them on. They might not. They're going to drop them. They're going to keep them in their pencil pouches. They're going to share them with friends. They're going to show them to people. But essentially, at the end of the day, it's not about how well they work, or it's about a choice. And that's why the same thing with vaccines. You know, the last thing we own is our bodies and our kids' bodies. And the second we start letting other people mandate what we do with those is the second we've lost all liberty and freedom. And I'm sorry, but everything that was in place was even before the opt-out, you know, and the mask mandate, and when it was just suggested, and there was a lot of other things to go back to school. The plexiglass was an option, and we understood that, and, you know, we all had to make that choice. Are we going to stay at home? What are we going to do online? Are we going to send our kids back to school? My kids are ready for normalcy, and I'm ready for normalcy. And at the rate that kids are being infected, and the death rate in children it's so minute. It's I don't know, 0.003 or something crazy. It's so low. We take more of a risk every flu season. And I'm not to say that COVID is like the flu. I understand it's different. It's more contagious. I get that. This isn't a pseudoscience argument. Okay, there's facts out there that we can all find. So it's basically, for me, it comes down to that it should be everybody's choice. And we all have that option. If you are in fear, if you do have grandparents living at home, that's not kind of or nearby. It's not normal. I mean, it's not a normal family situation. Most people don't have grandparents living in their home. But when I send my kids to school to learn, I send them and I make the best decisions for them. I can't make decisions for everybody else's kids. It's not my job, and I shouldn't try to. And I can't make these choices. But I should be allowed to make my choice for my kids. And I know you guys can't please everybody, and a policy with an opt-out for everybody seems, you know, pretty fair, right? We're making a policy, but we're giving you the choice to opt out. But if the policy doesn't exist in the first place, we don't need to jump through a bunch of hoops to get a permission slip from our government to tell us what we can and can't do, what we can and can't wear, what our kids can and can't do, where they can go with or without a mask. So I'm asking you to consider maybe keeping that policy for if there is an outbreak. I mean, in reality, chances are we're going to see some cases of COVID. I mean, we're going to see, it's probably going to happen at some point, right? It could be minor, kids could get colds. We might not even know they're sick. So it's probably going to happen. So in a contingency, I could see, you know, instead of highly recommending everybody, please wear the mask, you want to opt out, you can still opt out, but parents were
you have
letting
15
you know.
seconds, Ms. Harder.
Got it. Okay. So, and the other thing that concerns me is just the anxiety, just creating anxiety that just doesn't need to be there for all the kids.
All right.
That's it.
Thank you very much for coming tonight. We appreciate your comments.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
Good evening. My name is Delana McDowell. I would respectfully decline putting my full address knowing this is on the internet. However, I do live in Crestview on Risen Star Drive. I first want to thank the members of the board for hearing all of us this evening. I have two children, one finishing school and one really just starting, and one of which who relies on the facial expressions for social cues that are otherwise inhibited by a mask. I respectfully disagree with the enacting of the policy because it takes away the freedom as parents to decide what we feel is best for our children in discussions with their doctors. I would encourage members of the board to put the power back into the hands of the parents for those who want their children to wear masks in class, in the hallways, versus not. I look forward to hearing other discussions on the opt-out policy because I do have questions on that. I do know that that will be discussed later. Again, I appreciate y'all listening.
Thank you
for your time.
Thank you very much for calling in tonight. Okay. Ms. Helen Beige, did I say that correctly? Yes. Okay, Ms. Beige, if you would, please come to the podium, state your name and address for the record. You'll have 4 minutes to state your thoughts and opinions there.
Okay, thank you. Hi, Helen Beige, 924 The Masters Boulevard, Shalimar, Florida. I have 4 children in the school system. I'm actually on the fence about the mask wearing or not. Actually, when I came, I was pretty adamant that did not want them to wear masks. But, I've heard arguments on the other side. And so, I feel I have a lot of teacher friends, so I hear their side as well. My main thing is I feel like this should have been brought up before, and I'm a little irritated that it was not. The kids have been out of school since mid-March. The time has passed when we could have made the decision as parents to put them online, keep them home and do online. Although my kids are desperate to go back to school. They all want to be in school. They miss their friends, of course. But still, I feel like this should have been brought up and prior to elections. Because it's been a long time since they've been in school. Also, I just had a couple questions really because are there going to be, I don't know if you know, are there going to be plexiglass partitions around every desk in every class? There are, okay, and then that was kind of my thing. If there's partitions around every desk, do they need to be wearing a mask all day, which my children hate wearing masks as well, I'm sure most do. And then the other thing is, obviously cannot give me a date, but how long will the mask, if it does go through,
It's
how
90
long will
days. 90 days. It's
90
just a
days, and then you'll reevaluate
Yes.
where the numbers are?
Yes.
Okay.
If it passes.
If it passes, yes. And then also, my thing too is I just want to make sure too that all the proper sanitization things are at the school. I can't tell you how many times I've gone into a school bathroom when I'm at different events and there's no soap, there's no paper towels, there's no toilet paper. It's crazy. So that's something too that they need to look at. And then I do understand the buses and hallways. I had already told my children this way before all this, that you're going to wear a mask on the bus and you're going to wear a mask in the hallway, although it is about 100 degrees on these buses. So keep that in mind as well.
Yes.
And that's it. Thank you.
Well, thank you very much for coming tonight.
Thank you.
Yes, ma'am.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You're live with the board. You have 4 minutes.
Thank you. My name is Brianna Updegrove. Address is 1198 Bay Court in Destin. I have 3 children this year in Okaloosa County schools, kindergarten, 1st grade, and a sophomore, and they're all over Okaloosa County. I understand the fear that people have with this COVID-19. I do understand, but the science has proven that it's no more dangerous than the swine flu, than the regular flu and pneumonia. And if people will learn to build up their immune system and keep their hands washed, we wouldn't have to wear masks. I think that putting masks specifically at our children is not only dangerous for their health, for their long-term health, for their short-term health, but it will cause them to touch their face even more so, especially the younger children. And that if people are that scared, then they should be able to stay home. And if they're going to be mandated, then the people like me who don't want our children being forced to wear masks, then we can keep our children home. But we signed our children up under the understanding that they wouldn't be mandated. And I don't think that it's safe for kids to be walking down the street with a mask on. And I don't think that it's needed. And it's not just about a virus. It's about the safety and the mental well-being of our children and those around us. If the teachers feel like they need to wear them or other staff, then allow them to. But for those of us who are not scared of a virus, it's no worse than the flu, shouldn't be mandated. And it's time that our leaders of our school and our district and our state start stepping up and putting the fear-mongering to rest. That's all I have to say.
Okay, thank you for calling in tonight. Okay, so Miss Lisa Christopher, if you would, please approach the podium. Please state your name and address for the record. You have 4 minutes to state your thoughts and opinions.
Lisa Christopher, 716 Majestic Prince Court, Crestview, Florida. I grew up in Okaloosa County. I went to Edge Elementary, and now I have kids. And I've actually taught in Okaloosa, but not for the school district. But after we had kids, I have homeschooled my kids up until last year. Last year was their first year going to school in 4th and 2nd grade, so yay, that was great. But honestly, we had an amazing experience. Our teachers were amazing, and so without a doubt, my kids definitely want to go back to school this year. When we made the decision to keep them enrolled, it was under the understanding that they would have to wear a mask on the bus. And so we made arrangements so they wouldn't have to ride the bus because my kids do not want to wear a mask, and I don't want them to either. So definitely, like, when we made our decision, that was our understanding. The opt-out, I don't feel like is working because I feel like when there's risk, you have to have choice. And I think there's going to be some issues that, I haven't really heard discussed. Bullying between kids, if it's required, or why aren't you wearing it? Oh, my mom said I don't have to. I mean, just things like that, where if it was just a choice. And then also, like, teachers having to enforce it, having to know who's allowed to and who's not. I think we really need to give people the benefit of personal responsibility. If a parent really wants their kid to wear a mask, they're going to reach out to their kid's teacher, and their teacher will know, like, they really want their kid to wear a mask. And so then it's kind of a relational thing between the teacher and the child. It's not a rule. It's not. And then, the re-education language is very scary to me. Just all those things are red flags, but we definitely want our kids to be able to go to school. We made the decision, the information we were given, and it just definitely feels like very last minute. And most parents are very agonizing over these decisions anyway. So thank you.
You're pretty passionate about our schools. Shout out to the schools that your children go to.
Riverside.
All right, there you go.
Thank you.
Thank you. All right, Mr. Mitchell.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
Hi, my name is Tasha Malik. I would respectfully decline to put my address on the internet. However, I do live in Destin, Florida. First, I want to thank you guys for taking everyone's comment and consideration tonight for our children. This is for the well-being of all the staff, teachers, and students. I am in full support of the mask. I am a single mother of 3 children, 2 of which will be attending Destin Elementary School. I feel that there should be no opt-out due to the fact that, these kids really could pass the virus if they are carrying it to a teacher. And, I personally had my son's kindergarten teacher, her husband passed away due to COVID. And just to think if one of my children just so happened to carry the virus and pass this along to a teacher, and maybe they have a pre-existing condition, I think that it's very selfish that we would just not mandate for everyone. I would like to touch on the kindergartners. I have a kindergartner. I am under the understanding at Destin there will be 19 kids in a class. There will be just plexiglass on the desk of 2 kids sitting side by side. That is not 6 feet apart. And I still feel that kids are at risk. There is a 6-year-old that has been reported that died in the state of Florida. I don't think this is political. I just truly think that the parents set the mood. I have a 2-year-old that wears a mask everywhere we go. And I'm very passionate about this because, it could really save other people's lives. So I think that we should definitely mandate it. And I really appreciate you taking my comment.
All right. Thank you very much for calling in tonight. Okay. Josh Morris, if you would please come to the front. And Mr. Morris has been before the board a couple of times this month. So please state your name and address if you'd like. And you have 4 minutes to state your position.
Josh Morris from here in Niceville. So to wrap up my information from Thursday, a study conducted in June on how COVID transmits cites the CDC stat of all COVID cases, where less than 2% of them reside in children. They identified the method of transmission as due to the ACE2 receptor. There's direct causation between the gene expression of ACE2 in the nasal epithelium, the first point of contact for COVID introduction to the body, and COVID infection. They also found that this ACE2 gene expression was substantially lower in children than in adults. In other words, fewer instances of ACE2 gene expression in children means less presence of COVID in children. Another study this summer utilizing contact tracing found a positively infected child in the French Alps who came into contact with over 100 people, however did not transmit it to anybody. This study also reviewed data from New South Wales, where there was a total of 2 COVID cases in 15 schools. Another study this summer conducted in the UK of 100 schools and 20,000 students, and scheduled to be published later this year, found minimal evidence of transmission in schools. Population-level testing and research conducted in other countries, Australia, as I just mentioned, Switzerland, Sweden, Finland, Netherlands, France, Ireland, Italy, which was the European epicenter of the early COVID, Iceland, Canada, Taiwan, Japan, China, and South Korea also mirror the lack of transmission from children to adults. The Swiss study accounted for 0.3% of nationwide infections attributed to schools. The coupled study from Sweden and Finland concluded that there's no difference in the overall incidence of the laboratory-confirmed COVID-19 cases, and that the number of lab-confirmed cases does not fluctuate with school closure. The Japanese study concluded school closure did not show any mitigating effect on transmission of novel coronavirus infection because transmission in schools is negligible. An April study in China cited the CDC number of 1.7% of all cases being attributed to kids. The European numbers were 1.1% under 10 years old and 2.5% at 10 to 19 years old. Their study included 551 children outside the U.S. found to have contracted COVID and were hospitalized or treated in an ER. 9 of them, 1.6%, were considered severe or critical. 7 of those 9 had underlying health issues such as hydronephrosis, leukemia, intussusception, encephalopathy, or congenital heart disease. Out of the entire 551, and from the critical group of 9, only 1 died. Their study found 87% of the patients had household exposure. In comparison, the American number is 91%. Out of 2,572 American cases in the study, only 3 died, or 0.001%. They concluded children with COVID-19 have less severe disease and better prognosis than adults. From the CDC, as of mid-August, 90 childhood deaths were attributed to COVID, far less than the 480 listed as flu deaths from 2018-2019. That year, 39 children per 100,000 were hospitalized. The COVID rate is 6 per 100,000. The American Academy of Pediatrics provides state-specific data. In Florida, the mortality rate of children 0 to 14 is 0.009%, less than that of the flu. Only 5.5% of all cases are between the ages of 0 to 14. They make up only 0.7% of the entire statewide 0 to 14 age population.
30 seconds.
Rather than rely on one doctor's recommendation, I urge you to read as much scientific data as possible. Rather than deciding from a position of fear, I implore you to consider the data. It was mentioned Thursday when I spoke that with data, one can always find conflicting data. Well, where is it? Where's the data that supports the theory of children being super spreaders of COVID? Of the flu every year, of the common cold, sure. But how about COVID? If this data exists, please show me.
All right, Mr. Morris, thank you. Your time has expired.
Thank you.
Thank you very much for coming. All right.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
Hi there, this is Ann Hensey. I live in Destin, Florida. I have no doubt that all of you on the board, as well as Mr. Chambers, know exactly how I feel about masks and the necessary mask mandate. I've also made it clear that I take exception with Section D15, which is the general opt-out. However, I contacted Dr. Chapman today to ask her position, and I'm going to read her response to me to put it into public record. So I'm reading an email response from Dr. Karen Chapman, the Department of Health Director. Hi, Annie. As for the proposed mask policy being considered by the school district, I received a rough draft and gave input. I was told that much of what I suggested was incorporated into the policy. However, I never saw the final product. I have recently learned that the proposal includes D, Section 15, which allows any student to not wear a mask if the parent, guardian, or employee opts out of the provisions of the policy. I don't understand the value or the point of discussing a mask policy for the Okaloosa County School District with this language included. With that option, it is the same as having no policy at all. On the CDC website, Operating Schools During COVID-19 CDC Considerations, the CDC provides a continuum of risk stratification by model of learning and implementation of proven mitigation, generally called non-pharmaceutical interventions and strategies. From the CDC website link given above, while not exhaustive, this stratification attempts to characterize the risks of spread among students, teachers, and staff across the continuum. It goes from lowest risk to some risk, medium risk, higher risk, and highest risk. In the highest risk category, students and teachers engage in in-person only learning, activities, and events. Students mix freely between classes and activities. Students and teachers freely share objects. This is the section she highlighted. Students, teachers, and staff do not or are not required to follow steps to protect themselves and others, such as proper use of face masks, social distancing, hand hygiene. As you can see from the highlighted areas, any model in which students, teachers, and staff follow only some of the steps to protect themselves or are not required to follow the steps, wearing of face masks, physical distancing, and hand hygiene, staying home when sick, places the learning model in the higher and highest risk stratification categories for the spread of the virus that causes COVID-19. It is generally accepted practice that if any governing body wants to hear from a government official on an issue, that official is invited to the meeting. I have not been invited. However, I said from the first time I met with Mr. Chambers and school district staff, and have continued to say, the proper use of face masks at all times with appropriate exceptions and breaks, as well as social distancing, hand hygiene, staying home when sick, use of physical barriers, etc., are all, and she put all in caps, key to reducing the risk of transmission of SARS-CoV-2, the virus that causes COVID-19. I raised the wearing of face masks with the Board of County Commissioners in mid-July. There is now a signed ordinance requiring all businesses to post their masking requirements. At least now you can choose not to enter a business that doesn't require masks. The use of
Ms. Hinsey, you have 15
non-pharmaceutical
seconds.
interventions is not like an a la carte menu. In order for these interventions to be most effective, they must all be used together. The mask is a key element of the non-pharmaceutical intervention, since it is the only intervention that can significantly reduce respiratory droplet spray from the nose and mouth, thus serving as a first line of defense in source control, which is further enhanced by distancing and barriers, etc.
Ms. Hinsey, your time has expired.
In protecting and promoting health in Okaloosa, Dr. Chapman.
Ms. Hinsey, your time has expired. Thank you very much.
intervention.
Okay. So, Jennifer, if you would, I cannot read your last name, but if you would, okay. Obit?
Opitz.
Okay. If you would, please, just state your name and.
Jennifer Opitz. I live here in Niceville.
And you have 4 minutes.
Okay. So I work in a congenital pediatric clinic. Okay. I work with children every day. I've worked every day since I've been in, since this whole thing has happened. Okay. At first, I was a little concerned with it because nobody knew anything about it. But you know, there are things that have came out, studies and whatnot that have shown that I mean, back in 2009, we had the H1N1, right? Millions of people got it. My question is, like, we're never going to stop any virus. So, I mean, are we, like, where does this end? Like, okay, a mask now and then a vaccine later, I just looked today on the Florida COVID dashboard. And in Okaloosa County, we had 75 deaths out of 4,020 cases, which equals to 1.9% that have died. The median age is 40, okay? There are no studies to prove that children are super spreaders. And, if masks work, then why do we have to social distance? And if we have to social distance, why do we have to wear masks? Like I said, I've worked every day, during this whole thing, and I can tell you I've known one person that has gotten this virus. Okay, I realize there's people here that are worried about the older generations, people, the teachers, or whatever. But I feel like if, it's truly a concern, if the teachers are truly concerned, they can wear masks, But my child, I'm afraid of the long-standing psychological issues that kids are going to have later, I mean, honestly, I don't feel like school should have ever stopped. I think we jumped the gun. I think that, it's been hard. I work every day. My husband works every day. And my son has been at home by himself every day for 6 months. And I just don't think it's right. I don't think it's, I just think that, we're never going to stop viruses. We should not have to wear masks. I do work in a, healthcare setting. I have to wear a mask every day. I don't agree with it, but I have to do it. But I'm just saying, where does it stop? We are the parents. We should have the right to, say whether our child wears a mask or not, or whether we get a vaccine or not. So that's really all.
All right.
Thanks.
Thank you very much for coming tonight.
Thanks.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
Thank you. Hi, my name is Maddie Hensey. I live at 4059 Katz Court in Destin. Okay, so this is to the man that said that we're sheep. I'm not a sheep, and I'm not a faceless being. I'm attending collegiate high school as a sophomore. We've been in school for the past 2 weeks now with mandatory masks. I wear a mask on the bus for 2 hours in the morning, as well as all day long at school, and then again for my 2-hour bus ride home in the afternoon. Parents should not be able to opt their kids out of wearing a mask just because they think it's a hoax or a violation of their human rights. I'm referring specifically to Section D15 that speaks to exceptions. There's no way that a mask causes you emotional or psychological trauma. It hasn't to me or any of my friends. So at this time at school when we were wearing masks, we're also socially distanced. And this does not impair my ability to learn at all. I don't like wearing a mask, and it's an inconvenience and it's uncomfortable, and I wish that I didn't have to wear one, but I am still wearing one because I'm doing my part to stop the spread of COVID-19. I just want to say that I feel that if people can't accept the fact that saving lives and being safe is more important than their personal comfort, that they should choose virtual education. And the only way that school can be safe is if we follow all of the recommendations set forth by the CDC in their document, Operating Schools During COVID-19, and mitigate as many risks as possible. Thank you for your time.
Thank you very much for calling tonight. Okay, Miss Lori Miller, if you would, please approach the podium. and state your name, address, please, and you have 4 minutes to state your.
Hi, I'm Lori Miller, 4474 Sundance Way, Holt, Florida. I'm against the mandate for masks. I own a daycare. We've had 40 some odd school agers for the past 5 months. We've had no masks. And I don't know if y'all have ever been in daycare very much. There is no social distancing in daycare. But just to my school agers, we've had 40 children all in the same area, all using the same stuff. We have had 0 cases. 0 cases in our children, 0 cases from our staff. We haven't had any issue with this, and we have not worn masks a single day. If the opt-out works the way it should work, I'm okay with that. I fear that there's going to be bullying, there's going to be side shots and stuff on this, and I'm not okay with that. Bullying is not okay. I think that we have to protect our children, but I also think that they need to be social. They need to get out and be with their friends. They've been locked in homes. They haven't had the social interaction they need. They need to get back to school. But I don't think wearing masks is the way to do it.
All right.
That's it.
Thank you very much for coming tonight.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
My name is Sonia Vasquez of Fort Walton Beach. I was just calling. I work on Egland for clinical laboratory operations. I am for mandating masks. I've been reading and reading, but the reality is we all see the number of deaths, and yet the state of Florida has not even tried to mandate masks to see what works. Yeah, we scientifically, and I keep saying that we really don't know what this virus is. We really don't know what it's capable of. We really don't know if the kids are the carriers. We really just don't know, and we're not going to know until we at least try to mandate masks. I mean, if your kids have asthma as well as myself, I have heart disease. I wear a mask, and I don't only wear a mask for myself. I wear a mask to protect others. It's just I just can't believe how selfish people are when it comes to protecting others from this deadly virus. I mean, this virus, I guess because reality hasn't hit for them. Right there with people I work with, there's a guy, son passed, mother passed 2 weeks later, and I'm originally from North Carolina. My mother actually had COVID from my niece bringing her kids over to the house. She got COVID. My cousin ended up getting COVID. I had 2 classmates that have passed of COVID. Reality just haven't hit most of you, and that's the reason why a lot of you don't take it serious. Yeah, your kids can go to school, but your kids opt out or whatever. Masks should be mandated because masks actually protect you and they protect others. Is it fair for me as a mask wearer want to be exposed to someone that doesn't want to wear a mask and I get sick? Is that fair? Is that fair? No, I don't think it is. I don't think it's fair to anybody that's trying to protect themselves. We don't know what this virus is, and it's just going to get worse. Flu season is coming up. Schools are starting back. So we need to do the best that we can to protect the teachers, the bus drivers, because a lot of them have underlying issues. A lot of them are older, and we need to do what we can to protect our communities and our family and friends. I'm getting to the point where I'm just so sick of the whining, because what's the big issue about masks? It's not going to cause you. I'm actually a nurse as well. I didn't mention that either. It's not going to cause any psychological issues. It's not going to cause any problems to you or affect you, but it's going to protect you from this virus. It's too late once you get it, or your child take it home, or your child expose it to a teacher, and then you know other people are losing their loved ones out of disrespect for us not following CDC guidelines. I work in the medical field. I know the guidelines. I know they're saying masks should be mandated. It's not the kids, it's the parents. I actually don't think it's the kids, because as I was growing up, who's the boss? If I tell my child they should do something, that's what they're gonna do, is wear a mask.
Okay.
You know, we have to be their parents.
You have 15 seconds.
We have to be the leaders of this situation. This country is in a crisis right now, and if we don't never do what's right, it's not gonna get any better. Testing sucks right now, and they're also considering not doing as much tests for the people that are asymptomatic. They're thinking about not even testing them anymore.
Ma'am, your time has expired. And we appreciate.
Turnaround times on the testing.
Ma'am, your time has expired. We appreciate you calling in tonight.
Your 4
2 to
minutes are
3
up.
weeks for you to get your results right for testing. So you guys, we need to consider mandating these masks, please. Thank you.
Thank you. All right. Mr. David Keller, if you would please approach the podium. Please state your name and address for the record, and you have 4 minutes to present your thoughts and opinions tonight.
My name is David Keller. I live in Baker, Florida, 1423 Dan Barnes Road. I have 2 children at Baker School. One is a freshman, one will be a junior this year. I think we've heard a lot of arguments from both sides. And I want to start out by saying I'm not anti-mask. I don't believe that masks are bad or anything of that nature. What I am is anti-government telling me or my children that they should have to wear a mask. I have looked at both sides as far as like CDC, other doctors. I have sent the school board and Tim a study that was done specifically related to children. And so I would hope that you would take the time to take a look at that, read the article, take into consideration both sides. But I came to urge you to not mandate masks. I think that if parents want their children to wear a mask, then they should be allowed to have their children wear a mask. If parents don't think that they should have to wear a mask, then I think that they should have that option. So I'm not going to take up a whole lot of time. I'm not going to talk about things that don't really matter. So I just wanted to get that point out, and I thank you for listening. And you all have a good night.
Thank you, Mr. Keller, for coming tonight.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
Yeah, hi, it's Keith Fletcher, 111 Bermuda Way, Niceville, Florida, 32578. Thank you for letting me have the opportunity to call in. I wish this had happened 3 weeks ago, probably like many others, so we could have had the discussion and given you guys more time to plan. First, I don't know if you guys have looked around during the summertime and the spring when kids are off, but kids are with one another. They're interacting, they're playing, they're not getting sick. Why? Because like Mr. Morse, who I applaud for going and doing the research and using the data from not just one country, but multiple places where schools have been opened, that have done the tracing. And we're talking about genetic blood tracing to see if the virus has spread from kids to adults, and it has not, that they have been able to show. So there has been no proof of transmission in schools and most of these were European studies. There was one in South Korea. So I would urge you to take the data, because it's hard to have a discussion when people are emotionally in fear, all right? And there's a lot of fear because there's a lot of disinformation. So I'm not saying I have my data that I go out and get and I research. My profession is a systems engineer, where I look at lots of data and I'd make an analysis from that, and that's what I've done over the last 4 months. I used to travel a lot, and before all this mask mandate came down the last 2 months, people were out freely in the states of Washington and southern Florida without the mask and with some social distancing, and it was not the children who were getting sick. And as Mr. Morris said, that if you have the children in the ages between 15 and 24 are about the chances of getting the flu or dying from the flu are 1.5% higher than those with COVID. And those from the ages 5 to 14 are less than 1% of dying with COVID than they are with the flu. So if we're not shutting down schools, doing social mandates, or social distancing mandates and mask mandates for the flu, why are we doing it for COVID? There's no data. As Mr. Moore said, I'd love for anybody to make a presentation of data, not a projection of somebody's feelings or their hypothesis. Work on data. It's the only way you can fight through the emotional side of it, which I get emotional too, don't get me wrong. But people are in fear, and what they need is the data and rational leadership to do that. So I know people are worried. I got it. But when we go out, I can go out. I see people joining together in restaurants. I see people at events and venues. And I've watched the Okaloosa numbers drop, right? With more testing, there have been drops. Yeah, the death rate about a month and a half ago peaked up a little bit. The testing rate went up, and so did the positive rate. Those numbers are going down. We're actually heading, as one lady said earlier, towards a herd immunity. If there is no cure, if there's no vaccine, we can't have our kids for the next 3, 4, 5 years, every time a virus like this comes up, shutting down society and kids' education. It's just not right. We need to get past the fear and work with the data. I am totally against mandating masks. If kids and teachers want to wear masks, let them. And I thank you very much for your time.
Thank you very much for calling in tonight. And we have Ms. Karen Williams. If you would please approach the podium. Please state your name and address for the record, and you have 4 minutes to state your opinion.
Hi, thank you so much. My name is Karen Williams. I live on Michael Avenue in Mary Esther. First of all, let me say that I greatly appreciate the opportunity to be able to stand in front of you and give you my thoughts and my feelings. I am an administrator at a private school here in Okaloosa County, and I understand that you have a horrible decision in front of you. You have people like me who don't want their kid to wear a mask all day, and you have people on the opposite end of the extreme who are terrified and they want everybody in a mask. So my problem with putting my student in a mask is I just have some questions about that. Number one, they've been without face-to-face conversation for 24 weeks. That's a long time. 24 weeks is a long time to not have a teacher. In the beginning of the weeks that we did that last 9 weeks of school, they were able to, I have a middle schooler, so we used Edgenuity. We were not fans, and so when we sat down and we looked at what we had to do for this coming school year, we looked at all of our criteria. Okay, here's what the school's going to offer. I have the ability to keep my middle schooler home with me and allow him to distance learn. But Edgenuity was a train wreck for him. He needs people. He needs face-to-face conversation. He needs to engage. He needs eye contact. But more than eye contact, he needs to be able to smile at people and them encourage him. He luckily for us, he plays football, so he's been able to go and interact with his players and his team and his coaches without masks all summer long. So my problem is that now we've decided at this very short date, and all of that aside, you guys have said, we'll look at it, but school starts in 5 days. School starts in 5 days. It's Wednesday. By Monday, all these kids something has to be in place. If we allow the opt-out option, I'll be signing But I have questions about that opt-out option. How does my kid know? How do his teachers know in his block schedule? Oh wait, he's opted out. Well, he's also in band, so does his band teacher know that he's opted out now that they have to wear masks with little slits in them because he plays a brass instrument, which by the way has a spit valve in it that they have to dump somewhere. So all of those questions come to mind. And what I see is that you guys are in a terrible situation no matter what you decide. So I feel for you, but ultimately, as long as if you're willing to leave it in the hands of the parents, I take full responsibility for my student. I'm not going to send him to school with a fever. I'm not going to send him to school sick. I would hope that no parent would do that. I would hope that every parent would say, hey, you know what, my kid's sick, whether he's got strep or a stomach virus or the flu, and all of those things still exist. I'm going to keep him home because he's sick, and I don't want to get his teacher sick. COVID is a real thing. We know that it's a real thing. We know that people die, but the numbers in Okaloosa County are low, like 75 people have lost their life. How many of those were in long-term care facilities? How many of them had other pre-existing conditions before they passed away? And did they die with COVID or from COVID? I don't know. There's no study on masks and what the long-term ramifications of them are. They're not medical grade masks, so even our doctors can't agree on what's right. So while we don't know, and we don't know so much, instead of saying, well, let's just do it just in case it works, what if the ramifications of it are actually worse than the cure? What if the cure is depression and the cure is shaming and bullying right at the hands of their peers? Well, why don't you have a mask on? Well, who said? I know, I work with kids every day.
Ms. Williams, your
Thank you
time
so much
has
for
expired.
your-
Thank you.
Thank you so much for your time.
Yes, ma'am. Thank you for coming. We appreciate you coming. All right.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You have 4 minutes. You're live with the board.
Hi, my name is Taylor Palmer. I live in Niceville. I have questions about the younger children, and I'm not sure if this will be addressed later, but the kindergarten and pre-K age, if they will have to be part of the opt-out group or if they will automatically be opted out, and also if those students are part of that opt-out group, will they be educated on the importance of wearing a mask even though their parents have decided that they should not wear a mask?
Was that your only question, ma'am?
I had a statement after that, but if
Okay.
you're going to cover this later on,
Yes,
I will listen to the
Yes, ma'am. Yes, ma'am.
your
If you-
statements later on about it.
Okay, yes, ma'am. Mr. Chambers, I think you did want to just quickly answer the one piece there.
Yes, so first of all, appreciate the question. Within the policy, there is an exemption for the pre-K, the kindergarten, and some of our units that we have for students with disabilities. And that is an exemption in it of itself. Within the young kids, the kindergarten students, there still is an encouragement within there to wear masks, and teachers in schools still talking with those young students, about that. But there is an exemption built in this policy for kindergarten students.
And you may now go ahead with your statement.
Okay, so this will be my child's first year in an Okaloosa County school, and I signed her up with the understanding that the masks would not be required, and now I definitely feel blindsided at the last minute that this may not be the case. I think enforcing masks is definitely coming out of a fear of the virus that I totally get, but this virus is hardly affecting children. I think we are not really thinking about the repercussions that will come with instilling this kind of fear in our children and requiring them to wear masks.
And I'm really concerned that this is going to cause a huge amount of anxiety and worry due to the masks and social distancing. I fear that it will be a detriment to the development, especially for the younger kids, if they are forced to wear masks. Not only is it going to interfere with their breathing, but they will also not be able to see their friends smile. They won't be able to see their teachers smile. And it will interfere with them learning how to pronounce words and letters and vowels, things that they really need in these early years of school. So I believe everyone should have a choice whether their child should wear a mask or not. And I think it's unlawful to force everyone to wear a mask. I believe leaving the decision at masks being strongly encouraged is enough, and that the school board should not be allowed to go any further with their decision of forcing everyone to wear them. And lastly, everyone should have a choice. Teachers, administrators, and the school board should not be able to decide if my child should wear a mask or not, and it should be left to each parent of, or the parents of each child to decide. So thank you for your time.
Thank you very much for calling in tonight. Okay, Ms. Tina Wyman. Ms. Wyman, if you would, please approach the podium, state your name and address for the record. You'll have 4 minutes.
Yes, my name is Tina Wyman. I live here in Niceville. I'm against the mask policy. I, like a lot of parents, thought long and hard.
Scoot up just a little.
Sorry. I thought long and hard. Do I take them, bring them to school, let them go to school? Do I keep them online? Yes, there was some fear involved. I wanted them to go to school. I want them to be able to see their friends, because they haven't really seen their friends since this whole thing started. I think they'll get a heck of a better education with a teacher in school than online. The reason I said yes, the other reason was I was good with them going to school was because they didn't have to wear a mask. That was no, I'm not having my child or children wear masks all day long. I hate it. I'm very vocal about it. My family gets mad at me because of how vocal I am against the mask. I don't want it. People who want the mask, great, let them wear it. And if they feel that strongly that my child should wear a mask, they have the same option I did, to go online. If they don't want my kid to not wear a mask, keep them home then. If you're that afraid of COVID, I'm not afraid of it. I think it's a chance, but I think it's a small chance. And I'm not going to let my children live in fear. I don't live in fear. So I do have one question, because I'm telling you this, if the mask mandate comes in, I'm pulling my kids out of school. So do I, since you guys are throwing this 5 days before school, do I get to put them then online? Because I don't want them wearing a mask all day, and I don't trust the opt-out, because I think that's a way to shame my kid into feeling bad about not wearing a mask. And I'm not going to allow my kids to be shamed into being forced to do something that they don't want to do.
Well, I will just say that we haven't made any decision tonight, but if the decision goes and it's not what you think, I can assure you that we will, as always, make accommodations to take care of your needs for your children. So
I appreciate that.
all right.
Thank you for your
Yes,
time.
ma'am. I should say the superintendent and his staff will do that.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
My name is Alicia Beck. I live in Crestview. Pretty much everybody has already said, everything that I feel, and I know that a ton of other parents are feeling the same way, which side of the fence that they're on. It's not like something that we've ever lived through before. This is all new to us all, and as parents, we're all struggling to make the right decisions for our kids. And I am against the mandate to wear a mask, and I'm against it for multiple reasons. The biggest reason is I really don't see a point. There was a whole summer camp thing that was done, and there were no cases.
But my son, I know, I've been reading the comments, and I know that there's IEPs. My son's going into first grade, so though he has an IEP, this is nothing important for him. He'll most likely be exempt. But I do know that there's going to be other kids, kindergartners, that are coming into school that have severe speech issues, or even slight severe issue or speech issues, or you know what, they're just starting to learn sight words. So the biggest thing for my son whenever he started kindergarten was his teacher. So we didn't get the IEP meeting. It literally took all the way until February for us to get an IEP even set up with him, or even him being able to go to speech within school. So the biggest thing, what helped him be able to formulate words, was watching his teacher put her tongue on her teeth and her lips certain ways. And I also used to work with special needs kids, so I understand how big, two kids, period, whether they are special needs or, neurotypical or atypical, I know how big it is for a child to see facial expressions, to be able to, look at the expressions in the face. So I don't see how masks are going to help our children learn. I think that it will cause a lot of being sidetracked. And I've gone to Walmart. I hate going to Walmart. And I've worn a mask, and within like 30 minutes, my mouth was drenched. It was gross. My face mask was gross. I've gone into the mall with a face mask on, and I could smell what was at Bath and Body Works or Victoria's Secret. I've watched videos where people are vaping with masks on, and it's coming out everywhere. So I don't understand how we think that masks can protect others around us. And people are saying that masks don't even protect the wearer. It's just, you're selfish if you don't wear a mask because it's not about you, it's about protecting others. When majority of the deaths, not, excusing or not downplaying the deaths that have happened without people having underlying conditions, but most of the deaths are from elderly people and in nursing homes where medical equipment and safety precautions are made, and these elderly people are dying at high rates. So how is it really that effective? We don't know what this is going to do. The last thing, I was terribly afraid. I have really bad anxiety. I've had anxiety the whole time I was waiting to do this, but so I have terrible anxiety, and oh my gosh, I completely lost my train of thought with my anxiety. But oh my crap, where did it go? I don't know. Now I feel embarrassed because it's still on the internet.
You have 30 seconds. You have 30 seconds.
I don't know what I was going to say. Anxiety, about fear. I was insanely terrified of this virus whenever it first came out. I had no clue what it was. As everybody else in the world, we didn't know what it was. We didn't know what it could do. I stayed in my home for 2 months straight. I had everything delivered to me. I didn't go anywhere. And I'm a recluse anyways. I love staying at home. And it really bothered me. So
respectfully, your time has expired.
Do what? My time has expired?
Your time has expired, and we appreciate your comments tonight.
Okay.
You did a great job. All right, so Miss Kathy Riley. Ms. Riley, if you would please approach the podium, state your name and address for the record. You have 4 minutes.
Okay. My name is Kathy Riley. I live in Niceville. My daughter goes to Niceville High School. She's very excited to go back to school. I did tell her that as long as masks aren't mandated, she will be allowed to go back to school. So we're not really sure what's going to happen. Just a little bit on the fence about that. So anyway, that's kind of where I am. Also, I'm a speech pathologist, so I appreciate the last caller and what she was saying about kids learning how to speak. And it is really important that that kids can see our facial expressions. And we have a lot of nonverbal communication that they're missing out on. And I am concerned about their social health and their psychological health going forward. Everything, of course, there's different, you can read different things, but there are several things out there that say that masks are not effective. The New England Journal of Medicine did say universal masking in hospitals in the COVID-19 era. This was in May. It said, we know that wearing a mask outside healthcare facilities offers little, if any, protection from infection. Public health authorities define a significant exposure to COVID-19 as face-to-face contact within 6 feet with a patient with symptomatic COVID-19 that is sustained for at least a few minutes, and some say more than 10 minutes or even 30 minutes. The chance of catching COVID-19 from a passing interaction in a public space is therefore minimal. In many cases, the desire for widespread masking is a reflexive reaction to anxiety over the pandemic. Dr. Fauci and the WHO and OSHA experts have also come out and said that masks are not effective. Some of them have backpedaled after saying that, but they did say that. The Association of American Physicians and Surgeons also has put out a report explaining how masks are not effective to this virus. The CDC actually, I think on Sunday, just put out something that I'm going to read to you. It says, let's see, and this is off the cdc.gov website. While research indicates masks may help those who are infected from spreading the infection, there is less information regarding whether masks offer any protection for a contact exposed to a symptomatic or asymptomatic patient. Therefore, the determination of close contact should be made irrespective of whether the person with COVID-19 or the contact was wearing a mask. Because the general public has not received training on proper selection and use of respiratory PPE, and cloth masks are not considered PPE, by the way, it can not be certain whether respiratory PPE worn during contact with an individual with COVID-19 infection protected them from exposure. Therefore, as a conservative approach, the determination of close contact should generally be made irrespective of whether the contact was wearing respiratory PPE, which is recommended for healthcare professional and other trained users, or a mask recommended for the general public. So why haven't we instead recommended proven immune boosting strategies like taking vitamin C? There's lots and lots of data and reports that prove that vitamin C will completely protect you from getting this virus. Well, we can't control that. We can control people wearing masks. So I'm totally against control. I know a lot of this is about fear. It's about appearances.
Yeah, 15 seconds.
Okay. We right now we have a death rate in Okaloosa County of 0.0003, and that's with the elderly and long-term care patients.
Right.
So I'm sorry, I can't go on.
That's
but-
okay. Thank you very
Right.
much for
Thank
for
you
coming
very much.
tonight. And I noticed that you're from Texas, it looks like. I hope your family, there's nobody in the line of the hurricane tonight, so.
Thank you. There are. Thank you.
Yeah.
All right.
All right.
We have 3 blue cards remaining.
For the outside? I mean, on the phone. Okay.
This is the Okaloosa School Board Public Comment Line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
Thank you. My name is Lynn Dyerly. I live in Niceville, Florida, and I've been teaching in the Okaloosa County School District since 1994. I teach 2nd grade, and this year I have more than 20 students assigned to my class. We've taken out extra furniture that was in there, we've removed everything, and I am unable to socially distance my students in that class. I've done a lot of research and I've done a lot of reading, as many have, on this virus, and things have changed. It's a novel virus, which means it is new, and we're learning new things all the time. When we first started to close schools and we looked at everything, we were focused on formites, the things that are on surfaces. That's now changed, and we're looking at aerosol virus particles as being the primary spread of the virus. In the state of Florida, in the last 3 weeks, there's been a 139% increase in COVID-19 cases in children between the ages of 5 and 17. That's not surprising. When schools closed, when closed businesses, people went out and purchased food and did things, and they left their kids at home. As we've allowed them to go out and socialize more, be in school settings and camp settings, there's been a considerable increase. One of the things that I don't think has been addressed this evening is that this is a novel virus. It means it's new. It means we do not know what the long-term health effects on our students will be. They may be asymptomatic, they may have slight cases now, but we don't know what's going to happen a year from now. It appears to be primarily a pulmonary disease, and it may have very long-term effects. In my classroom, a lot has been made that this affects older citizens and not the children. In my classroom last year, more than half of the students had grandparents who lived in the home with them, either because it was an extended family situation or because they were in the care and custody of their grandparents. Our families are together. If our children are getting it, they're going to be passing it on. I'd ask the board to have a masking policy. In areas where there has been masking, the virus rate has dropped dramatically. There is a possibility that if we put a mandated mask in our schools, that we will end this cycle of the virus sooner rather than later. To paraphrase the superintendent from South Florida, we're not going to know if the board passes this mask mandate, whether or not they overreacted. But we need to err on the side of caution. I don't want us to find out 3 weeks from now, a month from now, that we didn't require masks and the numbers have gone up. We have few substitutes in our school district. We can't afford for teachers to be out for extended periods of time without school. I love my students. I want to be there for them. I want them to be safe. I have added things to my own classroom, put in HEPA filters, and done things that I can do to help make sure that my students will be as safe as possible. I want them back under the school roof. I want to be there with them. I don't enjoy wearing a mask, but I want them all to be safe. So I'm asking you to please enact the mandate for masks without the opt-out clause.
Thank you very much. Your time has expired.
Dress codes, we can do this.
Yes. Thank you very much for your time. We appreciate your comments. Okay, Miss Lisa Stanley. If you would please approach the podium, state your name and address for the record. You'll have 4 minutes.
Lisa Stanley. I live in Baker.
Okay.
My kids go to Baker School. I have a 6-year-old going into 1st grade and a 10-year-old going into the 5th grade. I'm not going to stand here with statistics. I don't have them. Other people have been versed with that, and I'm not going to bore you with it because you know there's always 2 sides to every story. I don't know which side is right. Neither do you. I mean, you're sitting in a position where you are here to safely, healthily educate our children. When we decided, or you guys decided, that you were going to take our kids' school start date 3 weeks back, and you're going to push it back, that should have been when we had this discussion. Now we are 2 working days before our kids go back to school. I have a son with an IEP. It's a non-situation for him. He won't be wearing a mask if it makes him uncomfortable. I'm going to let that be his decision. He's 10. He can tell me. But you've put me in a position where if you pass this without the opt-out, that now I have to get into his doctor's office and get permission to bring to his school to have him not have to wear that mask, or wait for his IEP team to write it into his IEP. And I can imagine that they're going to be bombarded with parents that want to do the same thing for their child. I have a 6-year-old who started at a very bad disadvantage at Baker last year. He went into a classroom of kindergartners with 36 kindergartners and 2 teachers in one classroom, a regular size. It's actually smaller than this. 36 kids. We're overcrowded at Baker. You say they're not going to have to wear their mask if social distancing is an option. Is social distancing an option for my first grader this year? Because those same kids, they're going to first grade with him. And how many, what's the percentage, Mr. Chambers, of kids that are opting out for virtual school? 25 to 30%? How many of those kids at Baker? Because those parents are hardworking parents, and they can't opt to stay home for their kids to be in virtual school. Luckily, I have a job where I will be at home. So if you push this mandate and I have to jump through hoops 2 days before I have to send my kids to school, I hope that you're going to give me the option to do virtual school. And it really puts me at a disadvantage because it is something that every single parent in this district has just questioned, am I making the right decision? Because we don't know. And I don't mask shame. I understand that you have the right to wear a mask when and where you want to. And we live in America, and I'm glad that you have that right. But I also have the right that if my kid is 6 years old and he says, Mommy, I don't want to wear this mask, it makes me feel uncomfortable, or I can't breathe, even though he doesn't have a medical condition, I should be able to say, you know what, Nate, you don't have to wear that, because I don't want you to be uncomfortable. So we're not just making a decision based on facts or what does the doctor say. You had these options when you gave us the option to go to school or to stay at home. This was not an issue. Mask mandate was not an issue until last Thursday when Mr. Chambers, thank you, decided to give the parents a voice, the community a voice to stand in front of you and say, I do or do not want my child to wear a mask. Unfortunately, that came a little too late. 2 days before I'm supposed to send my kids to school. Come on. You're doing us a disservice. You're doing our kids a disservice. And now we have to defend ourselves for our decision 2 days before our kids go back to school. Thank you. I appreciate the job that you do. You volunteer your time. I appreciate the job that you do and the job that you have ahead of you and the decision that you have to make. Thank you.
Thank you very much for your comments.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
My name is Dawn Martin. My address is 2352 Barbary Drive, Crestview, Florida. I want to thank you for giving me the privilege to speak tonight about the mask. I am for a mask mandate. I am a ESE parent. My child has an IEP. She goes to Richburg here in Crestview. I have had 2 relatives die of COVID, and it's not very easy. My child should have an opt-out for her to not wear a mask, but I mandate she does wear one because I need my child to be protected. My child has so many issues that if she catches COVID, it is a guarantee that she's going to die. There will be no saving her. Many children are asymptomatic. I live in a household where I have 2 elderly parents that I take care of, along with her and myself. If any of us catch COVID, we are going to end up in the hospital and the outcome will not be good. And the children that we're going to catch it from are the asymptomatic. Many of the teachers at Richburg, I know for a fact, are the age of 40 years of age. They are at higher risk for COVID. I have children that go to Crestview High School, my nieces and nephew. I've asked them that they wear a mask in the halls of Crestview High School because of the fact that there is no social distancing. They can't get away from anyone because the halls are too small. And it's not about whether or not they should, it's about respect for others and respect for those around them. You may not
know who has the illness. And you need to think of others before you put yourself first. And that's what I'm hearing a lot from parents tonight is the I. And I wish that many would stop and think about those around them first. Yes, my child has autism. No, she shouldn't wear a mask. She has too many medical conditions that would mandate that she doesn't wear one. But I, as the parent, make sure she does. Many of our ESE kids would be in that opt-out because they cannot wear the mask cognitively because they can't understand why they need to or their medical conditions prevent them from. Here's why we need the kids to wear the mask who are around them, that cognitively can wear one. They understand why they should. They need to protect those kids who can't. How would you explain to your child who was asymptomatic and gave it to their friend and their friend got sick? Or their teacher got sick and they, pray to God it doesn't happen, but their teacher gets sick and dies? How are you going to explain that to your child because they were the one that was asymptomatic? That's why I feel that we do need to wear a mask, and I thank you for giving everybody the opportunity tonight to speak their voice, and thank you again.
Thank you very much. Okay, so Mr. James Gump, is that correct? Okay. Mr. Gump, if you would please approach the podium, state your name and address for the record. You'll have 4 minutes.
Thanks, sir. Thank you, ladies and gentlemen. Appreciate the opportunity to be here. James Gump from 2629 Edgewater Drive here in Niceville. I have 2 kids in Niceville High, 2 at Ruckel. I do appreciate the opportunity to speak and be heard. I think there's a reason that Rockwell decided to use a board meeting as his depiction of freedom of speech when he painted the 4 freedoms. So I appreciate that opportunity, and I appreciate the people who came before me who give their opinion one way or the other. I do find it interesting, but not necessarily surprising, how the in-person attendees and the remote attendees in the board meeting seem to have biases toward the opinions differently on the issue. Having sit back there with all the in-person attendees, we definitely you can tell how we feel. But it's interesting, and I think that's telling as far as what can be done as far as your children attending versus not attending if they don't feel a mask mandate or with an opt-out clause is a good option. I do think mask use is a good thing. I don't think the good necessarily outweighs the collective risk. Florida is on the backside of its curve right now. Could that peak reoccur? Absolutely. Are children at school at great risk? No, I don't think they are. A lot of people have given the better stats than I have available to me right now, but the student-to-student transmission rates are low to non-existent from the studies that have been published about COVID-19, and the number of people who died under the age of 24 in our country was in double digits, at least as of a few weeks ago when I last checked, in a country of 330 million. If you don't feel it's safe for you, I'm talking to other parents, I guess, for your kids or your parents, just like you chose not to personally attend this meeting, then you have the opportunity to not attend school in person and do online school. But this is America. You can speak your mind and make your choice. I appreciate that. But I feel that our kids need to be back in the swing of things. They need their routine. This is not 100% germane to masks, but I am frustrated with that non-athletic extracurriculars are not being allowed. A lot of the kids who are at risk for depression and self-harm aren't necessarily athletes, but the other clubs and activities that they have are things that keep them attached to their friends and their school. I'm also frustrated, like many others, that this measure was not proposed prior to the decision time frame for opting in or opting out of in-person schooling. So at the minimum, an opt-out for the mask mandate must be maintained. Just to be clear, I do not support a mask mandate, but if there is going to be one, I support the opt-out clause. I feel it is necessary, especially given the late time frame. I do have a few questions that I don't expect you to answer now. It seems like most of them have been brought up, but if the given the opt-out scenario, basically the question of how that child is going to be identified. Do they have an identification card or some sort of thing? If they lose that card, what will happen then? That sort of thing. When the measure was read, it mentioned that visitors will have to cover their face. Does that include parents? Because if I'm opting out for my children, can I opt out for my children but not opt out for myself? That doesn't seem to make a lot of sense. Or does that mean non-parent visitors, etc.? And then I just am curious as to how the CDC's updated guidance regarding asymptomatic people no longer requiring tests, if that's been thought of. I mean, I know that came out on Monday, so that's not exactly something that happened prior to this question being launched. But if that has weighed into your decision-making process, so that's all I have to say.
All right, thank you very much, Mr. Goh. We appreciate you being here tonight.
Mr. Mitchell.
Yes, sir.
When you're done with that, I need you to look at one thing for me, please.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
I'm Deborah Bryan. I live on Wild Horse Drive in Crestview, Florida. I appreciate the opportunity to give my opinion. For the record, I'm against a mandate for masks. I think it should be up to the parents. You have been inundated with data. You have just, you've had it every which way that it's out there. Let's use some common sense. In the nursing homes, if the employees are wearing the mask correctly, why are so many of our elderly getting sick and dying? If the masks work, just common sense. Also, if the masks work, why can't we visit our elderly if the masks work? When a child has to go to have a procedure at a doctor's office or in a hospital, if the masks work, why can only one parent go in with them? I appreciate your time. I just wanted to give a different opinion. Thank you.
Thank you very much for your call tonight. Okay, so we're going to do another phone call.
Yes, the next speaker has a slight delay.
Okay.
From out there, but I believe it's the last one.
Okay.
But we're going to go ahead and put another call through.
That's fine. That's fine with me. There we go.
Mandy, I lost him. Put another one through. I need to tell you, Mr. Chairman, that we do have a lot of people still calling.
That's fine.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You will have 4 minutes. You're live with the board.
Thank you. My name is Christy Sappho, and I'm in Shalimar, Florida. I want to say, as an educator in this county and a parent of 4 children that are at 3 different schools, I was very relieved when you first proposed the mask mandate. I was very disappointed when the option of the opt-out came out. We need to learn from the districts around our country and around our states that have started school without a mask mandate policy and just after a few days or the first week ended up going completely online. For example, districts in Georgia. These mandates of of strongly recommended masks were part of this problem. If our schools go completely virtual, here's one big issue we need to think about. There are children that have been suffering at home due to abuse of all sorts of kinds who are waiting to come back to school for a teacher to notice or talk to. Those are not going to be able to be dealt with or identified if they are having to go back to virtual. Our surrounding base commanders have mandated masks since this fall, or since this all began. They have kept the rate of transmission low. The base commanders are very concerned of keeping our community safe, as well as keeping the mission of our military a priority. OCSD's mission should be to keep our students safe as possible while providing the best education we possibly can. And this, we need to be mandating masks without an opt-out option. I fear one of our biggest problems that we will have with this opt-out is the amount of peer pressure and ridicule and bullying that will happen to children, whether it be mine or any other child in this county. One staff member, one child getting sick, ending up in the ICU, or worst case scenario, dying is too many. One board member has previously stated before about trying to allow teachers to make the decision in their classroom, and then saying that allowing that decision to be made by the teacher is sending a mixed message. How is a policy that is mandating but then giving an opt-out not a mixed message as well? We have had recommendations from our health department, and our neighboring districts have even made masks part of their dress code policy. A mask is no different in a policy, just like a dress code. We require a certain dress code, and a mask would not be much different. Finally, one thing that needs to be thought about is if we end up having to quarantine a group of students or teachers, those students are losing out on that part of their education while they are in quarantine. We need to be able to keep these kids in school, as well as our teachers. So for the safety of our students and our staff, I please ask that you mandate without an opt-out policy of just parents wanting to opt out. IEPs, 504s, special needs, definitely a consideration. But as our county has had a motto of since last year, everyone is important. I will wear a mask to keep you safe, and you wear a mask to keep me safe. Thank you for your time.
Thank you very much for calling in tonight. We're going to take another phone call.
Yes, sir. But before we do, I need to let you know that we still have a lot of people calling in on the lines. It's very important when someone makes a call in to the school board that they call the 833-3100 number.
Okay.
There should not be any need for them to punch an extension or anything like that. It's just going to be, it's going to take them down a path that won't get them to where they want to go. If the line is busy or no one answers, just keep calling until you get through.
Right. And the phone number that is on the screen right now is the number they should be calling.
That's correct. The phone number that's on the screen, we may have to put it back on the screen, but the phone number that's on the screen is the one they should be calling.
Okay. Thank you, Mr. Mitchell.
So, Mr. Chairman, after this next call, I respectfully ask for a quick break.
Yes.
Would that be possible?
Yes, we can
Thank
do
you.
that.
You're going to have to take a tape break within the next 10 to 15 minutes anyway.
Okay. I'll
We're
do
good.
that.
Okay.
That's fine.
All right.
Go ahead and put the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
Good evening, board. My name is Mike Blauvelt. I am a resident in Niceville, Florida. I live on Bimini Way. I have a couple of points in favor of the mask mandate without the opt-out provision. The first is nothing has changed since July, when the Florida chapter of the American Academy of Pediatrics recommended as part of their Safe School Reopening White Paper that masks should be required or worn by all students, all staff, all people in schools. That recommendation hasn't changed. I know there are studies here and studies there, but Florida pediatricians say masks should be used in the schools. If we're going to err on one side or the other, I recommend we err on their side. The second point I would raise is that the percentage of comments tonight that have talked about my child will not wear a mask demonstrates that the exception to opt-out obliterates the rule. If all of these parents, if this is a representative population, then the rule has no effect. You will not get the 90% or the 95% that Dr. Chapman previously told the board back in July was necessary. So that exception takes the rule and makes all of the hard work that goes into the rest of it effectively useless. And a final point I'd make is one of the things that that I was really proud of with the Okaloosa County School Board was you took the delay. You said, we're just going to pause. We're going to see what the situation looks like. And we got the benefit of seeing other school districts. And we've seen in just the past 15 days, 20% of all pediatric cases in Florida, 9,000 of them, have come in just the last 15 days. And it's strange to me that 9,000 cases just among Florida children is sort of under the radar when we think that back in March and April, if we had 20 cases across the entire state, that was a day worth reporting. And now 9,000 children alone in 15 days sort of falls by the side. And those are schools who, just like you, try to do the very best for their students, try to make sure that their students, their staff were as safe as possible. And we still have 9,000 new Florida children sick. So I recommend erring on the side of caution, erring on the side of the American Academy of Pediatrics, and doing the mask mandate without the opt-out provision. Thank you.
Thank you very much for your phone call. We're going to take another phone call.
Then we can take your break. The phone calls are going to be lined up for.
Do we need to do a tape change then?
We can do the tape change now. Absolutely.
Okay, so do we need 5 minutes?
More like 7.
Okay, so I'll recess this meeting for 7 minutes.
Hold for me just a second. We haven't started recording video yet, so give me just a second, but I've got you. You're the next one in line.
And you're doing a great job.
Thank you.
You're welcome.
All right, Mr. Chairman, we're now live. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hi, my name is Bretta, and I live in Baker, and I'm one of your school bus drivers. I have a medical condition, which, according to the ADA and the CDC guidelines, says that I'm not supposed to wear a face mask. I have the students on my school bus distance so that they are at the 6 feet. They also have minimal contact with me because they'll be passing past me to go to their assigned seats. I would like to be afforded the opportunity to participate in the opt-out if it is passed. And I think that should be given to any of the staff members in Okaloosa County. That was basically it.
Okay, well, thank you for calling, and we appreciate all of our bus drivers, too.
Hi, thank you, sir. Y'all have a good evening.
Thank you.
Bye-bye.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
My name is Matthew Sparks. I live at 703 Bradford in Fort Walton Beach. And before I say my statement, I'd like my daughter to say something, if that's okay.
That's fine. You got 4 minutes.
Okay, go ahead, Eddie.
My name is Evelyn Stokes, and I think that when you wear a mask, you're protecting other people more than you're protecting yourself, and that it will influence others to wear the mask.
You know, Abby?
Yeah.
All right, thank you, Abby. All right, if you couldn't hear her, she said that she thinks that you wearing a mask will protect other people, not necessarily yourself, and that also encourages other people to wear their mask. And she's a 3rd grade in Fort Walton Beach schools. She's 8 years old, and she wanted to say something tonight, so I wanted to give her a chance. I myself, I'm a military veteran. I served in the Air Force for almost 12 years, and I'm currently a military contractor on Harbor Field. We have 4 children, all in the Okaloosa School District schools. Currently, on every military base that I know of, masks are mandated, both by the military and the military leaders are just about begging any community members that come on base to wear those masks as well, to protect both the military members as well as the community at large, to ensure mission success and the safety of their members. Medical folks, that is required for them. Government is taking this seriously. Obviously, it is a concern for school officials. Otherwise, you guys wouldn't be holding this meeting right now. The opt-out option, I think, is not acceptable in a mask policy. As you've heard tonight, there are many folks that are very much against the mask policy. If the opt-out policy is open for everyone with no restrictions, too many kids are going to opt out. Too many parents are going to have their children not wear it, and it is going to do no good. The mask policy only works if the majority of kids are wearing those masks. It is just like the social distancing. It is just like the hand washing. It is just like the plexiglass protections. It doesn't work in a vacuum, and it doesn't work if it's only done as a half measure or even less. I think we should listen to our public health officials. We should listen to the experts that are saying this is what is needed. It's not about protecting the person with the mask. It is about protecting all of us together as a community, not just those individuals with the mask. Just like all those parents are saying that we should have the choice to wear the mask or not, I should have a choice to send my kids to a school in person, which is what we want, where they're going to be safe. And that's what I feel that we should do. We should have a mask mandate that is, there's no opt-out policy. There is reasonable exceptions for those that require it, or in situations where a teacher might need to have their face uncovered so a student can see how they're talking. Or for kids with special needs, we have two ourselves. We understand that. But to have anyone be able to opt out for any reason is just like having no mask policy at all, and it will only increase the number of cases that we're seeing in our area. Thank you very much for my opportunity to speak, and good luck on your decision.
All right. Thank you very much, sir, and we appreciate your service to our country also.
Thank you.
We're going to do another phone call.
Go ahead and put the next caller through, please.
She was making signals at you.
Well,
She forgot her number. She'll come back.
that's fine.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
My name is Christine Newcomer, and my husband already gave our full address earlier this evening, Michael Newcomer. I would just like to point out, while he was interrupted by Mr. Bryant saying that Ms. Chapman, Dr. Chapman, did not give guidance or suggestions regarding face mask policy while he was interrupted and trying to illustrate a point about the science that she provided Dr. Whitelist, who then forwarded it to us. That indeed that they did receive guidance from Dr. Chapman and some recommendations. And just to say that it's kind of unfair that he was interrupted, was not able to finish, and his time was taken because he was interrupted. I do not agree with the opt-out at all, and I don't think that parents should have to ask permission to make medical choices regarding interventions for their children from the district. I am opposed to opt-outs, and I would like the policy to reflect strongly encouraged the way it was written before. Thank you.
Thank you very much.
Go ahead and put the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Yes, my name is Monica Traxler. I called in earlier this week, so I've already given my address, but I live in Niceville. I'd like to thank Dr. Chambers, or Superintendent Chambers, board member Mr. Vanchek, Mr. White, and Ms. Kelly for responding to my emails regarding whether we were going to keep school closed because the pediatric Florida's decided that, it should be under 5% or less. So now my question is about face masks. I do not believe in the opt-out. Like others have said, there's obviously no need to have a policy if you're going to let anybody opt out. But for some of the people that have spoken that have talked about percentages and that children can't carry it, I would just like to say, while I've been on this call, the August 26th Florida Department of Health pediatric Florida resident chart does say 48,928 children under the age of 1 to the age of 17 have been tested positive for coronavirus. 611 have been hospitalized, and there have been 8 deaths. There has been studies show that young children carry as much coronavirus in their nose as adults do. A second grade class in Florida had to quarantine already after opening because a child tested positive. The parents who think that they want a continuity of care or of teaching and they don't want their kids to have to wear a mask, they must also think about when someone does test positive, they're going to be quarantined. They're not going to be set up on the online program, so they are going to miss things. Our teachers don't have a choice They have pretty much been mandated to have to go back to class. I know that some have asked for accommodations. I'm not sure how that is in our county. I know in other counties, some teachers have not been able to be given those accommodations. We have a dress code. You have your child make them wear a dress code. You have them wear a seatbelt when they're in the car. So I think that it's not, you shouldn't be upset that we're allowing or making children wear face masks to protect our teachers. There was a 7-year-old boy in Georgia who drowned after having a seizure from a high fever in the bathtub from having COVID. So these children might not die directly from COVID, but they're dying from other things. They're spreading them to other people. If you do decide to go on and take the opt-out out, I think parents should have a choice to decide to keep their kids home if they would like. And I just really wish that all of us would think about others, and the masks protect others. And I do believe that the reason why our numbers are low in Okaloosa County is because one of our largest employers, which is the base, are wearing masks and are protecting our community. If you keep the opt-out in, you're going to not be protecting our community and our teachers and our staff. I'd also like to ask a question. I've seen in other areas of the state that it has maybe been said that teachers, if they don't have symptoms but they have been exposed to the COVID virus, would be allowed to stay in the classroom and teach. Is that going to be the case in Okaloosa County?
No, ma'am.
Okay, so they will have to quarantine. Is that true?
Correct.
Okay. And then I'd also like to ask a question. Someone mentioned that the board members tonight were not wearing masks. But I would like to ask a question from what I can see
you have
on
15
my
seconds.
screen. It looks like your shields go out past your desk. Is that correct?
Yes, they do.
Okay. So you have an
Ma'am, I
extra
hate to interrupt
You're
you.
not wearing.
I hate to interrupt you, but your time has expired. We do have other callers to get to.
Okay. Could you just answer this one question?
I'll
Because you-
go ahead.
Okay, you guys have an extra protection, and I think that that's great. So I don't have a problem necessarily with you not wearing masks. But what I'd like to ask is that every picture I've seen online of our desks in schools, the dividers don't go out past the desk. Is that correct?
I honestly can't answer that, but that will be something we can discuss here when we get into a discussion on this policy.
Okay, because I'm just saying, the people are saying, oh, there's dividers, but they're not really protected unless their head is inside the desk, inside that divider, if they indeed don't go out past the desk. So that's all I had a question about.
Okay, thank you very much. Thank you very much for calling in tonight, and we do appreciate your comments.
And thank you for your time. I know I might come across harsh. I do appreciate everything you're doing. I'm just very passionate. Thank you.
All right, you're welcome. Okay. Taylor Kennedy. Ms. Kennedy, if you would please state your name and address for the record, and you'll have 4 minutes.
All right, thank you. It's Taylor Kennedy, 1624 Florence. How are you guys doing tonight? Having fun yet?
Always.
All right. First, I wanted to commend all of the parents who have come up here, whether they're for masks or against them. We should all be encouraging our parents to become advocates for their children. That is the most important thing we can do. I want to let them know I don't think they're selfish for fighting for their child, because I would do the exact same thing, and I'm doing that right now. So I want them to know I have a lot of respect for them. I know it's hard to come up here. But I do believe that it's important for us to protect those we entrust to educate our children. I'm less concerned about what happens with our children as far as them contracting it. I'm more concerned with our educators, who we desperately need. Because when we talk about normalcy, consistency, mental health of our children, consistency and normalcy without having to have substitutes, without having to have our doors closing, without having 2 days of break and mom having to figure out who's going to come home for those 2 days because she can't take off work now. These are the things we really need to think about. If we can create something that makes it easier for educators in a classroom. I trust the teachers to make decisions for my children. I trust them. I think they're smart. I think they're strong. I think they're brave. And they're going to be our heroes now. And we need to treat them as such, which means we need to protect them as such. But they have that ability that if they know they're socially distancing in their classrooms, guys, take a break from those masks, all right? You know, I know we haven't seen each other. We need some human interaction. Let's do that. Let's trust our teachers, but let's make sure that they feel safe. Let's make sure that they feel safe enough to say, hey, you know, we can take this off for a little bit. Let's take a break. Because everybody's complying. Everybody's being all right, you know, and we don't have a this side versus that side. Just kind of everybody's stuck in this weird spot. And we can work in a united way together to get there, to get where we need to go. So I just want to commend all of the parents. I don't want this to be a negative. I don't want it to be a political issue. It's not. It's just, we don't know enough. Let's trust the people to take care of our kids, educate them the way we need to so we can get on with our lives, go to work. Let's thank them. Let's make sure they have the soap, hand sanitizer, supplies that they need. And I'll tell you what, any teacher, you come find me on Facebook because I will go and yell at the county commissioners and I will get you what you need. I'm telling you right now, I will. I'll do it. So let's make sure that the teachers feel safe. And if this is what they want, let's give it to them. Let's empower our teachers to teach and to, you know, educate our children on how to be kind to each other, how not to make this about anything other than what it is. We have to do that for each other. We have to set the example and let our teachers do it. I trust them too. Thank you.
Thank you. So Eric, no more in-person? No more in-person out?
No more, that was the last one.
Okay. I do want to just make just one quick comment and just remind people that there is a 4-minute time limit because we do have so many speakers and we do appreciate comments, but please, let's keep it within the 4-minute time frame. And if there is questions, a lot of these questions are going to be answered when we get into discussion, so just a reminder on that.
You have got the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hi, my name is Gabrielle Ferris. I live in Niceville, Florida, and I'm a sophomore at Niceville High School. First off, I'd like to talk about how there's hardly any other students on here. And I noticed that's because we have a very much lack of communication between the students and teachers and the schools in general. And I know I and my classmates do not feel informed on any of the subjects or going-ons and happenings. Second, I'd like to say forgive my language here, but I feel like it's a bit selfish of some of the parents to say that they feel they don't want their children to be uncomfortable in their mask, because I know that I, along with my classmates, a lot of us are high risk. So, I mean, how uncomfortable are you going to feel when you tell your child it's okay, you don't need to wear a mask, and then, I or one of my high risk classmates are on a ventilator? Because that's not going to be very comfortable for us either. You don't know who's high risk, who you're passing in the hallway, who, might be diabetic, might have cancer. You don't know. I myself am a diabetic. And if I got COVID, I mean, frankly, it would not be a pretty situation. So it's considerate, and it's frankly a lot smarter for students to be wearing masks. And it shows that, you're compassionate to each other. I mean, as the school board's been saying, everyone matters. So saying that you don't need to wear a mask because you're uncomfortable, that doesn't portray the message that everyone matters. On another note, the dress codes, that doesn't make sense to have a dress code and say that, girls can't wear a spaghetti strap tank top in 90-degree weather with 75% humidity. But then you can say, I can't control whether or not, you wear a mask to protect your lungs and your respiratory system. It's, the same thing. It's along the same lines. But you're saying you can't control one because maybe you're showing shoulders and the other is you're uncomfortable in the heat. It's the same thing. So another thing is I noticed, like some of the people before me have been saying, a lot of our community is military, and they are, we're one of the reasons our numbers are so low is because the base has been enforcing masks. They've been encouraging their employees to wear masks, a lot of the service members to wear masks. What's the difference in, our service members wearing masks and teenagers wearing masks? There should be no difference. In fact, we should be, more strictly enforcing those as we're children. I think that's about all. Thank you for your time.
All right. Thank you very much for calling in.
Thank you.
Next caller, please.
Yep.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
My name is Kelly Cord. I live at 2779 Willow Bend Court in Crestview, Florida. I am a long-term substitute in an elementary school in Crestview, Florida, and this is my 3rd year there. I also have 2 children that attend in 4th and 5th grade at Crestview Elementary. I feel like masks are one of those things that it's better safe than sorry, and we've always kind of taught our kids that as well. It is better to protect others and suffer a little bit of uncomfort for ourselves if we know it's for the greater good. However, I do feel like there is a compromise that is available to the school board as far as mandating masks in common areas. Not necessarily in the actual classroom where the students will be spending the vast majority of their days, because to be honest, most students, even my own children who are 9 and 10 years old, I know wearing a mask all day long in a classroom is going to be distracting. But we also recognize our duty to protect others. So mandating masks in common areas such as hallways, bathrooms, lunchrooms until they're eating, libraries, anything where they leave the classroom that they spend the majority of their time, I feel like is one of those safe options. And it's not a harmful thing for our children to do, especially if they're doing it only in the common areas. For those who are worried about reduced oxygen and whatnot. And it's just something that we can do to compromise to help reduce the risk of any of us sharing things that we don't want to share with other students, and to minimize the discomfort in the actual classroom. As an educator, I will be wearing my mask in all common areas, whether it's mandated or not, but I really hope that the school board considers all of us and our students, and then also the family members at home, extended family that our children are going to see, grandparents, aunts, uncles, they might live with grandparents, people that they might bring something home to. And that is more my concern than my own personal self getting COVID, and I'm in the school every single day. I'm not concerned about me. I'm concerned about the relatives, the family members, those who we might share it with. And so I would just hope that there would be some sort of compromise where we could have a mandate, but not necessarily be all day long. That would maybe, hopefully, possibly appease the majority of the people. Thank you so much. And I want to thank each of you for all the hard work you've been doing. I know how stressful this has been, and I cannot even imagine the pressure that has been on you to make the decisions that you have been making. And we appreciate each and every one of you as faculty. I cannot tell you how much we appreciate you and all the stress that you have put on yourselves and all the things that you have done to ensure that Okaloosa schools will be safe for our students returning next week. We are grateful, we see it, and we appreciate you so much. Thank you.
Thank you very much. Appreciate your comments.
Right at the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You have 4 minutes. You're live with the school board.
Thank you. My name is Robert Dittman. I live in Crestview. My question for the board is really about how we got here and the process and logic behind this policy. And now several callers have asked the question of why you waited till now and didn't receive an answer. I would add to that, I'm curious what the logic and decision-making process, the planning was, that created a policy that is basically self-negating. On the one hand, you're saying that we have such an important, urgent situation that it requires a mandated PPE rule for our schools district-wide. But on the other hand, you're saying that it's so not important that any one parent or all the parents can just opt out, ignore it, and let their kids infect everybody else. And, before I think the public can make a decision on whether they're for this or against this, we deserve an explanation of the thought process that got us here in the first place. And I would respectfully ask that the board not state me for my comment, but instead actually answer the question. Thank you.
Okay, so we have a couple of minutes with his time. Okay. Mr. Chambers, would you like to start?
So when you go back about from the point that we created our safe schools reopening plan, we were looking at strongly encouraging masks where social distancing can't be maintained. I have stated along the way that we would continue to listen to parents. We would continue to listen to employees. In fact, we actually surveyed employees, and we've asked our schools to also even do temperature checks, so to speak, to see where employees still lie. So we've continued to listen to employees. We've continued to listen to parents and the community as we've got closer to the start of school. Now, I shared earlier that we got to Thursday at the board workshop, and I asked the question because over the last number of board meetings, we've had I think one board member who may believe that we should have a requirement. We've had other board members discuss whether or not we should be looking at a requirement. So last Thursday, I posed the question, to the board, where would we like to be in terms of a mask mandate or not? At the end of that discussion, it was determined that we would look towards a mask mandate of some sort where social distancing could not be maintained. From that point, we definitely received a lot of input from families, from employees, and we took that input. We ended up creating an opt-out policy. I think one of the goals is by any means looking at, how can we really emphasize the need for a mask while also maintaining parental choice. So we did add that opt-out policy in there. And of course, one of the things that we felt was important, and I think you would hear me say last Thursday, is we did not want to in any way, shape, or form take this mask policy to this past Monday and let it be a part of 30 other items. We thought it was very important to bring this mask policy to its own meeting where it's the single agenda item where parents, employees could offer input. And that's what we've done. But we started at strongly encouraged. We continued to get feedback from families. I think there was a direction from the board to look at going towards some form of a mandate. We continued to listen to input. We went towards an opt-out policy, and that is what is before us here today.
And I would like to comment that it was actually the board chairman, myself, that called an emergency meeting so we could have this time for public comment. I hope that will answer your question. moving forward, we do have other people who are on the phone, but we will be addressing a lot of those concerns when we get to the discussion part. But we do appreciate you calling in tonight.
Put the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hello, my name is Teresa from Crestview, Florida. A few issues I have is, has anybody done any studies on the carbon dioxide intake by wearing a mask? Because carbon dioxide toxicity could cause faint, lighthearted, smothering, headaches, vertigo, double vision, inability to concentrate, tinnitus, can also cause seizures, suffocation due to displacement of air. Also, when you have children at certain ages, they're still at a toddler stage where their nose and their mouth of the breathing of their nostrils are not fully developed. And most people, when they end up having to do CPR, they have to do the nose and mouth. And when you're taking them wearing a mask, you're taking away their air supply. So that's the main concern I have on all of that. And I also believe that it is such a case where it ends up leading to any of these events of carbon dioxide intake of too much because your O2 level is going down. Are we going to allow the parents to take the liability of this and the risk of a lawsuit, or are we going to put it in the hands of the school board to make where they're liable of the intake of a high concentration of carbon dioxide all day long? And that's all I had to say, and thank you.
All right. Thank you very much for calling in tonight.
Put the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hello, gentlemen. My name is Chris Nugent. I live in Niceville. My daughter goes to Plough Elementary School. Look, I could go on and on and on with facts and figures. I'm not going to do that tonight. I want to go past emotion. I want to use common sense. I want to take us back to where we're supposed to be. Let's use our education, our intelligence. Let's not base this on fear. Let's base this on facts. All right? Look, I'm adamantly opposed to masks in all walks of this situation. We had the opportunity, as it was presented to us weeks ago, to send our kids to school or to stay home and do homeschooling. If you're scared, if you're worried about the virus, if you have extenuating circumstances with family members or anyone in your immediate vicinity, you have the option to keep your kids at home, to take that extra precaution. We have the opportunity to send our kids back to school in a normal environment where they can learn and they can prosper like they were meant to do, like they were doing before this thing started. Children are children. They're going to be children. They're going to go on the playground. They're going to take their masks off. They're going to touch their face. They're going to rub their masks on other children. They're going to drop them on the ground. They're going to step on them. You're going to spread germs faster and quicker by them touching their face 10 times more than they normally would by wearing the masks than they would by keeping them off, washing their hands, and taking basic precautions like we do every flu season. The flu is contagious. This is contagious. It's a virus. You're not going to stop a virus. The point from the beginning of this whole thing, going all the way back to March, was to slow this thing down enough that the hospitals didn't get overrun, or the secondary hospitalizations for heart attacks and everything else didn't get stepped to the side, and people didn't die secondary because of this overwhelming the hospitals. We've done that. We accomplished that. Everyone did their part. We slowed this thing down. The hospitals have staff. They have all the PPE in place. Children aren't trained in PPE. And even if you train them, they're still going to be 6-year-old kids. Do you know how many times I told my daughter to go get her shoes the other day before she actually went and got them? It's going to be the same thing. We can't stop this thing. We're not going to mitigate it, whether you get it tomorrow, next week, next month, next year. This is a virus. It's going to make its way through the population. You're not going to stop it from happening. You have to move on with your life. We slowed it down. We can deal with it. You're not going to stop it. My child has been in dance and tumbling since this started. 30 to 40 other kids in close contact for months. No reported cases in her dance school. She's been to birthday parties. We have hung out with friends. We have gone on trips. I'm a pilot for a major airline. I have been all over the country. No reported cases in our immediate vicinity. This is not as dangerous as everyone is making out to be. A mandate does nothing, especially with an opt-out. What is the point? You're going to put band members with a hole in their mask for their instrument. Are we hearing ourselves? We're going to put a mask on people, and we're going to put a hole in it so that they can play their instrument, but we're going to put a Come on, guys. Use your heads. Use your common sense. A mask with a hole in it? Are we really doing this? This isn't America. This isn't what we were born and raised into. This isn't how this is supposed to go. I don't know what else to say, but a mask mandate is just wrong on so many levels. If you're concerned about the virus, take the necessary precautions to protect yourself from the virus. Let the rest of us live our lives. Let us teach our children as they were meant to be taught. Let them play with their friends. Let them go to school. The virus doesn't affect the children.
Mr. Nugent, your time
like it does adults.
your time has expired, and
That's all I have to say, gentlemen. I appreciate your time. Everyone, thank you for listening. I wish everyone the best of luck throughout all of this. Have a good night, and I appreciate it.
And we appreciate you calling in.
Put the next caller through, please. Still full. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Yes, my name is Mallory Amrine. My address is 2081 Villa Palm Circle. May I begin?
Yes. You have 4 minutes.
Okay. First, I'd like to address, I have a lot of concerns about this mask mandate. The first of them being that this is a one-size-fits-all approach. I've reviewed the data that I was sent in an email, and it doesn't actually pertain to masks being worn in a school setting. I'm extremely concerned because most masks, when they're used in a medical profession, are outfitted by OSHA. And they do functionality testing, they look at someone's medical background. It's an in-depth process. And I feel like this is a very quick decision that's being made by people who don't know everyone's individual medical history. On top of that, whenever there's any risk, there's choice. And instead of asking parents to make a choice, we're having to ask for permission. And that worries me as being a resident here and having my children attend the schools within the school district. In addition to that, something I would like for people to consider is that if you do mandate the mask wearing, then are you also assuming liability for kids who have seizures, for kids who pass out? If there's any trauma that occurs to a child because they're wearing a mask during school, will you guys be responsible for that? If someone could answer me, if you all will be accepting liability.
We're not in a position to answer that question.
Okay, if someone could get back to me,
Yes,
that'd
ma'am. Yes,
be
ma'am.
really great.
Yes, ma'am, we will.
So
I appreciate that they put an opt-out clause. I'm also concerned, at what point do we know that you guys could remove that? If you revisit this at a later date, are we going to go through this all again and have to, come to our kids' defense and give factual information? I've not seen any studies of any caliber that show masks actually preventing or in the school setting where that's beneficial to kids. And also, I want to look at masks like you do vaccines. We as parents should have a choice. We should be shown all of the risk attributed to wearing masks for our children. We should be able to weigh those risks ourselves because we know our kids' medical history. Just like you would when you sit down with your doctor before you go into the surgery. These are the risks. These are the things that could happen. And I think that parents deserve to have that. We should have that choice. We should be able to look at the risk and not feel like we're having to make a split decision 2 days before school.
All right. Anything else?
No, but if someone could get back to me
Yes,
on the
ma'am.
liability, I would greatly appreciate that.
Yes, ma'am.
And I'll provide my contact information.
Okay. Thank you very much. We appreciate your comments.
Thank you.
Go ahead and put the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Good evening. This is Michelle Duncan with 519 Wexford Drive. I'm an educational advocate for kids with special needs with the Council of Attorney and Parent Advocates. I'm calling first and foremost to express my appreciation for your initial attempts to ensure the safety of our staff, students, and community. I'm sure as all of you on the board there know, I've been tracking very closely with you and hopefully been providing some assistance along the way. However, I'm deeply concerned about the addition of this parent opt-out. This is really unacceptable, and it will render the policy impotent and possibly a liability. Make no mistake, I have no issues about any of the other 14 reasons for which there might be an exemption. The policy is comprehensive and appropriate, and all anticipated valid exemptions to include age, medical concern, developmental disability, or sensory processing issue has been covered. But the only reason this parent opt-out language was added was to pander to the folks who don't believe in the virus. We are educators. The science is simpler than folks here would have us believe. The world is not flat, and over 800,000 people worldwide have not died as part of a hoax. We've already had several cases of transmission among our district staff and summer school attendees. And in the first 2 weeks of opening schools in Florida, we have 9,000 pediatric student cases. If this policy is allowed to pass as is, we will have significant uptick in cases here locally. Likewise, the knowledge of these facts makes our Board of Ed more likely to suffer lawsuits from negligence from both students, families, and teachers. Let me be clear. Lawsuits based on rights, imagined or otherwise, will be quickly dismissed. Lawsuits regarding gross negligence will be expensive and indefensible. The opt-out clause, at a time that we know better, is indeed negligence. But let's talk about what's more important here, our teachers. These community heroes, these amazing souls who Zoomed and danced and did car drive-bys and basically held our kids together last spring when the world fell apart, the ones who taught our kids while they homeschooled their own and troubleshooted their own kids' technologies, our teachers and our staff deserve better. No, not all of them got offered online positions, and some of them are high risk and in our schools anyway, because they love our children. These heroes are still in our schools. And to quote Mr. Chambers, everyone matters or no one does, even the most vulnerable. Safety in our schools is required by statute, and safe workplace environments are likewise matters of state and federal legislation, from which our district is not immune. Parent choice has been offered. Parents may choose online if they disagree. ESC and medical concerns have been addressed. This is not a matter of choice. This is not a matter of opinion. This is a matter of leadership. You've been given a great responsibility, and I ask that you make better choices. Thank you for your time.
Thank you very much for calling in tonight.
Go ahead and put the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hello, my name is John Lindsay, and I'm here with my wife, Carrie Lindsay. We're going to be moving to Lincoln Street in Crestview, Florida. And we're leaving Kansas City after living here pretty much all our lives. And we have 2 students up at K-State right now. They can't attend class because of all the restrictions and all the legalities and everything else going on. So we wanted to give our 5-year-old daughter and my son, who's going to be a senior, a chance to go to school normally, being in a normal environment, attending pep clubs, going to dances. And as far as Avery, especially, who's going to be a kindergartner, how important it is for her as a child to be able to see other children speak and learn their expressions. I mean, this is one of the most important part of her developmental stages as a child. And walking into a class where all the children have masks and the teachers have masks and the administrators have masks, it's just frightening. In fact, it kind of borders on child abuse. You know, part of being an American is being able to take risks. And you know, that's just part of life. You know, you can't mitigate car accidents. You can't mitigate all of these things. You know, these are all things that kill children. I mean, in 2017, 28 children under the age of 18 died from the flu alone. So what happens when the flu comes? Is that going to be a mass thing too? And then where do we go here with vaccines? Even Fauci said they'd only be 60% effective, and there may need to be 3 or 4 or 5 vaccines. You know, this is an epithelial virus. And so, you know, trying to do an immunization against it is, you know, has very limited effect anyway. You know, I just wanted to say there's one other thing that no one's considered. You know, in the New York Post, the Manhattan Dental Clinic did produce an article, and they were talking about 50% of the patients getting a new condition called mass mouth. Okay, that includes recession of the gums, tooth decay, and severe bacterial infection that gets on the tongue and the mouth and thrush, plus sores around the mouth. I mean, you're talking about having children wear these things continuously all day, maybe 6 hours a day, with very little break in between. You know, this is just unenforceable. You know, we are American, and it is free. And if the masks do anything, you know, they protect the wearer. You know, this whole idea of collectivism, that I'm responsible for the health of other people, is very, very selfish in my estimation. I just wanted to make it clear that, you know, we're coming down to Florida because you're one of the only places, you know, that's even considering something so amazing. And, you know, there needs to be other types of ideas out there than just the same draconian idea all over this country. You know, Kansas is running a $640 million budget deficit right now because of this whole shutdown. You know, and I mean, where does this end? The productivity of America, us not being able to go to our jobs, the homelessness this is going to cause. How about nutritional problems? You know, this can be addressed, you know, easily by nutrition and other methods. I just wanted to tell you that we were really excited about coming down there and being part of your community, being part of, you know, the freedom to be able to make this choice. And anyone who wants to wear a mask, that's absolutely fantastic. But I do understand there's a coronavirus. There's been one since forever. And this is a special version of it, or a special series of it. It's new, but it's not going to go away. And there's always going to be the next virus. So we have to learn how to develop herd immunity, increase our nutritional, you know, increase our ability to treat these things with good nutrition, with vitamins and minerals and exercise. But anyway, that's what I wanted to say. That yeah, with moving trucks coming in 2 days, we're on our way. And well, I hope that you put the opt-out in there for the people who really, really resent, you know, this oppression to freedom and an oppression to think differently about an idea. We just can't live in fear.
Thank you, Mr. Lindsay, for your comments, and we welcome your family to our community.
All right, we'll see you.
Thank you.
Okay, go ahead and put the next caller through. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
Good evening. My name's Amy Downs. I live up in Crestview, Florida. Of course, we've all been giving our addresses when we called in. First off, just bless y'all hearts. But more than that, I know Mr. Nugent covered a lot of it that I was thinking also whenever he called in earlier. Yes, we were all given the option. When we were given that option, like so many stated, it did say that masks would be encouraged, not that they would be mandatory. And I know a lot of people have said, if you don't like the way this is going to go online. Well, the difference is the parents who are wanting to opt out, I am one of them, I think that's the best compromise you guys could come up with, is you're trying to make everybody happy. And you guys are trying hard. The parents who are wanting to opt out, we're not trying to control somebody else's child. If your child wants to wear a mask, that's great. That's your choice as a parent. Whenever you choose to send your child to public school, you acknowledge the fact you cannot control other people's kids. If you want to control everything around your kid, keep them home. And I know that virtual school is not an option for everybody, but all of us have to work. And so you saying put your kid online, it's an endless battle of back and forth. It's just not there. I hope that works for you guys. I would also say that, the IEPs are great. I have a child on an IEP. I have another child I've been trying to get on a 504 for ADHD for over half a school year now because it's not easy to do. And he was epileptic, and he's been seizure-free for 2 years. And when he spikes a fever, I'm scared to death. I do not want to put him in a mask because if his seizures come back, they might not go away. And that should be my choice as a parent. Like I said, thank you for everything you guys do. I love our schools. One of mine goes to Riverside, one goes to Richburg. I was an aide at Lewis, and they're all absolutely amazing schools. We could not ask for better schools. Thank you for trying to keep everybody safe, and just bless you all in this decision, and I hope you guys have a good night.
Thank you, and thank you for calling in tonight.
Y'all have a good one.
Thank you.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board. Hello? Hello? Hello?
Hello?
Yes.
Oh, I'm sorry. I didn't realize I was online yet. Yes, I'm Christina Ackerman. I'm from Mary Esther. I'm just calling because I am really concerned about, I'm against the mask, for one, because most of them are made in China, Mexico. They're homemade. They're not PPE gear. They're not properly, most people who work in the medical profession only wear them for, like, surgery. Now they're wearing them constantly now because they're told to. But for the majority, they would only wear them like 2 times a week during their surgeries. And and now these masks are not even proper. They're not tested. And they say, even on the boxes, they say are not protected from COVID. So it's not 100% guarantee that they're going to work. It also scares me that with the elections, the crime rate's going up. You can't see people's faces. That's really scary when you can't. And why aren't we promoting health, like vitamin D3, getting a lot of sun, health foods, exercise? Why aren't they promoting that kind of stuff? Instead, suicide rate is on the high. We have almost 8 billion people, and about 700,000 people have died with almost 8 billion people, 7 billion people. And worldwide, only 700,000. Is everything COVID? I'm just worried. Like, if a kid gets a sniffle, oh no, he's got COVID. So we better, the teachers are they going to become mask Nazis and start getting onto their kids constantly because the mask, they're going to be rubbing their noses and they're going to be trying to pull on them and yank out. I mean, it's scary. Like, just all of it. And then I'm really concerned also with what Dr. Chapman said. There was a quote that she said that the mask, no matter what the rate goes down, it's all about when the vaccine comes out. Well, the flu vaccine, it's not even always effective, and it contains fetal tissue, animal tissue, dog kidney cells. I mean, there was an article I read that they predicted that lots of kids are going to get polio-like cases, and I was just thinking, well, in the insert to the flu, it says Guillain-Barré syndrome, and those are like polio-like symptoms. So predictive articles, reading, and that scares me when all the kids are going to be getting shots and getting sick. So I'm just, sorry, I sound kind of nervous, but those are kind of things I'm worried about. And then, do we not have control of our own bodies? I understand that people are saying you're selfish, but Hitler once said, for the greater good. And people, you go on, you see all these people that are like beating each other up and stuff if a person doesn't walk in with a mask, and the person who does, it's really scary. Like, the whole thing is just scary, and I'm totally against forcing anything on anybody that causes any medical problems. Clothes, yes, you can always cover up. It's called modesty, but with your mouth, that's health. So I'm against it, and that's all I have to say.
Okay. Thank you very much for calling in tonight. We appreciate your call.
Thank you.
So the next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Yes, I'm Chastity Haggard, Crestview, Florida. So I just wanted to give a little bit different perspective. So I am a frontline worker. So I actually take care of patients with COVID every day. So I see what COVID does. And as healthcare professionals, we are required to wear masks for 12 to 13 hours a day. No, they're not fun by any means. However, they are in place to protect us. There are different levels of mask in which we wear when we go in COVID rooms. We also are required to wear face shields and gloves and gowns and all kinds of stuff. And I believe that we have to do what is best for our kids, whether that be a mask mandate without an opt-out option. The masks are put in place in the hospitals to protect others. They're not to protect ourselves. Different masks have different levels in which they work. So even if it wasn't COVID, even if it was the flu or C. diff or MRSA or something else, there are different levels of protection in which we use to be able to care for these patients. COVID is something that we have never seen in the medical profession or anywhere, anything even remotely close to it. So I just ask that if you guys decide to do the mask mandate, then it needs to be a standard issued part of kind of like a school uniform that children would wear, not something that is homemade, not something that is fashionable or bought off Craigslist from somebody's home little sewing thing. It needs to be actually something legitimate that can protect our children, and possibly even face shields. I know that we use them in the hospitals and stuff to keep our staff safe, and I believe that it's your responsibility as our school board members to make the best decision to keep all of our children safe, not only our children, but our teachers. I've heard multiple comments of how children need to be like saved because they've been at home with abusive parents or they've not had enough to eat or whatever. You've placed all of this responsibility on our educators, on our principals, on our resource officers, our teachers that are in the classroom that care for our children at 6 hours a day. They place their lives on the line. You expect them to stand up for our students if, God forbid, some armed criminal was to come and there be a shooting on campus. You would expect the teachers to lay their lives down for your child. And I just ask that you think the same about our teachers. A lot of them are elderly. I know that in the hospitals, it's grim. I mean, it's horrifying to watch somebody actually suffocate because they can't breathe.
Okay, you have 15
COVID
seconds to
is
finish your statement.
absolutely just, it's terrible to watch. And I just really ask that you would protect not only the children, but also our teachers. I have many family members that work for the school board that are in the classrooms teaching our children, and I think it's imperative that we make sure that everyone that steps on school grounds is protected and safe. Not only our children, not only our educators, but everyone without an opt-out
All right,
option.
thank you for your comments. We do have other callers, but we do appreciate your comments tonight.
Thank you.
Put the next caller through, please. Both rooms are empty. You still have a full phone bank.
How many is that, 8?
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hello, my name is Matt Pierce. I live in Mary Esther, Florida, and I am completely against an opt-out for the mask, but I'm completely in favor of mandated masks. I am a therapist that works with at-risk kids in Okaloosa County. Every kid I work with has multiple suicide attempts and has severe issues with anxiety and other things along those lines. And I've seen the struggle they've had being at home without having that support. I also used to work in child protection and know how important it is for these kids to get seen by other members in society so to keep them safe. And we can do that without having to have a sudden closure again by putting in policies that keep people safe. Something that I thought of as I've listened to all these calls is we talked about parents wanting to opt out. Why can't we have, if you guys decide to go that way, these children that are opted out in separate classes from children that aren't opting out? That way, those parents that want their children to have that ability to opt out are able to have their children still go to school, but remain with those other children that are choosing not to be considerate of the safety of those others. The last thing I have to say really is just, it's scary for everyone, but this isn't a thing about fear. This is about science. We don't teach, we teach science in school. And so if that's what we're going to teach, then we need to go with what science says. And, our health department has made their recommendations, and I think that's what we need to look at. I thank you guys for your time, and
Thank you for calling in tonight. We appreciate your comments.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
My name is Michelle. I live in Fort Walton Beach, Florida. First of all, I'd like to thank you for taking your time to host this meeting. I know it's a heated debate, But we have to worry about not only our children, not only our teachers, but also the people at home that they will be bringing it home to. There are elderly in the households. There are people like myself who are high risk. I wanted to state that the previous callers that have mentioned that their child has a right to go to school, and if those who are scared, they can stay home. Your child is not more important than mine. You have the same option to keep yours at home. I could have the same debate and say that I want mine to be able to enjoy a full school year. So one doesn't override the other. It's not just they're right now in the classroom, it's going forward. So the military issued legislation that said if you had COVID, that you would not be able to enlist in the military. Now they've backed that up a little bit and said if you've been hospitalized from it. But you're jeopardizing not only this school year, but possibly their futures of being able to even join the military. Our school mandates a lot of things, even as far as I couldn't send my child to school with cupcakes because we're worried that other children who may have food allergies might eat one. So they don't know the difference not to eat something that could harm them. But we expect them to know the difference of doing something that would harm someone else. It's already causing lawsuits with employers, employees suing employers because they put them at risk. We're putting the school board at risk for the same legal battles going forward. We mandate seatbelts. We mandate car seats. I guarantee people would call if I had a child in the car who wasn't in a car seat because it made them uncomfortable. They didn't want to put the latch together. However, we do it. So our children have to listen to what we say. It's not an option. Wear the mask. Protect others. Teach your children kindness, consideration, and thinking about others. We've become a selfish society, and it's something that we get back up now. Whether it's putting them in separate classrooms, as someone mentioned, those who want to wear masks versus those who don't, or it's separate days, whatever the answers are, again, one person does not override another. My child deserves a safe environment to go to school in. That's all I have to say. Thank you for your time.
Thank you very much for calling in tonight. We appreciate your comments.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hi, my name is Claire Irk, and I live in Niceville, Florida. And I'm a teacher in the Okaloosa County School District. Mr. Bryant and Mr. Chambers have been in my classroom many of times, and they're welcome at any time. I am anxiously and very excited to meet my new students on Monday. My partner and I have a total of 42 between us. I'm in elementary school. And we are doing everything we can to keep those kids safe. We truly, truly are. We're sanitizing. We're doing everything you tell us to with the COVID protocols you've given us. And we're also trying to keep us safe. She has a newborn child. I have an immune-compromised teenager, and I have asthma. So we're trying to keep us safe as well. So our goal is to keep everybody safe. I have personally called all my parents to encourage them to wear masks because I want to describe my classroom to you. I have a very large classroom. I've been blessed with that. But my desk and the configuration, I can only get at the maximum 3 feet between students based on moving the desks around. So I was really looking forward to the shields, thinking, well, that's going to help. And they were delivered today, and I truly appreciate the school board providing the shields for us, to the teachers and the students, but I'm not sure that they're going to be adequate to keep us safe either. So, in addition to the shields, I would, and I really don't want to be behind plexiglass all day with the kids. I don't want them to be behind plexiglass. I teach 10-year-olds; they need to move around. I love hands-on science experiments. And I want to provide that to them this year, just like I have in years past. So I'm really in support of the mask mandate. I think most of my parents are, after I spoke with them about my concerns about I really want to do hands-on science. And I, like most teachers, we put in place in our plans already to have mask breaks. We know our students. We see when they're struggling with things. We're going to take them outside. We're going to socially distance and have science outside or math outside. We can measure things outside. We can find fractions outside. There are so many things that we could do to not wear a mask all day long and give them a little bit of relief, and honestly ourselves too. I mean, masks aren't my favorite either, but I wear them out of necessity. So I just wanted to show support of the mask mandate without the opt-out clause, because that just adds more paperwork to teachers, as we all know. But I truly appreciate all that you've done for us and continue to do for us, because I know it's late and I know you're tired, because 3 days of planning this week, I'm exhausted. So I can just imagine you guys right now. Right. But I just wanted to, again, share my support of the mask and removal of the opt-out clause. Just give teachers some relief. We're going to take care of these kids as best we can, and we're going to continue to do that this year as well. So I appreciate it, and thank you for your time.
Thank you, Ms. Irk. We appreciate you.
Thank you.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You have 4 minutes. You're live with the school board.
Hi, my name is Samantha Hargonis. I'm in Okaloosa County. I'm opposed to the mask mandate. We were informed in the month of July that we would be able to go to the school to start back up at school and to be able to try to go back normally. We were given a deadline on when we had to make that decision by, and this was not information that we had. And to some of us parents, that is a big enough deal to have opted out of sending our children to a brick and mortar school. Now, I do believe that everybody should have their own option. Nobody wants. I don't know anybody that wants to get rid of masks. Or I don't know anybody that doesn't want to send their child in a mask all day long, that wants to control anybody else's child. And I do respect wanting to take care of our elderly and our sick people, but we also have to consider that there are other deadly diseases out there and viruses that are just as deadly as COVID, if not worse. And we've never worn masks. We've never had mask mandate, but there will always be a virus out there. There will always be some disease out there, and there will always be somebody that is at risk. And so unless we are prepared to say that this is just going to be life from here on out, I don't see why we need to be making this mandate now. There's science that goes both ways. Everybody has stated that. I do strongly feel that if you do go forward with the mask mandate, to keep the opt-out clause for us. I want my children to wear their mask while they're walking in the hallways and when they're in close quarters with other students. But if we are social distancing the way that the CDC, states, then we are far enough apart that we don't need to. Now, I understand that classrooms can be small, so I'm just asking. Give the parents an opportunity to choose what they want with their children. I don't know if it's an option where you could just have one side of, like the children with their parents feel very strongly that they want anyone that comes in contact with their child to be in one part of, like have a section of the classroom that those children can go and split the classroom. I don't know how great that would work. But I do want to ask a question. If you guys do remove, is removing the opt-out clause a possibility?
I really can't answer that because we haven't had a chance to discuss it. We're in the middle of public comment here and hearing from people like yourselves. As soon as public comment is over, I can assure you that this is going to be discussed.
Okay, and then when will we have that knowledge? And when we do get that knowledge, will we have an opportunity to opt out of brick and mortar if it's something that we don't agree with for our children?
As stated earlier, I know the superintendent and his staff are in the business of, like I like to say, customer service, and they're going to deal with you and any parent how they see fit at that time. So.
Okay, thank you. And I, you know, as everyone else has said, we do appreciate you guys and all that you've done, and we appreciate that you want to keep our children safe. I just, you know, and when it comes to masks, I don't think it's healthy to be wearing a cloth mask for 8 hours a day, especially when there are no studies done on cloth masks that prove that they are helpful. So in that case, like, where are we going to get a mass supply of medical grade masks that the studies are done on?
Ma'am, I hate to interrupt you.
As other parents, my time up?
Yes,
Okay.
ma'am, your time is up, and we do appreciate you calling in, and your questions are valid, and these are things that we can reach out to you at another time on some of your questions there. So thank you for calling in tonight.
Thank you.
Next caller, please.
Eric.
Mandy, how many callers do we still have?
That's what I was going to ask.
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Fadina Spence, Crestview. I just wanted to address the comment about the ones who do not support the mandate being selfish. That can go the other way as well, for those wanting to decide that all children have to wear the mask because they don't feel comfortable with their children being exposed to those who don't have one. Also, healthcare workers, the one who said that she wears it 12 hours a day, she did choose that profession. My child cannot decide whether they want to get an education or not. So I don't think that's a fair argument. As well as, I'm okay with them having a mask on their person, like in their pocket, in their backpack, since they don't have lockers this year. Should they find themselves in a situation they can't socially distance, that's fine, grab it out, put it on. But making them wear it all day, that is not a good option. And if we have that become our choice, then mine will do virtual learning. As the comment about parents were given the option to do virtual or brick and mortar, and if we don't want them having to wear a mask, then we should keep them home. That also goes the other way. If they don't want them exposed to not having it, then they can stay home and do virtual learning as well. Like everyone said, we appreciate y'all even doing this and having this discussion, but I do believe that the opt-out should stay in, and we should have that decision as we are the parents, and it seems like all of our decisions are being made for us, and many options are taken away to where we have very few decisions to be made on our part by us. Thank you.
All right. Thank you very much for calling in tonight. We do appreciate your comments.
Next caller, please. So if we transfer another one, fix it. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Good evening. It's Pat Ryan, 252 Old Post Road, Niceville, Florida. Several callers have asked why this policy debate is occurring only 5 days prior to the delayed start of the school year. The district took steps 5 months ago in March to close schools and transition to online learning. I believe Dr. Chapman addressed the board via Zoom back in July. An earlier caller, about maybe 12 to 14 callers earlier, asked this question. The superintendent answered that this was discussed last Thursday at a workshop meeting. My question is actually for the board members themselves. Why did you not push the superintendent or anyone else in the school district administrative staff to try and be more aggressive about pursuing a resolution of this policy so that people would be able to get an answer to this beyond or well in advance of 5 days before the school year? And I have a follow-up question. Thank you.
What's your follow-up question, Mr. Ryan?
Well, I'll ask the follow-up question after I get the answer. Thank you.
Okay. Anybody would like to comment on?
So, Mr. Ryan, you're wanting to know why a board member did not step up? I mean, the bottom line is the district has had the stance that we are highly recommending the wearing of masks. That has been persistent. It wasn't until Thursday that someone said, let's move it a little bit further and look at it, and to ask, to continue asking the public. So that's why it was a time thing. It's not that we just sat back and said nothing. There has been some different times of discussion over the past few weeks, but it moved to that mainly because we, what I was going to say is the public has not had a big outcry about the the encouragement of masks until last week. Suddenly, and we have polled our teachers, they're polling out almost split 50-50. So it's not until this particular policy was made public on Friday did we start getting inundated. So that's when the board members began getting the information. So it's not like we were just ignoring it. There just wasn't a need to go any further. We thought the policy, or not so much an official policy, but the stance of the district was that we were highly encouraging the wearing of masks in situations where we could not control social distancing. Does that answer your question, sir?
Politely and respectfully disagree with you. Well, like I said in my initial question, Dr. Chapman, I believe, talked with y'all on July 23rd. So it sounds like what you're telling me is you waited till a good 4 weeks after Dr. Chapman talked with you to actually take any action upon this because there was some interest in the public. I mean, Dr. Chapman is the medical health expert that y'all should be listening to from what you've said all along.
Yes, when Dr. Chapman came, and by the way, I was the board member who asked her to come here, and she came in through Zoom. At the time, what the decision was about then was putting back the time of when we were going to start school from August 11th to the 31st. And while she may have talked about masks and so forth, the main thing was to ask her, I know I specifically asked her professional stance on putting students back in the classroom, and she stopped just short of saying she didn't think it was good. She said that in her position, she was not in a position to give another entity or organization only just facts, not to make a recommendation. So she did not recommend whether we go back to school or not. That was the first thing we were working with, not the masking.
And thank you, Ms. Van.
Well, I appreciate that, and I don't want to be argumentative or anything like that, but that's what we elect y'all to do on the school board.
Well,
Dr. Chapman and the health experts are folks who will give you just a certain amount of information. Just like Dr. Fauci gives President Trump recommendations, and then President Trump and his staff have to act on them. And I believe it's only fair to say that the people of Okaloosa County expect our school board to be a little more aggressive in taking that information that experts give them and being a little more, having a little more foresight. So in all fairness, I don't think it's really fair to point to the superintendent and say that it was up to him to bring this up. I just want to say there are 5 board members that we elect and pay to look at these sort of things and have the foresight. So, thank you for your answer. I appreciate it.
Mr. Ryan,
Yeah.
you know how this works. The superintendent and his staff bring things to the board for us to vote on for policy. We're not putting this back on him, but he runs the day-to-day operations of this district along with his staff. So when he said to us that he felt like we should have it strongly encouraged for the mask, that's where his stance was. There was no situation where we voted. So I'm not putting it on him or anything, but it just didn't come up for us to vote till now.
Okay. All right.
Yes, ma'am. But the board is the entity that enacts and
Mr.
drafts
Ryan,
the policies.
Mr. Ryan, I hate to interrupt,
I
but
think this debate could have started a long time ago.
well, thank you, Mr. Ryan, for your call. We do have other callers, so thank you.
Thank you. Have a good night.
You too.
Mr. Chair.
Yes,
this is
Dr.
Diane
Kelly.
Might I say just a comment
Yes.
pertinent to what Mr. Ryan has said? I've been asking for clarification on the mask issue since July, and it really had very little to do with anything except as a response to a letter sent to parents that went out for the opening of school information, which was full of excellent information, but there was a sentence or two that referenced the wearing of masks as strongly recommended. Parents and teachers who knew me asked me to seek clarification for them prior to the opening of school so that they could be better informed and make that decision. I have, since 2 months past, I believe it was July 13, if I'm accurate on the date, it might have been earlier than that I first started asking for clarification. And that is validated on the workshops that are posted and the board meetings that are posted. And I'll just go ahead and say while we're right now, for others listening, and then I'll have some other comments when it's appropriate. But for me, when I first mentioned the term opt-out, it was intended for the very rare and unusual case. I was specifically thinking of the very rare case that might be with regard to ESE students that might meet a legitimate physician's exemption not to wear one. I was thinking across this whole district, maybe 5 or 6 students. But since that time, others have taken that term and expanded it so that, in my opinion, it has diluted any mandatory mask policy. So I've got other comments to make, but I'll make them at an appropriate time on this agenda so that callers can be heard first.
Yes.
But I respectfully wanted to respond back to Mr. Ryan so that he will know that the board member representing his district has been asking for mask clarification and has spoken to Dr. Chapman on many occasions.
All right.
Thank you.
Thank you, Dr. Kelly. And Mr. Mitchell, do we have another caller?
We do, sir.
Okay.
Next caller, please.
Mr. Bryan, I have a comment if you have a moment.
Yes, sir. Dr. White, go ahead.
Just very briefly, and since everyone's kind of speaking about their thoughts, my thoughts at the time when we made the decision to delay the school opening really pertained to the infection rate. And I know, and I think the board members know, and members of the public might know, and Mr. Ryan might even know, that at one time, at that time, the infection rate was about 14%. And for me, my thoughts were that given more time that we would hope, even pray, that the infection rate would go down. The reality is the infection rate did go down. As of today, I think we're about 8% at an infection rate. And I'll say, and members of the public may know this, according to Dr. Chapman and according to other medical sources, an 8% infection rate is a medical crisis as defined by them. So those are my thoughts.
Okay.
Thank you, Mr. Ryan.
Thank you, Dr. White.
Chairman, it appears I'm the only one left out so far. In response to Mr. Ryan's question, we delayed school opening for 20 days, possibly 3 weeks, for the reasons that Dr. White explained to us. And also it gave us the opportunity to see what happened in the surrounding states and surrounding districts when they opened up. the responses and the things that have happened to those other districts have not been very encouraging. Schools in Georgia have to close. Schools around some of our surrounding counties have closed, and the rate of positivity is way higher than it should be. Therefore, driving us to this decision that we're discussing tonight, what else can we do to open our schools and keep them open in a safe manner? And that's why we're at this decision point tonight. We have seen that school districts that opened without taking any further measures are not being very successful. And that's, I'm glad that we delayed it so we could see what their experience was going to be, so that could inform us on where we need to go.
Right. Okay. All right, Mr. Mitchell.
This is the Okaloosa County School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
All right. My name is Every Carswell. I live at 803 Laurel Drive, Fort Walton Beach, Florida. I am a worker at the Boys and Girls Club that is in Destin, and I believe that the students should wear masks because I've worked there. The kids been going there for maybe 10 weeks, maybe less. And our kids at our club wear masks every day, all day. We do have time. They do have time where they do take it off, where they eat snack and lunch and go outside, but they wear it every day. And that's to walk to the bathroom, play with their friends and everything. It is, yes, and the staff wears it too, but we don't like it. Normally most kids don't like it, but we have kindergartners and middle schoolers in that club that will wear them all day. Sometimes you do have certain ones that take it down, but you do have to remind them. But they wear it all day, and those kids are there. Sometimes some of those kids are there 8 hours a day, 6 hours a day. And I do believe that these kids can do it, and I believe the kids can do it. The teacher can do it as we do the mandate standard 6 feet apart. When they go outside, they can't be touching each other and everything. We do sanitize everything that they do touch, but we haven't had, in our club, we haven't had anybody, there's normal sicknesses, but nobody has been tested positive for COVID in our club. So I believe the kids can do it, and I think that you guys, the parents, should truly think about it, because we do have kids that go to the school in Okaloosa County that they wear it all day. All right, that's all I have.
Thank you very much for your phone call.
You're welcome.
Next caller, please. This is the Okaloosa County School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the board.
Thank you. My name is Mary Kocher. I am at Pat 4 Lane in Niceville, Florida. Thank you for taking my call. I know this has been a very long evening for everybody. I currently have a Niceville High School senior who is also an ESE student with a 504 plan. I think that's important to state. Listening to all the students and the parents that have spoke before me, it's very clear that everybody wants the same thing. We all want our kids to go back to school. Everybody does, whether you're pro-mask or against the mask. I would like to say I am pro the mask. I would like the mask mandate policy to be in place, but I do not think having an exception for an opt-out is acceptable. I think it's negates the policy that could possibly put it you may vote on today. I think it's very important that we keep the mask mandate in place. We all want our kids in school. But not only do we want our kids to go back to school, we want our kids to stay in school. We want our kids to finish out school without having to come back out online, without having to come home to quarantine, without having to figure out that mess that we all had to figure out in March. It's not an option that any of us want to go back to. And I believe that to keep our kids in school, the only way to do that is to put a mask on and to keep everybody safe. Our students, our teachers, our faculty, the administration, the support workers, every one of us needs to wear a mask to keep the other person safe and to keep our schools rolling along and get us to the end of the semester. And maybe, in the new year, things will be a little better and these virus rates will be down. This, as stated by another caller, this particular virus is new. It's a novel virus. Our information changes daily. There's new research published daily. And with that, we have to change with it. And it's obvious that, our infection rate is definitely down, but it's still at 8.66. That's way above where we need it to be. I did hear some of the school board members speaking earlier that this emergency meeting is in regards to what can we do to keep the kids in school that we haven't done already. And I think if we put our kids back in without masks, it's a recipe for disaster based on, the Georgia schools, the Mississippi schools, the schools down south. 9,000 kids have been infected or have tested positive, since school went back in down south. 9,000 kids. That number is staggering to me. And I just think it's, in everybody's best interest if we put the masks on and keep everybody safe. I appreciate you taking my call this evening. I know, again, this has been a very long evening, and I hope that you'll take everybody's thoughts under advisement and make the decision that's best for everybody. Thank you again.
Thank you very much for calling in tonight. We appreciate your comments. Mr. Mitchell?
Thank you.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes, and you're live with the school board.
Hi, I'm Mia Moloturno. I live at 1102 Coral Drive, Niceville, Florida, and I'm a senior at Niceville High School. As a teenager, I love to give my opinion, but I believe there's no better place to give my opinion than in a place where it would matter. And I called today to give a perspective of a student, especially one that knows what's at risk, especially as a senior whose college is on the line and who wants to stay in school despite having an autoimmune disease. There are a lot of perspectives from parents that leave a few things out that only a student would know or a faculty member. And I just thought I'd like to just fill in those gaps. One, I'm also in a lot of higher level classes, and not all school board members just wake up one day expecting a pandemic, and we all understand that we have to be flexible. However, some of those flaws include not having all the higher level classes that students would need to take in order to keep advancing. And I know from experience that a large majority of my friends would not want to be in the school and would want to be online. However, these courses are not offered. And that is partially one of the only reasons I'm going to school, because I know a lot of students would not wear the mask if they had the option. And I know that they have the right to do that. However, I just don't think that should be an option, because not only does that put faculty members at risk, but it also puts the other students who need to be there to graduate or who want to be there to get their scholarship in band or football. Another thing is I had the opportunity of helping set up a classroom for a teacher, an elderly teacher, with the county's permission. Of course, I was in there. I took the temperature and everything. But one thing parents don't understand is how small a lot of classrooms are. That they ask why we social distance if we wear the mask. We had to set up only 14 chairs in one classroom, yet we could not go more than 5 feet because the room would not allow it. Now imagine if the state capacity level for seating was what they actually needed for this classroom. These students would not be able to socially distance. You wouldn't be able to do it. So I see the mask as like a common sense barrier. If it works, it works. And if you don't believe it works, I see it as a way of humor me, because we all just want to be in school. We just want to be safe first. I cannot go to college if I'm sick or dead. And that might be morbid to say, but it's the truth. And I I know a lot of students feel that way. They just don't want to call in. So I thought I'd be the one to do it because, like I said, I just like to give my opinion where it's needed. Another thing is we want to thank the school board members because we all know how stressful this is even as students, and I can't imagine what it's like to be in your seat. But, yeah, I think those are just some things to consider. Thank you.
All right. Thank you very much, and good luck on your senior year this year.
Thank you.
This is the Okaloosa Schools public comment line. Please state your name and full address for the record. You'll have 4 minutes, and you're live with the school board.
Hello, my name is Miranda Gillespie. I live in Destin, and I'm also a senior at Niceville High School. I would like to back up everything Mia just said. She's amazing. I wanted to start by saying a lot of people have been talking about how they're... Hold on. First of all, I don't like how this has turned into an argument, and it makes me sad rather than mad now. So I'm not arguing anything, but a lot of people have been saying that kids can't contract the virus. What they're forgetting is that teenagers are involved in all of this too, and we have had at least, I know of at least one teenager in our county that has contracted the coronavirus in a very serious condition. And I've seen all over social media other teens that have gotten it. And we can still spread it. Even if we don't know it, we can spread it. And I know little kids can too. So even if we don't know we can, they can. So I am very pro-mask mandate without an opt-out provision. It's being considerate. And I know that can go both ways. It's a very roundabout argument. But I have asthma. I have health problems. My friends, their family members have health problems. And I wear a mask to protect them. Not even for me. I'll you know what? That's okay. But for my friends and their families, I do it for them. And I personally, I'm going to school in person because online did not work for me. I'm a straight A student, and during the online 9 weeks, I lost contact with one of my teachers, and I failed the AP exam for it, and I can't get that time back. And I work at a grocery store, and I have to wear a mask, and I've never had a problem with it despite my health conditions. And it's just something we should do to get through this virus. If we ever want to get through it, we have to make measures that will take it away rather than giving a chance for people to contract it. And it's not just about dying, it's having it at all. So I think we should definitely have masks in place without an opt-out provision, despite the few exceptions.
Okay. All right. Thank you very much for your call, and same to you. Good luck on your senior year this year.
Thank you.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hi, my name is Kirby Locklear. I live at 13 Windsor Lane, Fort Walton Beach. And first of all, my hat's off to the board for this meeting, and congratulations, Mr. Chambers, for your election. I'm glad to see you sitting up there. First of all, let me state right up front, I am for a mask rule without an option. It seems like through all this debate tonight, we sort of lost focus why this started in the first place. There's a pandemic going on here. There's 180,000 Americans who have passed away. These are mothers, fathers, sons, and daughters. We're still in a hot zone in Florida. And I'm like what Mr. White had said, that although our positivity rate has dropped And I think that's because we have increased mask wearing, and also because the base has mandated it. We're still above an area that would consider out of control. So I would like to say that, and a quote from Dr. Simkin, from the chair of the Okaloosa COVID Advisory Board, there will never be a herd immunity with this virus. The antibodies do not last more than 2 to 3 months, and the virus has mutated and is now more infectious than ever. And also, she went on to say that wearing a mask is one of our best lines of defense. And for those who feel masks infringe on their personal freedom compared to the greatest generation and the sacrifices they had to endure to defeat a common enemy, wearing a cloth mask for a few hours at school or a few minutes at shopping or conducting business pales in comparison. Right now, our military and federal civilians and contractors on the bases are required to wear masks, with Hurlburt having a 100% standing order. So I find this infringement on their personal freedom rather shallow. Bottom line, a mask ordinance will keep our schools open to avoid another shutdown. And I do want to reiterate that was said earlier, that COVID is having a negative impact on our missions here at Hurlburt and Eglin. And that the base commanders are pleading with the local government to take action. So that's all I have. I hope that was quick, and I hope we can see that we can have this mask ordinance without an option. Thank you.
Thank you very much.
Is he still, Mr. Locklear, you still there?
Yes?
You're on the Fort Walton Beach City Council, correct?
Yes, I am.
Okay, so do I have this correct that as the city council of Fort Walton Beach did not do a mandate?
That is a correct statement, even though I was the one that tried to propose that, and we called a special meeting to discuss it. We went around and around on it, but we could not come to an agreement because of some of the options that we wanted to put in. So I don't think the issue's quite dead. I hope they'll bring it back up again when the situation warrants it.
Okay, I was just pointing out that as far as to my knowledge, the only municipality that's called a mask mandate is Mary Esther, and the county hasn't issued one either. And I was just pointing that out, and you're talking about the military, which is a good example of a mandate, but then there are other entities who have said no.
That's a correct statement.
Thank you.
Okay. All right.
But Chairman Bryant,
Yes.
I have a comment.
Yes, sir. Go ahead, Dr. White.
Just going to add to the caller and to what Ms. Ivanchek had to say, that the way I'm looking at this thing and the way that I think that the public will soon come to understand, the only way that this school board is going to do anything is if we can get 3 votes for something. And I think that's exactly what happened in the case of the Fort Walton Beach City Council. So far, there's not a majority to move that action item forward. Is that correct, sir?
He's no longer on the line.
He's no longer on the line, Dr. White. But I believe you're right.
That is the case there, and I think that we soon will experience that very issue. What does it take? I mean, all the research articles, all the medical studies, all of those very, very good things, all the public input that we've received, we've got to have 3 votes for something, or we just stay where we are.
Correct.
Thank you, Chairman.
Thank you, Dr. White. We always appreciate your input there. All right. Do we have another caller, Mr. Mitchell?
Go ahead to the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hi, my name is Jacqueline Aguirre. My address is 672 Redfern Road in Crestview, Florida. So I wanted to just point out I have two kids. One just starting kindergarten. The other one's he's going to go into first grade with an IEP, so the mask won't affect them at all. But I just wanted to say, in July, we had signed up our son because we thought that masks weren't going to be mandated. And, we went forward on doing that, registering him. And, of course, we also know that with that, along we would have a hugger. He's excited to see his friends and whatnot. And we knew that 6 feet apart wasn't going to be a thing. And my husband and we were okay with it. And we were just kind of just shocked to hear that you guys were going to try to go back. You guys were going to take a vote on making masks mandatory because, as far as we know, younger elementary school kids, they're bound to drop it on the floor, touch their faces, touch walls, like the floors, just like any place that could have germs. And I don't know, I was just trying to see if there would ever be like a middle ground between having masks and not having masks, like maybe like having certain classes that have a teacher that has a mask along with the students, and maybe another class that will not. Is that like a thing? Would it ever be possible?
Can you repeat your question? I had a hard time hearing you. Could you repeat your question?
Yeah. I was just wondering about if there would be certain classes, like, say, for example, Class A wouldn't require a mask for both teachers and students, and would there be like a Class B that would require students along with the teachers, just so there would be some type of middle ground between pro and then against it,
I don't think we're really in a position to answer that right at this particular moment.
Okay.
Yeah.
Okay. Well, I mean, I don't know. I was just trying to see if maybe there would be some type of
right.
And
I'm sure there will be after we have some discussion about this later on. But at this time, we really can't answer that question.
Right. Okay.
All right.
All right. Thank you so
All
much.
right.
Have a good night.
Thank you. You too. And we appreciate you calling in. All right.
Thank you. Bye-bye.
Mr. Mitchell.
Next caller, please. This is the Okaloosa School Board Public Comment Line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
My name is Kevin Hard. I live in Baker, Florida, Holloway Road, 6231. I guess my question for the school board is, can they answer whether or not throughout any time this school year will parents be expected to sign a waiver relinquishing the county from liability of any mask issues, mass diseases, choking hazards, issues like that? And if so, does that mean the school board is willing to take on that liability, that they are so sure that they have enough data that masks are safe enough for our kids to wear them this long a time in school? And that's all I have, and I would be great if you guys could answer that question. And it's not so much a legal liability. I mean, that's for lawyers to discuss, but can you answer it tonight on a personal liability to the public? Are you willing to take that liability on, that you are sure they are so safe that it is worth making it mandatory for our children to cover their face throughout the school year?
Well, I will just go ahead and answer that question. When we get discussion on this policy, you will see us come to a vote, and I think that will tell you how we stand when we take a vote. And but I can't really answer the legal part of that because we're that's uncharted waters for us right now. So. But
I
do-
understand, like you said, that's for lawyers to answer.
Right.
But tonight, so much, my question is, will you personally stand behind your word as a school board member that you 100% believe you know it's safe enough to cover children's face throughout the school year, if that so be your decision?
Again, like I said, Mr. Ard, I think you'll know how we feel when we take this up for vote.
All right.
All right.
Thank you.
Thank you, sir. We appreciate you calling in tonight.
Next caller, please. This is the Okaloosa School Board Public Comment Line. Please state your name and full address for the record. You'll have 4 minutes, and you're live with the school board.
Hi, my name is Heather Folta, and I live in Fort Walton Beach. And I want to say thank you guys for staying so late and hearing all of us out. I think it's amazing. First of all, I have a first grader and a third grader going into school, hopefully, on Monday. I am not for wearing masks. We made the choice to send our kids back knowing masks were recommended but not mandated. We have been personally in direct contact with at least 2 people that were positive and contagious when we came into contact with them, and no one in our family ever became positive. I'm a waitress. We wear masks at my job. I opted for a face shield, and like I said, I don't know if I got lucky, but no one in my family has come up positive. And for me to be in a high-volume restaurant touching people from all over the country and nothing has happened, it kind of tells me there's a loss of information there somewhere. Somebody doesn't know what they're talking about. We're not educated enough. And kind of something I've been saying the whole time. If masks work, why did we close down? And if masks don't work, why are we open? I don't want to wear a mask. I have anxiety issues. My daughter, who's going into first grade, almost lost me whenever I had my baby, and her dad, within just months of each other. And so kindergarten last year was hard, and we had to go to therapy and we had to do things. And I feel like if there's a breakdown and we haven't built that trust, masks are going to be so hard for her, because she is such a person that looks at your face and she looks at your mouth to see if you're smiling or how you feel about it. And that could be a big issue for us. As parents, we made our choices. My husband and I made a calculated choice to send our kids to school with other kids who would be masking. We know that. But there's that other side that also knows if you are for masks, you know you made the choice to send your kids to school with other kids who are not going to mask. We can't just come out and say, well, your kids don't matter because they do or do not want to mask. It doesn't. I am a firm believer in you cannot yell, my body, my choice, and then tell other people that they have to wear a mask. It doesn't
you have 15
work
seconds,
both
ma'am.
ways. Like, I have to have a choice on how I raise my children, and you have to have a choice on how you raise your children. And we all have to come together as a community and decide that, yes, we have differences of opinions,
Right.
but we also have to be tolerant and realize that
Ma'am?
while my choice might not be your choice, it's still what I think is best for
Ma'am?
my family.
Ma'am, your time has expired.
Thank you.
Okay, thank you very much. Have a nice evening.
How many callers do we have?
It's still a full bank.
Mr. Chairman, I don't know the protocol. This is, I have to say, the longest meeting that I have been in attendance as far as a meeting. So, while I appreciate hearing from the public, and in all fairness, I don't know what the protocol is, but at this late hour, and we still have to make some discussion, or maybe Mr. McGinnis can tell me, can we proceed, sir, or do we need to, would it be prudent to continue with our callers?
Well, we did advertise this for a public hearing, so I think it's appropriate to continue with the call.
Okay, if that's the ruling, yes, sir.
All right.
Okay, thank you.
Thank you, Ms. Van
Okay.
Okay, Mr. Mitchell?
This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're now live with the school board.
My name is Josh, and I live on Crown Creek Circle in Crestview, Florida. And I'd just like to say there's a lot of people out there that are just saying to go ahead and mandate the masks and be done with it. But there's a lot of kids out there that can't wear a mask at all, or even for an extended period of time due to medical reasons. Yet these kids might not have IEPs in place that might give them an out. What about those kids? Don't these kids deserve to be able to be safe as well? Our kid's doctor personally told us for one of our children not to wear one. Another one of our kids can't wear one, issues related to seizures in her past. You can't ask a small children to put something over their mouth and nose all day long and have them suffer, and then tell them to go eat lunch with others around with no mask on, or come home and go play outside and have it make sense. Unless you are doing 100% of everything safety-wise, 100% of the time, there's no way to stop this, especially for children. Having a hole in a mask for band does what exactly? Even the CDC has stated on their website that wearing a mask around someone positive with COVID for more than 15 minutes does absolutely nothing for you. A 2015 study by the Medical Business Journal, which was supported by the CDC and the WHO, advised against cloth masks as they were not effective and in some cases more dangerous for other reasons for airborne viruses. What changed since then? Not science. Another study found that adults were 10 times more likely to touch their face in a day with a mask on due to putting it on, taking it off, adjusting it, itching it because of it. What happens to that number when it's kids? We aren't proven to effectively stop this, and the rates have proven that while it is something to be concerned about, especially for select groups of people, it is not nearly as bad as originally thought. You made us make this decision to return our kids to school or not, with the mask requirement not in place. Now, last minute, after families have already made their plans for their future, you're asking us to change it. In a short period of time, I'm going on a deployment here, and we made the decision that our children wanted to go back to school, and we were going to allow them. My wife signed up for online schooling again because I was going to be gone. And now all of a sudden that might change because we're going to possibly have 4 kids at home. Now what happens to the online schooling? This is just one circumstance here. What about the thousands of others in Okaloosa County? This mask mandate makes no sense. We as parents have the right to be able to opt our children out of this for medical reasons, personal reasons, or what have you. I am not against anybody who is scared for this or has other reasons why they can't wear a mask at all. If they feel they need to wear a mask, please do so. But you can't mandate other children to do it. Thank you.
Okay. All right, thank you, sir. We appreciate your service to our country as well.
Thank you.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hi, my name is Julie Ann Stringfellow. I live at 1029 Lakeway Drive, Niceville. I'm a mom of 3 Okaloosa County students, 2 present, 1 past. The one that's in the past graduated with honors and is a sophomore at the University of Florida. He is now staying home this semester to protect himself and the rest of our family. And we're comfortable with that. My 2 students that are a rising freshman and a rising senior, they have IEPs. They are both, the senior is in high honors and a great athlete and excelling in all things that she's done. And my freshman, he's following suit behind. One of the most amazing programs that Niceville High School has to offer is the leadership program. And this is in jeopardy now because I really felt encouraged that not only would a mask mandate pass, that I could at least send them to 1 class. I have opted to do my school online for both my high school students, and I'm comfortable with that. I don't have a problem with that. But I really want them to attend Niceville High School and be a part of the leadership program and band. I've been a conversation with the band director at Niceville, and they're doing everything they can to make it virtual for that class. So that's not an issue. But leadership class is the most important class, or one of the most important classes that Niceville, and I think anything in Okaloosa County could offer to these kids, especially those that are high achieving and ready to go to the next level. And big schools like the University of Florida and Florida State absolutely look at that on their resumes. And now, if we don't have a mask, well, I'm for the mask mandate, but I am not for the opt-in because then that's just kind of, it negates the whole thing. I don't have any questions or anything like that. The reason I just want to state, because I've heard all these other stories of everyone else that has spoken so far tonight. I'm a full-time caregiver for my aunt. She was a product of Okaloosa County Schools. She taught for 14 years at Florosa Elementary. She now has ALS. I have to care for her many times a week. She's extremely immune compromised. She's a 60-year-old woman who is going to be on an incubator before we know it, and I don't want to put her on that any sooner because I sent my kids to school, brick and mortar. Like I said, those are the reasons why I chose to go to online school for my kids. Again, I'm just for the mask mandate, but I am opposed to the opt-out program. Congratulations, Mr. Chambers. Thank you all board members for staying as late as you have. I appreciate that. And for those that I've written by emails a number of times, and I've gotten personal phone calls from a couple of you, I appreciate that as well. Thank you and have a good night.
Thank you, Ms. Stringfellow. You have a nice evening.
We're down to 6 lines.
Okay.
For the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board. Whoops. Let me try that again. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You are now live with the board. You have 4 minutes.
Great, I can hear you now. My name is John Barlow, 960 Dixie Street, Crestview, Florida. I want to thank all the board members for continuing to stay on. I did not know that there was a meeting, did not get an email, did not see it on Facebook, but I did have a neighbor who said she saw it through the paper. So I want to thank you and express my appreciation. What I don't understand is we came to this decision to either go virtual or brick and mortar, and now at the 11th hour, we're trying to figure out about the mask mandate. I have a daughter. She has asthma. She has trouble wearing a mask in the grocery store for more than a couple of minutes. And it's troubling to think that the option for her to not wear a mask is potentially off the table. I would strongly encourage this not to go forward with a mandate of a mask. I also have had firsthand knowledge from a local doctor here in town who says the masks don't work, and is more than happy to bring patients in without wearing a mask. And the doctor's recommendation: wash your hands, don't touch your face, social distance best you can. If if somebody is sick, don't be around them. Don't step into the fire. So I'm very confident that the school systems have done their due diligence in trying to make the schools as safe as possible. I would be willing to bet that they are safer than most grocery stores, gas stations, and other public places that you could visit. And I think that the children just need to get back to a bit of normalcy, which a great place to do that is in the schools. Providing masks to children that are going to continue to have those on through all hours, they're losing all the social aspects, the smiles, the facial features that all these developing minds need to be able to experience. And if we're not going to allow them to have that, then there's no reason to open up the schools. But I truly believe that the school system has done what they can do to make this as safe as possible, and we need to get these kids back to school. If anything changes, then we can take it at that point. But for these parents that are worried about splitting the classes, just let's provide them with the laptop so they can go virtual, and then they won't have those concerns. As far as I'm concerned, I feel confident that the school is safe enough to send my daughter to school and to get back to some normalcy. That's what I would like to see, and I think we can do that.
Right.
I think y'all have done a great job.
Thank you. Thank you, Mr. Barlow.
That's all I really had to say.
Thank you, Mr. Barlow, and we appreciate your comments.
Absolutely. Thank you. Have a good night.
You too.
Go ahead and put the next caller through, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hello. My name's Nicholas Millette, and I'm at 18 Bay Drive, Fort Walton Beach, Florida. And I really appreciate y'all staying late, and I know this just seems like a broken record and just a bunch of back and forth. And I have several young kids going to school here, starting third grade and second, and then some going into high school. And I graduated Fort Walton Beach myself, and my dad and his brothers the same. And I remember growing up and going through school, and a lot of these people talk about the getting to school and being safe, and I just don't understand how you can do that and not seeing facial expressions and the love that you get from the teachers, the hugs, being able to visit with your friends and just be able to hang out and have fun, and then how do you even know who is disrupting class? And I can just remember the countless times that the kids are acting out, and that's got to be pretty easy to hide there behind a mask. And as far as the the virus is. The death rate is so low, it's bizarre that anybody's even talking about it anymore. I mean, tuberculosis, 1.5 million people died last year of it, and we're not doing, there's nothing spoke about it. I got friends, a close friend of mine has this, she's got warts in her chest and has got the most compromised immune system and has been hospitalized twice for the flu. And she's tested positive for COVID and was not hospitalized. And she has 12 foster kids at her house. And all this talk about COVID and the kids, and we got all the whole foster, all these young kids that all need help. And we're worried about, a 0.06 death rate here, or just, and that's even irrelevant. It's just bizarre. I don't know. Kids playing with their masks. I took my daughter to orientation today, and her and her friends, they're more worried about their mask being on their face. And then how do you discipline the kids? I mean, kids aren't going to want to wear their masks. And if they do want to, that's great, wear it. I just, I have a tough time just even picturing school with everybody masked in America, with everybody fought and died for it. I just have between the kids' anxiety, I don't know. I think that y'all will make the right decision, and I appreciate everybody's time. I'm not going to take up any more of it, but
all right. Thank you
I just hope you take all these things into factor. I thank y'all very much for your time.
Thank you very much for calling in. We do appreciate your comments.
Yeah.
Next caller, please. This is the Okaloosa School Board Public Comment Line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hi, this is Carrie Lindsay. We're moving to 1023 Limpkin Street from Kansas. So we will be in Crestview in Tim Bryant's district. My husband called in earlier, and as I've been listening to all the callers, I just kind of wanted to give another perspective, being from a state that is mandating. So first of all, before I start, I want to say thank you. I know that I can imagine all of you are ready to go home, but I wanted to share this perspective before you vote this evening. So again, Kansas has had a governor-enforced mandate since July the 2nd. We have 90 counties, including the one that I live in, that have opted in for that mask mandate. So almost 2 months now, we have been required to wear masks anywhere we go, indoors, outdoors, unless you have a medical exemption or your child is under the age of 2. So grocery shopping, restaurants, anywhere. Our numbers have continued to rise in the last 2 months under a mask mandate at the state level. We are at 11.4% positivity rate in our county. So my point is, they don't work. Kansas City, Dr. Burks came 2 weeks ago and declared Kansas City a hot spot. She's wanting to shut everything down again in our county and in Kansas City, Missouri. We cannot do this to individuals, and I can't express enough how proud I am of this county and of Florida as a state for not doing that, because we have almost 2 months of data in Kansas with a mandate from the governor and 90 counties out of 105 that are continuing to see spikes, and we're wearing masks all the time. Now, I have asthma, and my doctor has personally told me don't wear a mask because it's more harmful for me to wear one than it is for me not to wear one. So I don't show my medical exemption unless I get asked to show it. but I would never, even being immunocompromised, ever jeopardize the safety of a child for my well-being. I'm a Christian, and I believe that if it's time for me to go and I'm going to die of COVID, I'm going to die of COVID. I could die of the flu. My cousin's husband, 34 years old, was murdered this past weekend. We can die for all kinds of different reasons, but these are children. This is not a dress code issue. This is not covering arms and legs for modesty. This is putting a mask on a child's mouth and nose where they breathe in oxygen. And so I feel like I just wanted you to know that being in a state where it's been mandated, being in a county where it's been mandated, our schools, some of our school districts here are going completely virtual for the first 9 weeks because our numbers are so high and we're under a mask mandate. It only takes one person to spread this virus, whether they wear a mask or whether they don't wear a mask. We cannot continue to live in fear. Herd immunity is the only way that we're going to survive this virus because it's not going away. Thank you so much. I love you guys. I can't wait to live there and enjoy the freedom that Florida offers. Right. Good night, guys.
Thank you, Ms. Lindsay. And y'all, like I said, welcome to the neighborhood.
Thank you so much. Bye-bye.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes to speak. You're live with the board.
Hey guys, my name is Zarina Ellis and I live in Niceville, Florida. Am I in here?
Yes, ma'am. You have 4 minutes.
Oh, okay, cool. Thanks. My only concerns are, one is, why is this being brought up now? Our kids decided, us parents decided to send our kids back in July. And this wasn't a thing. We were in the middle of an election. We have our new superintendent, who I love, by the way. But now we're discussing masks 5 days before school starts. It makes absolutely no sense. My next concern here is going to be, hold on, I'm sorry. My next concern is going to be that just basically on the CDC website, it says that the only mask that's actually efficient, I mean, I'm all for protecting teachers, is the N95 mask, okay? That's 95% effective, supposedly, against COVID-19. And so if we're all, a lot of parents here, we're all concerned about our teachers and our kids, well, then have these teachers provide them with N95 masks, but on the CDC website says that these are for medical professionals, there's not enough. I mean, if there's not enough, that's another whole issue. But they should be able to wear these masks to keep them safe if this is such a big concern of these older teachers and everything. And a piece of cloth, we're asking right now our kids to wear a piece of cloth. We're asking them to wear a piece of a T-shirt that's cut up and tied around their ears, on their face, that's not properly really fitted to block out viruses or whatever. It's supposed to only stop large particles. Coronavirus comes in all sizes of particles, so a large particle and a small particle is completely different. They might still get sick, and they probably will. We're putting face shields on here. The virus isn't going to just stop on the shield. Actually, on the CDC website, it says that it's going to do more harm than good doing these shields, unless they're constantly being wiped down, because the virus can sit on these shields a little bit longer, and I guess it just lives better there. That's another issue, we're running into. So my point is, it's okay to do these mask mandates. I'm personally sending 5 children to school, but if you don't do it right, there's no point in making our kids wear a piece of cloth over their face. If they're doing the N95 mask, that's different. It's suctioned to their face, it's well fitted. That might actually work, but we're asking them to wear a piece of cloth. And that's my only concern out of this. I don't want to send my kids to school with a piece of cloth. I already got all my kids' school supplies ready to go. And I don't feel like it's fair now, 5 days before school starts, after an election, that now this is being brought up. This should have been brought up way before, not now. Not now telling these parents, hey, now you have to redo your entire structure so you can send your kids to school or not. My kids are going to camp right now at PLU, and it's going great. They're not wearing masks. They're sanitizing. These teachers are keeping it clean. I mean, it's fine. So that's really all I have to say.
All right. Well, thank you very much for calling in tonight, and we do appreciate your comments.
Thank you.
Yes, ma'am.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You've got 4 minutes. You're live with the school board.
Hi, my name is David Dye. My address is 1652 St. Lawrence Drive in Niceville. I'm a student at Niceville High School, and part of my whole deal with calling is because it's a very big deal to me that I and my fellow students are safe at school. And I know that masks and face shields are going to be necessary for that to actually happen. Part of my reason in needing this is because my mom has been diagnosed with breast cancer, and she's undergoing cancer treatment to get rid of that, which is making her extremely immunosuppressed. And I have a grandma, as many other students at Niceville do, who is very old and within that range that if she gets the virus, she's exceptionally at risk. And I don't want my family members to die, is what I'm saying. So I've been hearing all of the other callers talk, and they've been talking about mostly how their children can't wear the masks because there is an underlying health risk, underlying health concern, but basically they just can't get oxygen. And I understand that that's a significant issue for these families and these children, but there are other options. There are face shields, which can be up to 96% effective at stopping airborne particulates, as a study showed on PubMed.gov. And you can buy 100 of those for $100. They're exceptionally cheap for what they are. So it's just something to consider. If there's another option for these kids, that would be fantastic, because I really want everybody to be as safe as they possibly can. We're going through an unprecedented issue in the entire nation, the entire world, and I think it's really important that we keep as many people here as safe as we can, because a lot of students, they don't have an option. You could go online, but you're not going to get the same rigor and class structure as you would from being in class. I myself am taking a significant load of AP classes, of which I'm taking as many as I think that I can manage online, but the rest of them, which I know are going to be harder courses, I've had to schedule in class because I can't do them at home. There's no way. So I won't spend too much more time. I just wanted to give some food for thought, and I hope that this can make a difference. Thank you for having me on.
All right. Thank you for calling, and good luck in your senior year.
Thank you. Goodbye.
Next caller, please. This is the Okaloosa County School Board public comment line. Please state your name and full address for the record. You've got 4 minutes. You're live with the school board.
Yes, my name is Callan McGraw. I live at 649 Earl Campbell Road in Laurel Hill, Florida. And I'm actually calling, I'm actually a homeschooling parent. However, I have a lot of friends and parents of my children's friends who do send their kids to public schools. And this is something that I've heard them discussing, and we've discussed together and prayed about, because they're all very concerned that this is being brought up so close to school starting. And I had a couple of thoughts on that, in that parents were given this choice back in July, and it doesn't seem very fair to me that all of a sudden these parents and these children are now having
basically go back and question that, wondering, okay, did we make the right choice here? We made our decision based off of these standards, and now all of a sudden this is potentially changing. And we have a lot of families right now within our county that are they're struggling because they've made these decisions, and all of a sudden their worlds are getting turned upside down again because they chose to send their kids knowing that they would not have to be wearing a face mask, and that was their own choice for their family. That was what they were comfortable with. And I strongly believe in parent choice when it comes to kids. And I think that they have absolutely every right to make the decision for what is best for their family. Whether it's, if somebody wants to send their kid with a face mask, then I think that's great. That's, their choice for their family. If somebody chooses not to because they want to give their kids a sense of normalcy in the world today, then I think that's great too, and they absolutely should have the chance to make that choice. Just the kids have gone through so much change as it is, and even though we're a homeschooling family, I've seen my kids impacted in this through a lot of their extracurricular activities having to be changed and things switched around. For a while there, they were having to deal with a whole new set of rules, and they're finally able to come back to some sense of normalcy and join back into their normal activities. And it's been such a great thing for them. It's been so positive for them to be able to be around friends and do the things that they enjoy and that they love. And I really think that that's one of the things that we need to take into consideration when we think about protecting our children. Is, obviously protecting their health and their safety, but part of that includes protecting their mental health and making sure that we're doing all we can to keep them kids and just let them have the freedom to be children and enjoy their time with their friends and their school years, and not let this be something that they look back on later in life with anxiety, and that this is how they remember their school year, but that they are able to go into it and hopefully take something negative and turn it into a positive. And,
okay. Ma'am, I hate to interrupt you, but your time has expired, and we do have other callers waiting to call in.
Thank you.
Okay, thank you for your comments. We do appreciate them.
Next caller, please. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
I'm so excited to be live. I'm Lisa Severico at 818 Lark Street, Fort Walton Beach, Florida. I just wanted to say congratulations, Marcus Chamber.
Thank
Y'all
you.
have a good night.
All right.
Let's run now.
Thank you very much. I guess that was right to the point.
Next caller, please. And then confirm for me that this is the last one. This is the Okaloosa School Board public comment line. Please state your name and full address for the record. You'll have 4 minutes. You're live with the school board.
Hi, yes, my name is Adam Geithner, and I'm on Sadler Court in Niceville. First off, appreciate you all getting together. I don't necessarily think this meeting should have occurred due to the options we had before, but nevertheless, I do appreciate you all staying late. This is going to be a quick comment. I'm going to go over a couple stats, and the reason I'm going to go over these stats is because I believe the whole mask debate is missing the forest from the trees. And really, it's a measure, whether you agree with it or not. I don't agree that it mitigates risk, but it's a way to mitigate risk. Well, first we have to look at what the risk is. So in Florida, there are roughly 4,200,000 people below the age of 18, and this is the age of students. There have been 8 people under the age of 18 that have died from either with or from COVID-19. That's 0.00019%. Now, I understand a lot of people say that, yes, kids are not at risk, but teachers and staff are at risk. Okay, so if we look at teachers and staff, they're potentially age 19 to 65, and there are 12,300,000 people of that age in Florida. Of those, 2,064 people have died between the ages of 19 and 64, either from or with COVID-19. That is 0.016% of all persons. Now, in the abstract, that doesn't mean much. But in an average flu season, guess how many Floridians die ages 19 to 65 from the seasonal flu? Roughly 2,500. So I think it's important that we keep things in context, and having an emergency meeting to put masks on our children without parents being able to opt out of such a mandate is, I think we need to step back and really look at what we're doing. And I think we need to be able to look at things and allow families to manage risk. And I know this virus is real, and it does affect a smaller subset of the population, the elderly, especially with comorbidities, but never in the history of contagions do we limit or stop free society from functioning in order to protect a small group of people. What we do is we put in practical measures for those people to be protected, and that's incumbent upon individuals, families, our community to set those measures in place. But doing it to the entire community is not a proper or practical measure for how we go about mitigating or managing risk. So I'd like you to consider those numbers, especially, and I highlighted in comparison to the flu. People don't like to do that, but in terms of stratified risk, kids are 10 times less at risk from the flu, and people age 19 to 65 within that spectrum are roughly on par with the flu. That's the data, and I ask people to go look at that themselves and research it, so please keep that in mind. Thank you again for your time. I appreciate it.
Thank you very much for calling in, and we do appreciate your calls.
Good night.
Good night. Okay, so we are now done with public comment, and we're going to move back to 3.1, and this is the discussion agenda, and the floor is now open for
Mr. Bryant, you have 15 minutes to your next camera break.
Okay. Just give me the high sign when we're ready. Okay, so the floor is now open for any discussion regarding this policy.
Look at me.
Does anybody, any questions, or I'm leaving it to school board members to open it up?
I'm sure Mr. Destin's ready to start.
Okay.
Oh, well.
All right, so
I wouldn't be
Mr.
so sure, Mr. Destin. I guess our first question is, should we go forward with the opt-out provision that has been added to this? Pretty much a contradiction in the direction that the emergency policy would be taking us in, because as anyone who looks at this can see, if we have an opt-out that's available to everybody in our school district, then we don't really have a policy at all. So, as a first step toward hashing out this problem, I would make a motion that the opt-out be taken out of this policy.
Okay. So, Mr. Destin,
and
go ahead, Dr. White.
Mr. Bryan, I guess for me, and I know it's late, and I certainly don't want to bog things down, but I'm wondering if this, and I understand it's a special meeting, so there may be special conditions that we choose to invoke, but since there is a recommended action, do we first need a motion on that action and then a second to proceed?
Mr. McInnes.
You've had your public comment now, and so I guess the matter before the board is the recommended policy. It would typically be appropriate that you get some motion on the floor.
Right.
Which
And-
that can then be amended.
Right. And that is, and Dr. White, you are correct. It is late, and I should have known better. So right now, we are back up to discussion agenda 3.1. So I need a motion to approve the agenda, approve that? Is that how we're going?
To take some action.
Yes.
Just so you get it on the floor for
Right.
discussion.
Yes. So, Dr. White, thank you very much for correcting me on that. And so I do.
I didn't mean to correct. I'm just trying to help.
No. And I appreciate that and respect that. So at this point, I need a motion to approve item 3.1.
Which is discussion.
For discussion, yes.
And I'll second it.
Okay, so we have a motion and a second, and now we're up for discussion.
Okay, and now I will make a substitute motion. I'll tell you what, let's let the discussion go first.
Okay, go ahead, Dr. Kelly.
Okay, I was just going to say several things, but before I make my personal comments, I wanted to recognize that we had several students, mainly from my district, who spoke up, and I want them to know from their board member to them how very proud I was of them, that they were very well spoken, that their points were very well laid out, and that they represented themselves, their families, and their school very well. And I'd just like to mention Maddie Hensey, Gabby Ferris, a third grader from Fort Walton Beach, whose name I unfortunately did not get, Mia, whose last name I didn't get, Miranda Gillespie, and David Dunn. And I think those students did us proud as students from the Okaloosa County school system, and I just wanted to say that first. So now for my points, I've already made a couple of those when I was addressing one caller who called in, but I'll just reiterate very briefly. I do realize that semantics and interpretation, along with personal preference, are all playing a part in this. And of course, every caller was passionate, and I think I counted, I was trying to keep up as they called in. I think we were to number 77. I think that was the last caller. And I think as I was trying to count, there were so many that were either on the fence or never gave us a definitive as to whether they were for or against. But those that I could tell that were definitive in their statements to us, I think I caught about 35 who said they were for the proposed mandate, either with or without the opt-out, and I haven't had a chance to go back and look at how many of those were for the mandate with no opt-out, but that seemed to have been the strength, and about 20 were definitively against. So we're still somewhat split, but I see a pattern here. So to reiterate the points I made earlier, I said I've been asking for clarification on the mask recommendation since July, and it was strongly recommended at that time. I tried to get some clarity. I think I've been trying for 2 months now, or approximately, prior to the time that students and parents and teachers would have been making their decisions. For me, the term opt-out was only thrown out there more as an exemption and as a way for those very few cases of extreme ESE situations, because I wanted those students to have that opportunity and not to be blended in just a general statement or policy that we might have made. I did not intend for that to mean for everybody's interpretation of whenever they wanted to opt out. My thought was that since we are told to lean into the guidance that we are given by the CDC and our own local health department, and Dr. Chapman has been very open with providing information for us. She has said to us that to prevent the spread of COVID-19, we need 3 things, and we need those 3 things in conjunction with each other. We need social distancing and hand hygiene and mask wearing. We need all 3 of those according to our health professionals. And those professionals further tell us that implementing 2 of the 3 elements causes concern and puts us in danger of another potential shutdown of our schools. That is the part that gives me grave concern, because I don't want to put our students' academic progress or their parents' opportunities to return to work and stay there, particularly in jeopardy. In other words, I feel like an ounce of prevention is worth a pound of cure, and even our military facilities, one of which, a school we have, is located in that installation, and they require masks in order to protect their mission. And as we know, we lean largely into the military, whose force is vital in our area. I'll go back to saying that I believe we wear masks as a part of our school culture rather than making it punitive. And we emphasize that we exercise care and concern when we remind others of the importance of their use of it. It's not punitive. So those are the arguments and the points I've been making since July. So just to reiterate my stand there. Thank you, Mr. Chairman.
Thank you, Dr. Kelly. Any other discussion?
Yes.
Well, I have a question, Mr. Ryan.
Yes, sir.
Well, I guess based upon the many comments that I heard tonight, I have some concerns. And what it seemed to me that I heard from parents was that they believed that masks were not required when they made the decision to enroll in brick and mortar schools. So my question is, if this recommended policy is not adopted in current form or in an amended form, then will we simply revert back to the stance that face mask coverings are strongly encouraged? And if so, what does that really mean, strongly encouraged? Apparently, from the comments tonight, the parents feels like that there was no requirement or there would be no mask worn if they chose to go to brick and mortar schools. So that's my question.
Okay.
If we don't adopt this motion, excuse me, Dr. Kelly, go ahead.
I'm sorry, I was just reiterating that was why I had sought clarity all along, was because there was such lack of clarity and some confusion as to what strongly recommended would mean in the reality of day-to-day school life.
I understand. And so it seems like this meeting here then will have some worthwhile outcomes if in fact we do adopt a motion so that all that stuff is cleared up. But in any case, that was my question, is if we don't do anything because we can't get the 3 votes, do we just simply revert back to the previous stance of strongly encouraged?
I would think that would be the direction. Yes, sir.
Of course, the question is of whether that would be a school board policy or simply one from the district. Without any action by the school board, I would say that is not a policy of the school board and would be a policy of the district.
Okay.
Superintendent.
And I would concur. I concur with that, Mr. Destin. I think that is what was to happen pertinent to the letter that was sent home with the reopening of school information.
Okay.
So it would be more of a.
Go ahead.
My comments were never intended to institute necessarily a policy, but just to get clarity so that teachers and parents would know what that really meant.
Right. Okay, Ms. Vanchek.
So the way I'm hearing it, then it would be more a procedure from the district side, which is where it was before when you said, Mr. Chambers, that we're highly recommending. And we left it there for a long time as far as taking any kind of action. I do feel that at this late time, there is an unfair element in changing to a mandate because so many did make a decision based on that information at the time. So having them at this late date, and many brought that up, it's not even so much I'm against a mask, it's just that I've already got my head set on we're going to do this way without, with no the recommendation that it would be really unfair to force them. And thinking ahead, let's say we do make it mandated, I think we might all consider the chaos that would happen in our district, that we're already to this, to the point where we're set to go Monday. We heard representatives of the public say, I will pull my students out. I will make different decisions. And we know that that is a real challenge. Of course, we're going to accommodate, but at this point, if we do that, then that really would be some chaotic stuff that you're putting back on these schools that I think is really bad. The other thing that I had said initially through all of this is that I didn't want any of this decision we make to be punitive, which the opt-out does give. So there would not be anything on for either a student or a teacher. But also I didn't want, I think I used the example a couple of times, that the teacher would end up the bad guy because we mandated a policy that one person, if you do it where one person kind of interprets one way and the other one says, I don't care if you have a mask on or not. I didn't want to have that on. But it's true that if we just go with what was out there and the information that the parents initially got and made a choice on, then it wouldn't necessarily be a policy. It would be a procedure on how we're starting this school year. That's the way I see it.
Okay. And if I can, I would like to just make a comment. I have a prepared comment right here, and it's appropriate at this time. But first of all, I would like to thank everybody who called in tonight. What an incredible meeting. And even though we're here at the 11:30, this has been a very productive, and it's great to have the community get out. However you look at it, it has been very much appreciative of all the feedback we've got. And I also would like to publicly apologize to the newcomers. I wasn't trying to be disrespectful or rude or anything like that. I just felt I needed to make that statement, but it was not intended to make be disrespectful, and I do apologize if you felt that way. So tonight, we possibly could vote on a policy that was presented to us by Mr. Chambers at our request. Our students and employees are our priority, and their health and safety is at the top of all of our list. Every decision is made with that in mind. I have thought about this, prayed about it, researched it, sought input from teachers and parents, spoke with other school board members outside of our county and teachers in other counties, and either way I vote, there are going to be people who are not going to be happy either way. I would like to commend Mr. Chambers and the entire Okaloosa County School District on their commitment to getting our schools back open safely on August 31st. It has been a monumental task, to say the least. During this time, the subject of a mask mandate made its way around other county and city governments in our community. It was a divisive issue then, and it will continue, and it continues to be today. And as we've heard over the last 5 days, it is very divisive. I believe through Mr. Chambers' leadership, our district has been on the forefront following CDC guidelines and encouraging our school teams to do the same. Over this time, we have strongly recommended the use of face coverings when we cannot be socially distant. At the same time, our school teams have followed and have come up with plans that strongly encourage the use of face coverings and have even presented videos of what their schools are going to require as it comes to face coverings. I believe that as a district, the schools create the expectation of how our school will operate. Administrators create the culture. They do this every year, and it goes into the classrooms as teachers meet students and parents to share their expectations of their classroom. Parents have been given 3 options to begin the school year. First is the traditional school setting. Second is an online version. And third is the homeschool or private school option. The district has spent an incredible amount of money on purchasing PPE for the entire district to provide a level of safety for all who come into the school. We have restricted for the first 9 weeks parents, visitors, and others coming into the schools to help keep our students safe while in school. We require everyone's temperature to be checked before entering our schools. Students must wear masks on buses because we cannot social distance on the bus. We have asked that students have a mask on them at all times. So in the event that the student has to wear one, it is with them. We have done all of this by creating an expectation without needing a policy. Up until recently, the majority of our parents, staff, and community have been agreeable to the superintendent's recommendation. Yes, we've had some on both sides contact us, but overall, everyone was on board with the superintendent's expectation. It is also my belief that last week's election was proof that the majority of people have been satisfied with Mr. Chambers' direction on strongly recommending face covers, but also creating a culture of acceptance as to when a mask should be worn. So tonight we are at a point in which we might have to vote on a policy. That pretty much was and has been the expectation all along. We have a policy that, in my mind, has some questionable language, and it also gives parents an opt-out choice. Why have a policy when we can give an opt-out option? In the end, we have an opportunity to just continue Mr. Chambers' recommendations, as we have been told for a couple of months now, or create a policy that in the end really has no significant bearing if we allow an opt-out, plus it will create chaos within the schools with people feeling like they will need to take their kids out of school. I also believe that this policy could have an adverse effect and will create more work for our already burdened school employees. I have publicly stated that I do not support a mandate policy because if you create an expectation and explain to people that what your expectations are, the vast majority will follow with no issues. This is true throughout the county. Government did not make a mandate. The private sector took the lead and created expectations for those entering their businesses, as well as county offices and our military partners. So respectfully, if a vote comes up tonight on a policy, I will not vote to support it because at this time I felt like the expectations were there and there is no need to mandate a policy.
Chairman, if I may ask a couple of questions, and it's always good to have some facts when you make decisions and deal with questions such as these. And Mr. Chambers, you can answer, or Mr. Horton. We have been engaged in summer school for several months now, which is kind of a much scaled down version of what we're about to go into on Monday. Can you tell me how many numbers of positive results we had among staff members and students over the summer school?
Yeah, so, and if you don't mind, I'll even go maybe a little bit even broader, if that's okay. And I'll discuss the student side, and then I'll ask Dr. Hale to come up to discuss the employee side. But what we have right now from the numbers provided to me is we've had 6 reported cases of COVID positive students in the district. One of those students being a summer recovery student, and 5 of those students being athletes. And one of the things that we also looked at is we had approximately 833 students in summer recovery, approximately 142 in daycare programs, and so that's about approximately 975 students. Additionally, if you take into account middle school band and athletics, high school band and athletics, that's somewhere probably another 1,000 or so students coming across our schools. So we had, of that total number, we had 1 summer recovery student and then 5 athletes tested positive. And Dr. Hale, if you'd come up and discuss the employee side.
Good evening, everyone. I would just like to let you know some overall data. It's not specifically related to summer school, but beginning in March all the way to this point with regard to the employees and then the documentation, the reports that we've been given. Now, certainly I'm not going to assume that all the teachers that have been gone since March have reported all the various illnesses that they had while they were remote and not around us, but I can tell you that we have had reports of a total of 43 adult positive cases since last March, but only 18 of those 43 indicated that they had spent any time on campus prior to this positive test. So there was a lot of community impact to these adults. 25 of the 43 had not been on campus at all. None of the 18 who had been on our campuses contaminated other close contacts or were contaminated as a result of being a close contact, which is a testament to all the procedures that Ms. Schroeder had put together for us and all the different protocols that we had put together. 7 of those positive cases were identified as coaches, but none of those were identified as close contacts prior to the positive tests. And of course, none further contaminated close contacts according to the information that we had. So of the positive tests, only 18 of those had drifted through our campuses at all, and none of them were identified either prior to as a close contact or created any close contact positives beyond that. So, and that's since March.
Okay, I had one other question. Absent a school board policy, are masks going to be mandatory? And this might be for you Superintendent. Will masks be mandatory on schools or in hallways?
Absent a policy, no. So absent a policy, they would be strongly recommended.
And that's the only issue I have. We are not even going so far as to mandate masks in the common areas. We have a policy recommendation in front of us. We can modify it, change it, not adopt it at all, but to do nothing at all on behalf of this board strikes me as irresponsible. We at least need to say you have to wear a mask when you're on a school bus or changing classes or other common grounds.
But I thought that was already, the expectation
bus.
is that the bus and in common areas.
An
At least that's the way I
expectation.
can.
So
An
on school
expectation.
buses, so we've already made the stance that masks are required on school buses, but that is the only place that we have required masks.
Okay.
And that's a requirement or an expectation.
That is a requirement.
What happens to a student who doesn't have a mask on a bus?
Excuse me.
Hold on for a second. We're answering Mr. Dessen's question, so go ahead, Mr.
If a
Chambers.
student were to refuse to wear a mask on the bus, then that family would have to make other arrangements.
And could we not do that same enforcement in the common areas, changing classes in some of the other areas that we know are going to be dangerous?
So as a board right now, I think you have the ability to look at the policy as recommended, and I think you have the ability to look at any adjustments that you would like to make.
Okay. Dr. White, I believe you wanted to make a comment?
Well, yes, I do, and of course, I understand the superintendent's thoughts about school buses and those kinds of things, but I think there is no policy for that. And if policy is important for that, then I guess we probably ought to consider that. But I do have a question for our attorney, Mr. Bryant.
Yes, sir.
That certainly plays into the whole idea about the policy that is currently on the table with a motion and a second. So might I address my question to Mr. McInnes?
Yes, sir, of course.
Mr. McInnes, the recommended policy that we are now considering and the first draft of the policy provides a number of exceptions or exemptions from wearing masks for students, employees, and others. For example, like all pre-kindergarten students are exempted from wearing a mask. All kindergarten students are exempted from wearing masks. Special education students, medical exceptions, etc. And there's even in the newest version of the policy an opt-out provision. However, the newest policy and the former policy provides other information and direction to our school district employees, our parents and families, and so forth, And so I'm wondering if you could speak to why this policy, even though it includes an opt-out provision, might have some value.
Yes, sir. Dr. White, as you've stated, the policy itself puts into writing certain definitions, certain parameters, certain standards that school administrators would be able to follow. Certainly for those persons who are wearing masks and who are following those recommendations that are in this policy. A number of the exceptions are not things that a parent or employee would have to apply for an exception. They are just operational exceptions that school administrators would know how to put in place. For instance, not requiring masks when you're at a scheduled meal time, not requiring masks when you're in outside settings where the social distancing is possible. So there are a number of matters in the policy that whether or not there's an opt-out provision that would provide guidance to schools and district offices if they were in place.
Thank you, Mr. McInnes. And one of the things that I saw, and I know that we had faculty members call in, and I know that they're exactly right that they would do this, but I believe the drafted policy also included breaks from wearing masks in the classrooms. Is that correct?
Yes, sir. It provides for face covering breaks in order not to have students be wearing the face covering for the entire day. It leaves that discretion to the teachers and staff to give them a break and to take breaks themselves.
Yes, sir. And so in my mind, Mr. Chairman, and superintendent for that matter, if this policy fails to pass, or if the first or second is withdrawn, I guess it would be your responsibility, sir, to direct all of your people to all of those provisions if there was not a policy. Is that right?
Yes, sir.
So that's how I see it. Either we're going to get 3 votes to adopt the policy, the motion that's on the table, or we're going to amend the motion that's on the table, or it's just not going to pass, and we're going to revert back to the original language from the superintendent. That's all, Mr. Chairman.
Okay, thank you, Dr. White. Dr. Kelly, did I hear you earlier?
Yes, I was going to ask if you or the attorney could reread what we are considering. Is the motion with the opt-out or without the opt-out? I'm so sorry, but we've had such a long and convoluted conversation. I've lost track there, and I would love to be reminded.
Okay, so Dr. Kelly, on the 3.1, it is with the opt-out provision. That's what we've advertised.
And let me add, Dr. Kelly, that as the superintendent announced at the beginning of the meeting, and that I reviewed when I went through it, he has added 2 additional revisions or recommendations to that policy. That it does have the opt-out clause. It would also, though, have a provision that would not make the opt-out available for bus transportation. And in the exception dealing with musical performances, it would give the band directors the discretion and authority to establish which of the instruments the split face mask would be required for. So that's my understanding of what's on the table right now.
Let me ask one more question, and Superintendent, you can help me with this one. We, as pointed out by a number of our callers tonight, we are surrounded by plexiglass barriers in our meeting tonight, and we are not wearing masks. I think we have ordered 21,000. We plan to put these barriers approximately on every desk for every student in the district. Is that correct?
Correct.
And so when we put these barriers in place, at that point, for all intents and purposes, we have, to the best of our ability, without moving desks, have social distanced the students. They are they'll be surrounded by these plexiglass barriers.
So they will be surrounded by the plexiglass barriers. However, just to the technical definition of social distancing, there could be some classes where that can happen, but due to the sizes of our classrooms across the district, the vast majority of our classrooms, it's almost virtually impossible to space out desks 6 feet apart. So just being very transparent there, which is why the desk barriers are important. And I do understand one of the callers, for example, said where the desk barrier necessarily doesn't come out maybe 6 to 10 inches past the desk, which is correct, but it is one of the approved desk barriers that we believe, and I think others also believe, does make a difference.
And I think at least the model that Mr. Horton showed us was a three-sided, if I'm correct.
That is
so
correct.
You would not be projecting your breath and potentially the viruses forward onto the other students. And the reason I'm asking about this and making this point is that this policy could well say that the mandatory mask provisions do not apply to classrooms where there are district installed barriers. Could it not?
It could.
Could I add there, though, that I'm afraid it might be misleading if we are letting our public believe that those desk barriers that have been delivered to schools are of the same quality and quantity that those that appear around the school board members.
Or do you believe they're not?
Am I correct about that?
No, you are correct. So the barriers that are the desk barriers in schools definitely do not look like these 2 feet by 3 feet or whatever the size of these glass barriers are. So they definitely do not look like that. I believe, and correct me if I'm wrong, Mr. Horton, we could have shared a different one, but I believe we shared what the desk barriers look like at one of the board meetings.
And I believe I was the board member that questioned the cost of those.
Yes, ma'am.
And I think we were shown 2 or maybe even 3 different varieties of those, but I think perhaps those that, as communicated to me, those that might have been delivered might be perceived as flimsier than those that we might have desired.
Ones that we showed to the board were the ones that were 3 individual pieces that were needed to be put together with little foundational bases. And so the ones that ended up being purchased were a single trifold piece with clear on all 3 sides, so they didn't need to be put together. And so they just are opened up and set on the desktop.
And so they are less effective than what we have here tonight? Is that what you're telling me?
Well, I wouldn't speak to the effectiveness of them. I do know that they're closed on 3 sides and not just separating on left and right. So they're desk barriers that a student would sit behind and have 3 sides covered.
And just being very specific, I think what we're saying, they're not this size that you see here. They're not this material. But none of the desk barriers, I shouldn't say none, the majority of desk barriers that I think that, at least that I've seen, aren't this size.
Well, I suppose we believe they are effective, or we would not spend $800, $600, whatever it is, to install them, correct?
I think any desk barrier provides some mitigation, yes, sir.
The point being that if we have that mitigation, we have taken steps toward social distancing that would not be there did we not install the barriers. Is that a fair assumption?
Well, I think to Mr. Chambers' point, if you put barriers between 2 people, I don't believe that the health department would say you've created social distancing between them. So if the 6-foot recommendation is always there, I think Dr. Chapman would say if a student's wearing masks, the 6-foot social distancing would still be recommended in all cases possible. So I'm not sure how to answer your question exactly, but if you're using desk barriers, if that means that students can be closer together with less risk.
Hopefully that's what we believe.
And I would say
we do.
that this is a measure.
It's a measure.
Once again, so this is one of many measures that we've taken. The desk barriers are one of many measures that we have taken that we do believe, based on input, that this would be a factor in helping keep our students and employees safe.
Well, the point that I was trying to make was that if we have the best desk barriers in place, the mask requirements are not quite as necessary. And in which case, we could go with a policy that said, in rooms that have the desk barriers, we don't have to have the mask mandate. I'm trying to flounder about to find some way to make our environment safer without having the 7-hour-a-day mask benefit a requirement, and that is one option. Since this policy is on the board on the floor at the moment, I would make an amendment or propose an amendment that would take the opt-out section out, because as I said earlier, to have an opt-out section in this policy renders it basically meaningless. And so I will offer that amendment to this policy.
Okay.
What is your amendment exactly? To
remove the opt-out option
okay.
from the policy itself.
Okay. Well, so I'm looking over this again, and even though this is done in the form of a policy, the way I'm seeing it, a lot of the things on here, the definition of a face covering and all that, could be, again, going back to procedures. It wouldn't have to be policy. It could be, this is how we're going to work things right now. And it wouldn't have to be a policy, because in my mind, when you do a policy and it's mandated, okay, then anything mandated, you're making a rule, you have to have repercussions when it's not. And then we get into punishing students and teachers, and I don't think that's right. The procedure was going to be, from the initially when it was ever stated, is that we were going to highly recommend the face coverings, and especially in areas where we couldn't social distance, and I believe that's what you're trying to get to. And I think we can use a lot of this as procedures to follow that we can give to our parents, our administrators, our schools, and yet not make it into a mandate where we have to then go about. For example, even in the opt-out, I've been asked, okay, so you let a student opt out. I'm assuming there'd be some kind of form, okay? But if I'm sitting in class, this is my class, how do I know Miss Lightbourne's an opt-out? That puts more things on the teacher. I don't know. I'm looking at Dr. Hale. He may be an opt-out. I don't know. Or he may just not have his mask on. That's just making it too complex.
And that would be the very reason that I've made a motion to amend the policy to take the opt-out out. And if you see procedures here that you feel are appropriate, let's pick them out and turn them into policies. Procedures do have consequences, and there will be disciplinary. The question I have with the road we're going, or the problem I have with the road we're going down now is we are not taking any stand at all on anything. And we're leaving the superintendent to take either the blame or the problem that he may have should the procedures not work, which is not fair to him, in my opinion. We need to, if there are things in this policy that we think are correct and should be in procedures, let's adopt them. This is a 90-day policy. If you feel uncomfortable with that, make it a 60-day emergency policy. But we're taking no action whatsoever as a board, and that's very regrettable, because if we take no action on these masks, I hope I'm wrong, but I think we're going to be back here very soon trying to figure out how in the world we're going to keep these schools open with the number of cases and positives that we have.
So it sounds to me like what you're trying to say, Mr. Destin, instead of the mandate on the mask, is do other situations that make it safe for the students where we don't have to put the emphasis on the mask. Is that right?
Well, that, and we've pointed out some procedures here and some some parts of this that the attorney has recommended that would be helpful as we go forward. I see no reason why we shouldn't take at least some of this and turn it into an emergency policy, rather than just take no action whatsoever, which is where it looks like we're heading, unless I am confused on the direction we're going.
Mr. Bryant.
Yes, sir, Dr. White.
Mr. Bryant.
Yes, sir.
And I appreciate and agree with just about everything that Mr. Destin and Ms. Ivanchek, both of them, are saying. But if I understand procedure correctly, I think Mr. Destin's motion to amend the recommended policy needs a second.
Correct.
Is that correct, Mr. Mickens?
Yes, sir.
Yes.
It is
Before
correct.
we start a lot of discussion.
Right. So Mr. Destin has made a recommendation for,
Removing the opt-out section, that would be section 15, sorry.
all right,
It's a motion to amend the main motion right now by removing the opt-out provision.
right,
Yes, it is.
okay,
So then it
And
makes.
let me ask a question really quickly.
The-
okay, hold
yeah.
on.
So just, so procedurally, because I just want to make sure where we're going. So if the opt-out policy gets a second, and I have a couple of questions on this line. So if the opt-out policy gets a second, and then that's voted on, then the policy for requiring masks anywhere social distancing cannot occur, then that takes effect, correct?
No.
No.
What has to happen procedurally is this. Mr. Destin has made a motion to amend the main motion to remove the opt-out provision from the policy. That has to be seconded before it can be voted on. Then it has to be voted on. If it's voted up, then the main motion has been amended. If it's voted down, the main motion stands as it is. If the amendment passes and the opt-out provision is taken out of the policy, the board still has to vote to adopt the policy as amended. So there's still another layer of vote that has to happen before that becomes a policy.
Okay, but taking the opt-out out takes it to the original thing with a couple of those things, which essentially mandates wearing masks, right?
That's what it sounds like.
And that's where we were back on Friday when we began getting a lot of feedback, no. Then then what happened is put the opt-out in, so now we're going to take that, we're voting to take that back out?
That
Well,
would be, if there were
if
a
there's a
second.
second, if
If
there's
there
a
were a
second.
second, that would be it, and then we would be back to voting on the motion as it was on Friday. However, I would point out that there are 14 exceptions to this mandate, and we can change, we can do another amendment to change anything we find in the remaining policy that we feel is objectionable.
But we still need a second.
Yes, we
Correct.
do.
So, but I also just want to chime in one more time. I'm just concerned that now at a point where parents have already made the commitment to have their kids back in school, I'm afraid that we might be opening up another situation that's going to make it harder on our schools to open up, with the students that have already committed to coming back to school. And I think that's going to have an adverse effect. So that's just my opinion, that will have an adverse effect on our schools.
And,
So-
and if you don't mind, if
Mr. Bryant, I understand that, but I feel like we need to have a second.
Yes, sir.
So that, because I'll have some comments if we have a second.
Okay. All right. So
do you mind if I add something really quickly?
go ahead.
All right. So I do want to bring us back once again to the June-July timeframe, where our stance was that we would look at masks in terms of strongly recommending. And some of the things we talked about at that time was not allowing this to become a disciplinary issue, not allowing this to become a distraction, so to speak, but strongly encouraging our administrators, our teachers, our staff to wear masks and utilizing those relationships as a means to get our students and families to wear masks. We have teachers right now who have reached out to their classes, to their families, and have said, hey, I'd really like to require masks, and many of them are successful in doing so. And I say all that to say, I also understand, like some of you have said, there's no way possible in this situation that we will make everyone happy. We know that within our school district, even employees right now, we're about 50-50 split. We know that from individuals that we've spoken with on the medical side, definitely have heard from Dr. Chapman, which I know we all respect, but we've also heard from other doctors who go the opposite way. So we know that there's a lot of information out there. I will say the policy that was presented without the opt-out, was presented by me, was presented by the superintendent, was not recommended by the superintendent. With the opt-out policy, that is what I did recommend as a means to allow for parent choice. And I'll say right here, this board meeting at 12:01 a.m., do I want masks to be worn? I do want masks to be worn, but there's a way to go about it. What I have seen through email, through social media, through conversations in the community is this is a very divided topic. So how do you get more to comply with one of the many measures to keep students and employees safe? It's working together as a team, as a community to do this, as opposed to mandating something that many are going to resist. And then what does that resist look like? That resist is going to look like many families removing themselves from the brick and mortar, going to online, which then is going to take a monumental effort as well to get these schedules back in line, back in order. I understand some of the families who have said, why is this happening now? I understand that question. I can say from my standpoint, and I know in these board meetings, we've said the entire time that we are going to continue to look at this situation, take input, and then at the appropriate time, make the necessary decision. At least for myself, with information that I get, I haven't seen a clear direction based on input, whether it be employees, whether it be families, whether it be community. This is a 50-50 split. Dr. Kelly is absolutely right. I think she has for about 2 months, and I respect that. For about 2 months has talked about some of this as well. And I know it's kind of ratcheted up over the last couple meetings, which is why last Thursday I did bring it up. What would we like to do as a board? We talked through that. We did come up with a policy. Once again, my belief is, how do we work together as a team, as a community, to add a measure of safety, which are masks, for our students and for our employees? And we can either do it through a mandate, which people, many might resist, or we do it coming together. The families that were adamantly opposed to this policy by mandating, I contacted a number of them, so have you. And what they shared with me is they will, many of them, their child will wear a mask, but they might wear it in the hallway. They might wear it in a crowded area, but they do not want it mandated across the board. So I just wanted to share that as whatever that might mean.
Okay. So thank you, Mr. Chambers, for your comments. And so we do have Mr. Destin's amendment to the current policy. And do we need a second? We do need is there a second to continue on?
I'll second.
Okay. So we have
I have a comment, Mr. Bryant.
Okay. Now, Dr. White, you're good to go.
Yeah, I didn't want to comment before because there wasn't a second. However, there certainly were a lot of comments, so I was about ready to jump in there. But since there is a second now, I guess my position is that this changes the superintendent's recommendation. Should this amendment pass, no longer is the policy that the board is considering the recommendation of the superintendent. The prior policy did bear the recommendation of the superintendent of schools. If we amend this policy, then no longer will this be the recommendation of the superintendent of schools. It will instead be the unilateral action of the school board. That's all I have to say.
Okay, thank you, Dr. White. All right.
Oh, one comment, and I respect what Dr. White is saying, but if you follow that line of reasoning to its logical conclusion, we can only approve school board policies that have the recommendation of the superintendent, which means we have no authority at all, and we're simply a rubber stamp. And I understand.
No, sir, that's not what I'm saying.
And I understand.
That's not what I'm saying at all.
I'm trying to follow it to its logical conclusion, Dr. White, and so then we can never adopt a policy that's not recommended by the superintendent.
No, in fact, we have adopted policies that weren't, and you and I did that together as a team. But what I'm saying in this situation, this recommendation has been made by the superintendent.
Yes, I understand. But school board policies are voted on by the school board, so unless we always accept the recommendations, then we have no real authority to change anything. And and we will vote on the opt-out, and then we will come back to the policy itself, you know. And we discussed at the last meeting. At the last meeting, how could we say we strongly recommend? Well, I think, you know, I would be just as happy to take out the section that deals with non-compliance. Now we have essentially what the superintendent has asked for, with the backing of us, without any punitive actions taken against people who don't comply, at least at this time. So, you know, I'm not advocating to completely reverse course on what the superintendent is recommending. I'm trying to find some way to go and strongly recommend math by incorporating it into a policy that this board supports.
But Mr. Chambers, the policy that you recommended is the one where you went back and redlined and added that piece on the opt-out. So if we vote to take that out, I think Dr. White is correct. It won't be the one you're recommending, correct?
Correct.
It'll revert back to, and then, but what Mr. Dustin is saying, then it would be at a point where the board could actually change that and make it a board policy, and it would take you out as far as truly recommending it. You might like it, but you wouldn't be putting it in front of us to recommend. It becomes our policy.
Now that we have a second, I would welcome your comment on taking the non-compliance part out, where we have essentially the same thing that you've recommended, which is strongly recommended, and we don't have a mechanism which to discipline non-compliance, which we don't at this point either. If we go with simply the policy, without the policy.
And just making sure that I understand. So you're talking about the opt-out policy gone, and then removing the punitive matter for the student or the employee. And I definitely appreciate the discussion. The only piece that would be interesting would be how the principal or how the AP or the teacher handled non-compliance. It would just be another layer that would be placed at the school level, which of course is where it is, but it'd be another layer that's placed on that school principal to make decisions for non-compliance with no direction.
And I see Mr. McGinnis probably has an opinion over there.
Well, the reason I wanted to mention that even if you remove the non-compliance provision, if you leave Part B in place where we say they must comply, even without non-compliance, it still is a mandatory school board policy. And we have other provisions that require employees to follow school board policy. Students are expected to follow school board policy. So even if you don't talk about non-compliance, if you leave it as must comply and adopt it, then the superintendent would be bound to enforce this as a school board policy, and it would have ramifications. If you wanted to recraft this to move forward the superintendent's position of strongly encourage and yours of strongly encourage, you could consider in Part B taking out the word must and inserting there that persons are strongly encouraged, and then the language goes to comply with CDC when social distancing cannot be met. We could then simply adjust in the exception areas the language where it says masks are not required. We would just make an adjustment there, because obviously once you start strongly encouraging, there is not a requirement. But the whole thing could be adopted as a board policy, and your policy could be that we are strongly encouraging compliance in this situation, and to give our schools guidance, the exceptions that are listed would be for principals and administrators to understand that even with our strong encouragement to wear the mask, we're outlining areas for you where we say that really not encouraged in those situations. So you'd be clear to give guidance to your faculty, to your students, and to your families that when they're eating, we don't expect the mask to be worn. When they're outside social distance, we don't expect it to be worn. You wouldn't necessarily need the exemptions for medical certification anymore, because under strongly recommend, no one would be mandated to wear it. So, I mean, I think there is a parameter here for a board policy that would do exactly now what the superintendent's describing that he prefers to do, and that is to have the school community and the parents and the teachers gather together on their own to provide this extra layer of safety, and the board could help guide that with this if you wanted to do it that way.
I would say that would be a route we can go down, but I would think that the amendment to take the opt-out would still stand. If we take the opt-out, then we would go down that pathway.
Okay. All right. Any other discussion on Mr. Destin's amendment? Okay. Ms. Vanchek, how do you vote?
Well, Mr. Bond.
Oh, so, go ahead, Dr.
I'm
White.
sorry, Brian. I was trying to get my phone off of mute.
Okay.
So in my case, I'm going to vote against Mr. Destin's amendment because it's not the superintendent's recommendation.
Right.
And in this case, I intended to support the superintendent's recommendation.
Okay.
And so I just wanted to make that remark, sir.
Okay.
Thank you.
So I will just go ahead and start with you, Dr. White, then. How do you vote?
Mr. Bryant.
Wait,
I
yeah.
apologize.
Wait, I'm sorry, go ahead, but that brought up something too. Okay.
Do you mind, or Mr. McGinnis, do you mind, one of the two just kind of clarifying what your amendment was? I understand removing the opt-out policy, but then bringing strongly encouraged into policy. I just want to make sure that I understand.
Well, that has to
not-
come later.
That's not what's on the table. The only item on the table is Mr. Destin's motion to amend the main motion to remove the opt-out exception item from the policy. So that's all that's on the table, and that's what that vote would do, would be to take that out. It would not implement the other revisions we were just discussing.
And then we hopefully would go forward with those revisions after that vote.
Could, or if there's a hesitancy on board members to vote just for that amendment, you could craft some of those revisions into your amendment now, and then people would know what they're voting on in full.
And that may be a better course. I was going to suggest that. So,
Because if this doesn't pass, and then we don't go forward, then we're back to square one, right?
Well, you would be back to voting on the policy as it was presented.
So I think, there might need to be some things to change, not just getting out the opt-out, so that perhaps the superintendent would feel more like it's closer to what he recommends, along with something that the board would look at as a policy.
And I would ask the board attorney, we went over those changes that you were talking about. Can we go through them one at a time so we can make sure that they're all part of this proposed amendment?
And is what I described what you'd like me to lay out?
Yes.
Okay. The first item would be then under section B, wearing of face coverings. On line 2, it says, or other person must. That could now be changed to say, or other person is strongly encouraged.
Okay.
To comply with CDC guidelines, and it would read on. And the language is already there that individuals subject to the policy are encouraged to provide their own masks, so that would not be mandatory. I think the district still is maintaining the emergency supplies and would have those available, so I don't think that would have to change. I think in the last line on that page, all persons, instead of shall, you would need to say all persons are strongly encouraged to have the face mask with them at all times.
Okay.
And I think we would put a period after on the next page where it says school district property. We can just put a period there because the rest of that dealt with saying even if you were in a place where you weren't mandated to have one, that wouldn't be necessary any longer.
Okay.
The next paragraph could still stand. It just says employees will make every effort to encourage students' compliance with the policy. The policy is encouraging. And if someone doesn't want to wear it, the employee would not be responsible for that. The CDC guideline language is probably still applicable in the event there's some major change over the 90-day window. You'd want the superintendent to be able to make adjustments.
Mm-hmm.
Face covering defined. I don't think that this change in any way affects the definition of what would, what we're recommending that the face covering would be made out of. I think even when you say strongly encouraged to wear, the principal still needs the ability. For instance, I think you should leave the language in about all face coverings must meet the dress code. I think the principal needs the ability to still have those type of rules of order there. The examples of acceptable and unacceptable, I mean, they can stay, but honestly, if it's not mandated, there really is not technically an unacceptable mask. You're not going to make somebody take one off and change it out. So it needs your guidance on whether that even needs to be there.
I don't think that hurts, though. It gives those principals some guidance on that, to leave those examples in. That's my opinion.
I mean, I think certainly the example of an acceptable face covering is appropriate to stay because it does kind of give them parameters. I suppose if someone came in with a different kind, because it's strongly encouraged to wear, I'm not really sure, unless it violated the dress code policy, that principals would be saying, well, that's not a acceptable face covering. I mean, that's the only question about leaving in the example of those that are not. We are defining what we would like them to be made of, and when they're helpful, so I don't know that it hurts to leave it here, but I just wanted to raise that issue for your thoughts.
If it doesn't hurt to leave it there, I'd leave it.
Okay. The top of the next page about the text, symbols, slogans, and dress codes, that probably should stay. When it comes to the exceptions, I would say that what we could do throughout the exceptions is simply remove any language that is talking about not required, because the policy will not be requiring mask at all. And you could, if you want to allow that editing, I can remove the words where it says not required out of
The strict application of the policy is not required of these students. That's what you're trying to take out, right?
Right,
Yeah.
right. So really what we would be doing is we would leave that teachers, employees are still would encourage students, but you don't have to talk about a strict application of the policy. So you could strike out the strict application of the policy is not required for these students, and even the word, and then but could start the new sentence where they're encouraged to do that. The last sentence there, dealing with students with certain disabilities and other conditions, this is just saying they should consult with their own physician about whether they wear one or not. I think that still is applicable because they could get their own personal information about whether to do that. That's not anything that's part of a mandate. And then number 2, the very young children. Once again, instead of are not required, we would need language that would keep that guidance for our principals.
How about face coverings would not be expected?
I think that could be a word, expected, because that's instead of required. And so we could just simply replace required with expected.
Is that just for number 2?
That'd be number 2.
Right. Mm-hmm.
Okay. The whole issue of face shields, we don't need. I mean, if the masks are strongly encouraged, then I would believe that we could leave some guidance in here about the CDC's evidence on the effectiveness of these. I don't think that you would really need to, well, actually, even where we outline the areas that they may be used, we're not mandating their use. We're just saying these areas are recognized as times when face shields may be used. So I think that probably could just stay like it is.
Mm-hmm.
Yep.
Okay.
Right.
The next one is the face covering breaks. And I think that language can remain there, because even if we have a large number in a school that wear them voluntarily, I think that if the principal knows that the board's policy is we're okay if teachers give breaks to kids and let them take them off, I don't think that hurts to have that there. And then I think on number 5, we just take out, like we did the other one, required, and put expected, that they're not expected to be worn while you're eating at scheduled meal times. The second sentence of 5 encourages social distancing while eating, and so I think that would work. On number 6, I would say again, we just replace required with expected. Once again, social distancing is strongly recommended. That would be appropriate. And that we would consider other guidance by outside groups, that would be appropriate. Number 7, we can replace required with expected under the musical performances, but it's my understanding that the bands already have these procedures worked out. They've been working on plans, informing the families, so I think that we could use the word expected there, and they would work as a team to do what's safe. And I know that there's already a plan in place to provide protective coverings for some of the bells on those horns, so I don't think that would have to change. And certainly all other safety procedures we'd want to be followed, so that would be acceptable. Number 8, once again, we could just replace required with expected.
Excuse me?
Am I allowed to call a point of order? There's a motion, a second on his motion to opt for the removal of the opt-out. I think that has to be voted on.
Well, he's asked that.
But he amended it.
He's asked.
He
yes.
wanted
Amended,
to-
yep.
He's, in essence, maybe withdrawing that motion and replacing it with another.
That's
Right.
exactly right.
We're down to number 9, the emergency
Right.
circumstances. And once again, I think that we can use the word expected. Number 10, required could be replaced with expected. I don't think we need number 11 at all now because there is not a need to get an exemption. Item 12 is really probably not necessary because we're back at strongly recommended, so no child would be forced to have the mask. I think number 13, we take expected, take out required and put expected. And number 14, if you want to leave a reference in so teachers feel comfortable in their classroom, if students are wearing masks and there is some impediment to instruction, they could let them take them off. I mean, they could take them off anyhow since they're not mandated, but this would at least
I'd
maybe
leave
give
that in.
teachers a feeling they can do that. So that means then that item 13 would be renumbered as 11. 14 becomes 12. We don't need 15 now because there's no opt-out needed since it's strongly encouraged. And I would suppose we don't need section E at all, which is the non-compliant section. We do need to keep in the section on Eglin Elementary because there are going to be mandates there that we need to abide by. So part F would become E, and G would become F. The effective date would still be the same. This is still only a 90-day policy because of the emergency nature of its adoption. So, Mr. Destin, if those revisions meet with what you were trying to do, you could make a motion to amend the main motion by substituting all of these changes that were just outlined.
And I will make that motion to amend the main motion to include the revisions we just outlined.
Okay. Do I have a second?
I'll second it.
Okay. Any other discussion?
I want to know from Mr. Chambers, does that align with what your recommendation would be?
It does.
Which
Does?
is
Okay.
It does.
which is the strongly recommend.
Strongly
Okay.
recommended. Okay, great.
All right. Any other discussion?
Well, based upon that, then, does that mean, Mr. Chambers, that this amended policy is now your recommendation?
Based on what was outlined, it would be.
Okay.
That's all I needed to know.
All right. Okay. Any other discussion? Okay. Hearing none. Ms. Savanchek, how do you vote?
Yes.
Dr. Kelly, how do you vote?
I'm going to officially vote no because this reverses everything that I've stood for the last 2 months with regard to supporting Dr. Chapman's recommendations. But in transparency, I want everyone to know that I will support the superintendent's recommendation in theory and in practice in the real world in Okaloosa County because I want to operate in harmony. So I just wanted to put that out there. Thank you.
You're welcome. Thank you for your comments. Mr. Destin?
I'll vote yes.
And because of the language of strongly, what's that? Dr. White? Oh, I'm sorry, Dr. White, how do you vote?
Sorry, Mr. Bryant. Given the fact that the superintendent is now recommending this amended policy, I'll vote yes.
Okay. And because the language of strongly recommend is in there, and that was my request to keep with the strongly recommend, that's what we've kind of advertised, I will vote yes also. So the motion carries 4-1.
And now, Mr. Chairman, the main motion is on the floor to adopt the policy. It's been amended, so this will be a vote now on adopting the policy as amended.
Okay. So do I have a motion to approve?
No, you've already got the motion.
Oh, I mean,
in a second. Just a vote now whether or not to adopt it as
okay.
amended.
All right, so we'll start with Ms. Vanchek. How do you vote?
Yes.
Dr. Kelly, how do you vote?
No.
Okay. Dr. White, how do you vote?
Yes, as recommended by the superintendent.
Okay. And Mr. Destin, how do you vote?
I'll vote yes.
And I'll vote yes. The motion carries 4-1. Okay. And I believe this concludes the meeting. Okay. This meeting is adjourned.
Woo-hoo!
One for the record book.
Thank you to all the staff that stayed. Appreciate y'all.
Except for you have a school board policy that's backing us.
Thank you. You too. That was,
76 total callers.
yep. 6 trombones in the big parade.